both are feeling the pressure. But change is in our hands. From clean air to cool homes. From healthy diets to clean cities. We can design a future that's better for every breath we take, every bite we eat, every single step. Our health is deeply connected to people and the planet. And right now, both are feeling the pressure. But change is in our hands. From clean air to cool homes. From healthy diets to clean cities. We can design a future that's better for everyone. Welcome to the Climate and the Future of Health Conference at the Conduit. Let's build a world that's healthier, fairer, and more resilient together.
Hello everyone, good morning. Hi, good morning, and welcome to the Conduit's Climate and the Future of Health Conference. My name is Matt Farquharson. I am Editor-in-Chief here at the Conduit, and I'll be with you at various points through the day today. It is fantastic to see such a full room first thing on a Monday morning. A couple of basic housekeeping bits. When it comes time for refreshments and lunch, that will be on both the second and third floors, so feel free to take your pick. We also have a special space set aside for those who might want to have meetings with people that they meet today. Meaningful connections are a very important part of what we do here at the Conduit. So there's a spot set aside on the third floor if you'd like to have a meeting with someone you meet with here today. Just head up and speak to a member of the team to book a slot there. But for now, I am delighted to introduce our co-founder and CEO, Paul van Zyl. Thank you.
Good morning. I read this weekend an article in The Economist about snake bites in India. When you're preparing a conference on the climate emergency and public health, you tend to see the link between these two fields in everything you read. At last, I thought, I have found in snakes a public health threat that is uncorrelated with climate change. But the journalists soon set me right. Rain washes snakes out of their holes. More extreme weather, especially flooding, is likely to cause more snake encounters. It's forehead-slappingly obvious that the climate emergency is profoundly impacting public health. From air and water quality to floods and droughts, from infectious vector-borne and zoonotic disease to antimicrobial resistance, from the impact of extreme heat on infant and elderly mortality and crime and mental health to the production of food. We know that those working on improving public health and those transitioning to a more sustainable planet will need to collaborate closely if we are to build more durable solutions. You will hear today from 24 experts and leaders in their fields about the scale of the emergency we are facing and a set of pioneering and exciting solutions. We are in a moment when the threats to planetary and public health have never been greater. But counterintuitively, we're experiencing a backlash against the policies and solutions required to address them. One of the reasons why this populist backlash has been possible is because ordinary people in far too many countries have experienced a stagnant or declining standard of living. And as a result, they don't trust those in power to care for them or understand them or even know the circumstances in which they live. Against this backdrop, we in the climate movement have at times framed our goals in terms that are too distant, too abstract, and too technical. The goal of net zero by 2050 is both anchored in science and is existentially necessary, but if this goal is not pursued in ways that show direct benefits to those who feel marginalized and vulnerable, then the social consensus necessary to support it will fray, and an opportunity will arise for demagogues to discredit the policies required to build a more sustainable planet. In this risk lies an opportunity. The health impacts of climate change are now undeniable and omnipresent. Extreme heat and drought, flooding, dirty air, contaminated water, the spread and lethality of disease are all things that directly impact us, our children, our parents, and our friends. The proximity of this impact on those we love and the communities in which we live gives us an opportunity to authentically frame our solutions for what they are: an effort to robustly address these threats, to ensure our fellow citizens lead lives of dignity, able to fulfill their true potential, and that we take steps now to act as responsible ancestors. And the good news is that with focus and attention, we will be able to access the capital, the technology, the policies, and the mandate that will enable us to make this change. The Conduit is a community of people passionate about positive social change. Last year, 150,000 people walked through the door looking for and working on solutions. This conference is not a once-off talk shop. 6 months ago, we held a conference examining the impact that climate change is having on the insurance industry. Today, a coalition of close to 50 organizations convened by the Conduit is working to raise a £1 billion flood bond to finance wetlands and other forms of natural flood management, to both reduce the catastrophic impact of flooding as well as harness the remarkable climate co-benefits that wetlands generate. In December, we will bring together 50 chief resilience officers from 50 cities across the globe to explore how to build cities better equipped to deal with the impact of climate change. We will be looking for solutions from today to showcase then, in order to accelerate and scale real-world solutions. One of the Conduit's KPIs is to help changemakers make meaningful connections. Please use every opportunity today to meet someone new. Tell them what you do and are doing. Past evidence indicates that remarkable relationships and results will arise. And now some thank yous before we kick off. A huge thank you to Welcome, our founding partner. Welcome has thrown its prestige and brain power behind this topic in ways that will have enduring consequences for decades to come. Thank you also to our supporting partners, to Reckitt and Bupa on behalf of the Sustainable Markets Initiative and the Resilient Cities Network, to Global Witness, and to Julius Baer. Thank you to our scientific partner, the Institut Pasteur, and to our strategic partners, Ashoka, C40 Cities, the Clean Air Fund, Green Alliance, and Forster Communications. And thank you to our media partner, Illuminum. A huge thank you to all of you who've attended and to our speakers and contributors. And thank you, as always, to the fantastic Conduit team, to Perez Kagbala and Jay Kinsella, who make the show run, to Lily Asher and Katya from our program team, to Derek and Meljo from our ops team, to Sierra and Merad and the full Impact Partner team, to Matt, Charlotte, Eddie, James, and to Colin from our editorial and marketing teams, to Gillian and our reception team, and to our production team, Duna and Hess on event management. So now it gives me great pleasure to welcome from the Wellcome Trust, Alan Dangur, Director of Climate and Health. Alan.
Wow, how brilliant. Wonderful to be here. Thank you very much for coming in on a Monday morning. It's superb. A very warm welcome to the Conduit and to this fabulous day dedicated to climate and health solutions. I'm Alan Dangur. I'm the Director of Climate and Health at Wellcome, and I'd like to extend a huge thank you to Paul, the Conduit team, Wellcome colleagues, and our partners, and the exceptional speakers coming up today for making this event happen. We're in for a really, really inspiring day, rooted in our shared endeavour to tackle the biggest challenge of our generation, the climate crisis, and its impact on human health. Now is the time to act, and we are the team to deliver. The people in this room can make a difference, a practical difference, if we unite and work together with common purpose. We know the challenge. Human behavior and activity is driving unprecedented climate change, as well as destroying the very environment we need to survive. The science is very clear. We are living on an increasingly warming planet, driven by greenhouse gas emissions and superpollutants, and our response is far too slow. We're starting to see the consequences at an alarming rate. Extreme weather events, heat waves, the spread of infectious diseases, mental health impacts, water and food security, and conflict. And it's killing us. Every country in the world is now impacted, and it will get worse. And that's the reality. But the good news is we know what to do. We have many of the solutions. We have the science and innovation. And there's even a great deal of public and political support for actions, despite what some people might be telling us. Acting on climate change is good for business, it's good for economy, it's good for our health, and it's the only choice we have to make if we want our children and grandchildren to flourish. So why are we not getting this done? What is stopping us acting at the pace and the scale required? What actions do we need to take to ensure the science and evidence drives financial and political decisions? What are the bridges between people and organizations that we need to build? What work do we need to do to ensure the solutions are credible and deliverable in different nations and have equity at their core? These are just some of the questions we will be asking today. Paul and I agreed that today must be 90% about solutions. Today is about action and implementation and what we will do together when we leave this room and way beyond London Climate Action Week. Given we are in London today, I want to take a moment to reflect on the opportunity we have in the UK. We have world-leading science and institutions in this country, extraordinary innovation and creative industries, and a government and population who care about climate, the environment, and health. Let's seize this moment and use this expertise and creativity to change the world for the better. We must work together, learn from one another, and understand our place in the rapidly changing world around us. It is vital we build coalitions and collaborate with the very best experts and leaders around the world. And on that note, I want to introduce our first guest, and I'm delighted that our first session is going to be a conversation with Dr. Jamila Mahmood. Jamila is an extraordinary human being and the perfect person to open this event. She trained as a doctor in obstetrics and gynecology and has more than 2 decades of experience working in conflict, disaster, and health crises around the world. Jamila was special advisor to the former Prime Minister of Malaysia on public health during the COVID pandemic and holds several key advisory roles, wait for it, on Malaysia's Climate Action Council, the Consultative Council on Foreign Policy, the Economic Advisory Council, and I found out this morning, the Higher Education Council too. So, she's currently Executive Director of the Sunway Centre for Planetary Health in Malaysia, leading exceptional national and international work on climate and health. Please give a warm welcome to Jamila as she takes the stage. Hello.
No pressure.
Slightly intimidated. So let's get to know you a bit more. What was young Jamila like, and what brought you to medicine?
Well, first of all, let me just express how grateful I am to be here. I'm quite intimidated by the number of people in this room. The Jamila you know today is the same Jamila when she was a younger person. I hate being challenged. And when I was in school, someone challenged me because of racial, issues in Malaysia, that people like me would never become doctors. And so I said, okay, I will become one. And that's really what drove me. But also, I think, psychologically, I saw my father die when I was 11 from cancer. And I think deep down, there was a real inherent sort of drive for me to help people who are ill.
Wow. And now you focus your work on climate and health. And as a doctor in obstetrics and gynecology in Malaysia and an expert in humanitarian crisis, what can you tell us about the way climate change particularly affects women's health?
Yeah, I mean, we've heard how climate change affects every aspect of health, from snake bites to infectious diseases, to increase in non-communicable diseases, all sorts of respiratory illnesses and cancer, but also mental health. But climate change is not gender neutral. It really affects women much more than other genders, and in particular, in many, many ways. Let me tell you the story of what impacted me, seeing women walk, post-cyclone in Philippines, just because they couldn't get access to healthcare, almost losing their pregnancies on the way. But the one image that will live with me forever is a woman in Mozambique climbing a mango tree to deliver her baby because of rising floodwaters and crocodiles in the river that had overflown the river. I think that it's beyond the impact of, physical impact of climate change, but also heat, for example, increases the risk of miscarriage, premature birth, and other climate events also lead to stillbirths and other particular consequences, and of course mental health, which most women are caregivers as well, and they take care of families, so the pressures on them will be terrible.
Wow, those are really horrific stories. And I can see then why your focus is so squarely now on climate and health. And you work at the very highest levels in Malaysia, as I mentioned, and with leaders from all around the world. And what have you learned about turning science and health evidence into policy and action, which we're so focused on today?
I think what I've learned working in Malaysia and with leaders globally, as you mentioned, is that science doesn't automatically lead to action. Evidence is essential. It doesn't live in a vacuum. And I think it needs translation, storytelling, trust, but also linking with economics. I think eventually most policymakers and decision makers want to see the money, where it's impacted. I think we owe scientists and researchers a profound debt, including Wellcome Trust. You've helped us understand why not only the scale of the climate and health crisis is so important, but also finding some of the solutions that we need to find together. But, let's be honest. The crisis we face today isn't one of ignorance. It's about inaction. It's about delay, disconnection, and the science is so clear. What's missing is urgency, courage, and political will. And climate change and climate delay has become the new climate denial, in my opinion. So too often, the brilliant science will vanish into a void, ignored, drowned out by distraction, disinformation, and algorithms. And that gap between what we know and what we do widens. It's not just about emissions, it's about imagination, it's about empathy, and it's about power. And we need to shift from just informing people to mobilizing them. That means investing not only in technologies and data, but in how people think, how people feel, and act. So behavior change is the missing link in the climate and health response. So, and let's be clear, fossil fuel companies and plastic industries have already mastered this through decades of manipulation. We must be smarter, we must be bolder and more united, and we need to beat them at their game. So I want to maybe suggest a couple of things. One, we need to break the echo chamber. We need to translate science into language people understand. Let's use media, culture, the arts, influences to make it resonate emotionally. Occupy public space. Speak up, be visible. Bring climate and health urgency into every conversation, not just expert rooms. We need to challenge institutions. We need to demand fossil fuel divestment and meaningful sustainability in our research, education, and funding. Design with people. Center community research and policy design on people, on communities who really understand and have the solutions at hand. Let them co-create the solutions with us. Act across boundaries, geographic, sectoral, institutional, and mobilize together. We have to do that much more. And, turning science into action is not just about evidence, it's about leadership, it's about courage, it's about connection. We don't just need experts, right? We need champions. And I believe many of them are right here in this room. This morning I woke up to read that Shell has been, the case of Shell in Nigeria. So that's a really a wake-up call, I think, beginning for the fossil fuel industries. Last week, just before I came here, I spoke to a group of lawyers and judges who were shocked with the evidence presented to them. They were not aware. So we need to have these conversations with people who are not in the room with us.
Wow, that's a fantastic response. So many things there: urgency, courage, the need for us to be united, the need for leaders. We'll be coming back to leaders in a bit. But I want to frame, so we have a fantastic program today, an extraordinary set of speakers. And the first session is about building resilient health systems. And we have many people in the room who work on healthcare. What do you think we need to do in the next few years to ensure our health systems are resilient to climate change?
I think the first thing I would say is we need our health practitioners to be aware. Only 15% of medical schools around the world teach climate and health. So if the health practitioners, who are probably the most trusted people in the world, nurses and doctors, aren't even aware, how do we expect policymakers to take action? So this is why I take a role in the Higher Education Council, because Malaysia will make it mandatory for all universities to include planetary health and sustainability in all university curricula from 2026. Wow. Yeah, so it's possible, right? But I think resilience in health systems starts with recognizing that we just can't treat illnesses. We need to address the root causes, many of which, as we know in health, the drivers are outside the health system. So I think we've got to design our cities better, grow our food more sustainably, manage our air, care for the environment. And I think that over the next few years, we need to prevent much more proactively on prevention, on primary care, and public health, especially in vulnerable communities, because it is not a balanced response. It is this lower socioeconomic status, people who are more vulnerable. And I think that we need to have to build climate risk directly into how we plan and deliver healthcare. And that is whether that's preparing for heat waves, pollution, or disease outbreaks, or climate-related migration. And that's another issue that we haven't really touched upon enough, because if more than 1 billion people are going to be displaced post-2050, how are health systems going to cope for that? How are countries that they will be migrating to be able to address these challenges? So I think it's huge. And I really want to re-stress the education bit. We need to not just educate a new generation of health practitioners, but everyone, and to recognize that health is central to how we address climate change.
Brilliant. Brilliant, brilliant, brilliant. Okay, this afternoon, we're going to hear from Mary Robinson, the great Mary Robinson, on her reflections on leadership in these very challenging times. We have leaders here today from a wide range of organizations. What's your message about the kind of leadership we need right now?
I like to frame it as the 3 C's that we need. We need courage, we need compassion, and we need to be connected to people and the planet. And I think that it's not enough to manage the crisis. I think we need leaders who are willing to transform the systems causing harm. And I think that means putting planetary health at the center of every decision, recognizing that human health or the health of human civilization is deeply rooted and linked to the natural systems upon which it depends. So in this space, courage looks like this. It's about speaking uncomfortable truth, even when it's politically inconvenient. It means acting at the speed of science and not the pace of politics. It means listening, especially to those on the front lines, especially women, health workers, indigenous people, local communities, young people who are going to inherit this planet that has been damaged by many of us. And we need leadership that just doesn't just promise change, right? It needs to build trust, it needs to drive inclusion, and leads with care. So this isn't just about emissions. I keep repeating this. It's about intergenerational justice, survival, and the kind of world we want to leave behind. And my call to all of us in this room, whether you lead a country, a clinic, a company, an institution, or a community, is this: Step into the discomfort. Be the bridge between knowledge and action. Lead with empathy. And lead like lives depend on it, because they do.
Yeah. I think it's unbelievably your 3 C's: courage, compassion, and be connected. Compassion is the one that really actually gets me viscerally. So I think there's nowhere near enough compassion. And I think you've made that point beautifully. So let's finish on a message of hope. Let's finish on a message of hope. We've got a fantastic day ahead of us. You've challenged the room and all the speakers who are, I hope, trembling in their seats with the challenge you've given them. What are we going to do? What gives you hope, and what solutions do you think we need to focus on this week at London Climate Action Week and over the critical few years ahead?
I'm going to ask all of you in this room to think about what photograph you probably have as a screensaver on your phone. Most likely it's someone you really love. For me, it's my 1-year-old grandson, right? So for me, what gives me hope is the fact this is a packed room, number one, and it's really about people, and particularly young people. I've met such courageous young leaders and health workers and in the communities and front lines, and I think we have the solutions, we have the innovations that are available to us, and clean energy, resilient health systems, work, nature-based solutions, and I think we need to scale them with urgency and equity. Hope isn't passive. It's something we need to exercise. We need to just keep doing it, and we need to believe in it, and we need to just continue and carry that spirit forward. George just said London Climate Action Week, but beyond.
Fantastic. That was a wonderful opportunity to speak with you, Jamila. You're a real hero. I think the whole room is now in love with you. So thank you very much for your time. Thank you very much.
Alan. Thank you. Thanks a lot.
Thank you very much to Alan and Jamila for that fascinating talk. I think there's one line that really resonated there, the idea that science doesn't automatically lead to action. And hopefully what we'll be able to leave with at the end of the day today, certainly the intention, is some ideas about what actions can be taken. But first, our first panel of the day today looks at the big picture of how our health systems can respond to the challenges of climate change. And so please welcome to the stage our panel on climate resilient health systems, moderated by Sophie O'Connell, Senior Policy Advisor at Green Alliance.
So that was a pretty tough act to follow, I think. But our panel will do a brilliant job. Just bear with us one moment while we're all getting settled. So I'm Sophie, Senior Policy Advisor at Green Alliance. I've been there for 3.5, coming up to 4 years now, and led our climate and health programme last year, where we had funding from the Wellcome Trust to do 2 pieces of research. Looking at adapting to extreme heat in UK cities, and also the mental health challenges around extreme weather in the UK. So that's a bit about my background. But I'm personally very passionate about the environment because of the disproportionate impact that it has on certain communities, and especially the health injustices that we see. It's kind of such a stark example of the impacts of climate change. So this panel is named Building Climate Resilience Health Systems. So we're going to explore what we are seeing now and how that threatens current health systems across the world, and what the costs are of carrying on as we are, and the current status quo. So obviously we're seeing much more frequent periods of extreme heat and higher temperatures, droughts, more flooding, extreme storms. And this has an uneven burden on our climate-related health systems, particularly on those that are marginalised within society already, poorer nations and regions, and those with existing mental and physical health conditions. So our panel is going to explore what this means for health systems, I guess looking at the public health impacts, but also financial costs of inaction. And I loved what was said in the previous discussion, that hope isn't passive, we have to act. So hopefully we'll dig into some of that today. Obviously we're needing a big shift, kind of, as well as mitigating climate change, towards adaptation and resilience. And another thing that was picked up in the previous discussion was the focus on prevention. So if we're stopping people getting sick in the first place, then they'll be more resilient. And I guess a lot of that comes down to tackling poverty, which is such a big key determinant of health. Also goes without saying that we're in a more unstable world geopolitically, and that has really impacted the global funding crisis, particularly UK philanthropy, and the environment for climate work has shifted in the last year or so. So taking that into account, this session is about finding grounded and practical responses and what it takes to build true resilient health systems. So we're going to explore system-level insights and examples, policy and regulatory responses, and also innovation and infrastructure across different geographies. So yeah, we've got a brilliant panel of experts today. Just to introduce, we've got Hidden Patel, Head of Strategy at Greener NHS, which is an initiative to decarbonise the NHS in England. He also developed and co-authored the world's first net zero healthcare strategy. Then we've got Glyn Richards, Bupa's Group Director of Sustainability and member of Bupa's Strategic Development Forum. Saul Johnson, partner in charge of health practice at Genesis Analytics, with over 30 years of experience in healthcare in Africa, also a qualified doctor and degree in epidemiology. Gary White, who is our CEO and co-founder of Water.org, Water Equity and Water Connect. They have worked to develop sustainable, scalable solutions that have empowered millions of people with lasting access to water and sanitation. And then we also have Laura Clark, who is our CEO of Client Earth. She joined in 2022 after 2 decades in public policy and diplomatic roles across Africa, Asia and Europe, and is our expert on litigation and regulation for environmental issues. So we're going to start with some opening questions first to Hidden and Glyn. In terms of what we're already seeing, how would that compromise the future health systems across the world?
Shall I go first? So, hello everyone. So for those who don't know, Bupa is an international healthcare company. We service or look after about 60 million people globally. But we also have 50,000 clinicians within our workforce and within the hospitals that we operate. And so, and actually, it's already been talked about very coherently, but we see massive shifts in terms of heat-related diseases, non-communicable diseases, also vector-borne diseases. And, these are sort of inextricably linked to climate shifts, particularly things like sort of heat, flooding, surface water, all that kind of challenge. I think, and what's interesting for us is that, whereas if you went back maybe 10 years, you'd probably see that in certain locations, we now see that everywhere, across all of our markets. And this is becoming a real kind of challenge. So it fundamentally challenges the business model. We'll come on to the things around costs and the opportunities that sit within that. But so we've been doing some research across some of our markets, and the more recent study that we've published is actually from Chile, and where we worked with the public health sector, leveraging our own data, leveraging the data of the public health system, and working with a very well-known university out there. But really, the opportunity to identify this correlation and this linkage between particularly heat and some of the damaging health conditions that we are facing across that health system. And actually that's been sort of fairly groundbreaking in that market, and it's enabled us to sort of use that, and the government to use that to start to inform guidance, particularly for people like outdoor workers and the like. But I think the challenge is, it's been talked about, this is just going to get worse. So this is a fundamental challenge. This is not like it's going to get worse and then stop. This will just progressively get worse and worse and worse. And we do see that across our business. And that fundamentally challenges the way that we deliver care. So whilst we are taking action to reduce carbon emissions, We're sort of championing more sustainable healthcare practices, trying to reduce waste. It is incredibly clear to us that health is outside of hospitals. Health is fundamentally driven by where you live, where you grow up, where you work, the way you interact with your local environment. And so we're starting to take some action through a number of different fora to try and shift that conversation, to shift that dialogue. And it's nice to see a couple of people around the room that we've worked with as well.
Great, thanks.
Yeah, to add to that, I would say that in England at least, there's been significant challenges already from kind of climate change. I think in 2022, which I think was the hottest summer on record at the time, I think nearly 3,000 people lost their lives with heat-associated deaths. Across the globe, wildfires exacerbate respiratory issues. And then, even here, there's 36,000 deaths just in England that are attributable to poor air pollution. So this is an increasingly challenging environment for us. But added to that, there are the challenges of actually operating a healthcare system, hospitals, flooding, actually getting staff or patients to and from healthcare facilities. These are challenges that are here today, and we're looking to address them. I think that's why it's important that we are already taking action. But then I guess the other thing that's kind of rising is, I think Glyn just mentioned it, around vector-borne diseases. That is going to be a real challenge for us, and many other countries, especially in Western Europe, where we're not really set out to kind of deal with those challenges on a day-to-day basis. There are already kind of mosquitoes in southern parts of Europe that are carrying things like, or in other parts of the world, carry things like dengue. They have also, unfortunately, been spotted in the southern England. So this is a challenge that's going to keep coming, and it is probably going to get worse. So we do need to take action. I think it's important that we are.
Great, thanks. We will go on to a more hopeful picture later on in the panel, I think. But kind of sticking with this theme, Laura, Sol and Gary, what are the real costs in terms of social, financial and ethical of maintaining the current status quo? Do you want to take it down the line?
Can I go first?
Go ahead.
What are the real costs? Well, I mean, there's a real human rights cost, isn't there? But I mean, there's others have already mentioned the inequity of the outcomes, the impact of the most vulnerable people, normally those that, of course, had the least responsibility for these crises that bear the brunt, whether that's climate vulnerable communities in the South Pacific or it's poor communities in the developed world. So that's a huge issue. There's also the intergenerational inequity as well that we're facing. And I think the way Client Earth thinks about this is how can we mobilize human rights framing to drive the change that we need, because human rights is well established already as a good way of testing whether government action is compatible with human health and human well-being. And I think that's really the framing in which we need to think about the action needed. So we think there's going to be a lot more. We know there's going to be a lot more litigation on this front, really trying to reinforce the UN General Assembly recognized the fundamental right to a clean and healthy environment, but that needs to be backed up with proper frameworks at the national level. And one of the ways that we do that, one of the ways we close the gap between science and action is about litigation to focus minds. What is a government's responsibility under human rights to create the right sort of framework, have a proper health adaptation plan under a nationally determined contribution, under a national adaptation plan. And that's going to be key, as well, of course, class actions based on attribution science, damages claims against corporates under the polluter pays principle.
Great, thanks. Yeah, the NDCs and adaptation plans, it's just completely missing nearly entirely across the world, isn't it?
Yeah.
Gary, do you want to go next?
Yeah. I think that when we look at the climate crisis at one level, it's really a water crisis, and that is with climate change, lack of water resources in some areas, too much water flooding in other areas, and the impact that has on the water and sanitation infrastructure. And that's key to health. Recently, I was walking around central London, and I came across the Broad Street pump, which was a hand pump from back in 1854. Where John Snow used that pump to help demonstrate that it was the drinking water contaminated by human sewage that was causing the cholera outbreak. And that was a seminal moment in helping the world understand that we needed to invest in sanitation infrastructure and water infrastructure. you look at today, 170 years later, and we still have 3.5 billion people around the world who don't have access to sanitation. We've known for that long that this is the most basic building block for improved health, and yet we're still missing it. 1 million people dying every year because of lack of sanitation. And I think that's key to the global health crisis with regard not just to climate change, but broadly. And I think it's interesting, this quote, "Sanitation is the single greatest human achievement with regard to health, yet much of the world is still underappreciating it and it's still inaccessible." That was a quote from the Lancet Medical Journal. The medical journal saying sanitation was the single greatest thing. And so I think that can kind of ground us, because what we see at water.org and Water Equity is helping people get access to climate resilient water and sanitation services. And for us, the action we're taking today is, instead of waiting for government, we're working in collaboration with government. We're helping people get access to small, affordable loans so that they can get the sanitation and water improvements that are best for them. And this is key to bringing in impact investing. So we've also created an asset manager that raises debt and equity capital in the US and Europe, helping investors get a financial return, while we create kind of the financial plumbing that can connect that capital to women making a few dollars a day so that they can get a loan to make their well deeper so it's more climate resilient, build a latrine that's more climate resilient. They take these loans. We've developed a network of about 200 financial partners around the world who we provide technical assistance to, some capital to kind of de-risk, and they make these loans. So now 70 million people, actually closer to 80 million people now, have gotten access to water and sanitation that they value the most, because they're making the decisions, because they have the financial resources to solve their own water and sanitation crisis. These loans are repaid at a rate of 98%. And if we had stuck with our original approach of water.org, I started this back in 1990, where we were just drilling wells in a charity-led approach, it would have taken us 600 years to reach those 80 million people. Now we're reaching more than 1 million people every 6 weeks. And so this is kind of a real life solution from the bottom up, trying to bring the financial resources that people who are living this crisis now with respect to resilience, so that they have the solutions that they can take up and make their lives better, more climate resilient.
Yeah, so about bringing those people in to the solutions.
Mm-hmm.
So.
Yeah, the cost of inaction is huge if we do nothing. And I don't know if everybody appreciates that in the last 25 years, we have halved the child mortality rate around the world. That's a huge achievement. Still, millions of children do die, but the progress has been enormous. But we're at a moment where that progress is so fragile. It's fragile because of what's been happening globally, with funding cuts, and it's fragile because of the impact of climate change. Child mortality is a fantastic indicator because it talks to the ability of health systems for pregnancies to be safe, for childbirth to be safe, for children to get access to medical treatment, vaccines that they need. And just reflecting what Dr. Jamila said a bit earlier, these things are under risk. That's something that's happening now, and it's something that increasingly is going to happen. And we have to start planning for that, because if we don't plan for that, we're going to see a huge reversal in the gains that we've made on all of these important public health indicators. So I can only echo what was said this morning. Now is the time for very courageous leadership.
Great. And just back to the NHS for context. So, Hitam, what is, obviously the NHS is such a vital public health service, but it is also a major emitter in the UK. So what does a credible pathway to net zero look like for the NHS?
Well, I think it's worth taking a step back and thinking about, just the size of the NHS. We employ around 1.4 million people. We have over 1,000 hospitals. As Sophie just mentioned, we are a large emitter. We're responsible for about 4 to 5% of the country's emissions and about 30 to 40% of public sector emissions. But speaking on a kind of more practical level, We have the second biggest fleet in the country, second to only Royal Mail with 20,000 vehicles, which is phenomenal. Our energy bill has doubled since 2019. It's now around £1.4 billion. We're one of the public sector's biggest energy users. We have really significant challenges, and that's part of the reason that when we developed our net zero strategy in 2020, this is exactly why we did it. We knew that there was action to take. We knew we had a significant impact. On a kind of more practical level, and how does it look? Trafford General Hospital, I don't know if many people know about this, but it's in Manchester. It was the first hospital that was said to be part of the NHS over 70 years ago. Nye Bevan went up and they ceremoniously handed him the keys to kind of signify the start of the NHS. That hospital in Manchester it's very old. It's over 70 years old. I can't remember exactly how old it is. It kind of represents the kind of very beautiful hospitals that we have, an old kind of stock of buildings that we have, but it's currently going through a transformation to become one of the greenest kind of energy efficient hospitals in the country, and that is fantastic, but it's going to take time, it's going to take effort. But we have, over the kind of last 5 years or so, we've invested around £1.4 billion into kind of making some of that change happen. On a kind of, on the other side of things, I read over the weekend that the London School of Hygiene and Tropical Medicine are estimating around 600 people might lose their lives of the heat wave that we've just had, which is pretty significant. So there are other things that we have to do. I guess we have taken kind of significant action on things like desflurane, which is an anesthetic gas, for those of you that don't know, which is more carbon intensive, I guess, than other alternatives. So we worked with anaesthetists up and down the country to kind of phase that out, and we've kind of made significant success. In and around London, we have electric ambulances kind of taking patients to and from hospitals, meeting patients. To be honest, 5 years ago, that having an electric double-crewed ambulance seemed like an impossibility. I'll be completely honest. But now it's operating, and kind of looking forward, in March we announced a kind of partnership with Great British Energy, which will see about £100 million invested in solar over the course of the next 12 months. We're going to triple the NHS's solar generation in the course of 12 months, which is phenomenal. There's much more that we need to do. I'm not going to sit here and say that we have all of the answers, but we are kind of going in the right direction.
Yeah, that sounds good. And Glyn, when we talk about reimagining healthcare, obviously you mentioned a lot of the current threats, but what does it actually mean to reimagine healthcare in practice?
So I think Dr. Jamila said it very, very beautifully actually earlier, which is it's about prevention and it's about resilience. And so we've kind of focused our attention on those two kind of drivers really. So we've taken a lot of action in terms of reducing the energy burden on or rather the sort of non-renewable energy burden across our portfolio, so shifted from 54% to 94% renewable energy across 2,500 properties globally. But when we think about prevention, it's really about sort of looking at the determinants of health. So for us, it's getting out in front of ill health and figuring out kind of what are the levers we want to pull to sort of improve that. What we've tried to do is we've launched a program called My Genomic Health, which is in the UK and Spain, and sequenced about 14,000 of our customers' genome. And the idea is to tailor preventative and predictive medicine for those people. So identify where the risks are, the likelihood of those risks as they move through their sort of life, and start to tackle that up front. And that's been hugely successful. We've also, for example, the modelling that we've done in-house would suggest that preventing early-stage breast cancer can save thousands of kilograms of CO2 per patient, which is an incredible footprint when you think about the scope of healthcare's scope 1, 2, and 3 footprint. I think it's also about encouraging, and again, just Dr. Jamila, in fact, Dr. Jamila said everything I need to say, but I think it's about behavior change and how do you encourage people to take agency for their health and understand the drivers of their health and the impact of their environments, whether it's work or at home, on their health, and to take preventative action themselves. And I think a lot of our new products and services, which are not insurance, are geared around giving people that ability to understand their health and to take more action. And they're also cheaper products because they're not fundamentally underwriting. And so that means we have a broader demographic of customer who can access that preventative intervention. The resilience piece is recognizing that whilst we can take action in our footprint and reduce emissions, we fundamentally need to think about how do we drive resilience in the urban environment? 50% of people live in urban environments. That'll increase to 70% by 2050 or thereabouts. Unsurprisingly, most of our customers sit in urban environments as well, so we see a huge amount of overlap between those sets of demographics. And we're working with the Resilient Cities network as part of the Sustainable Markets Initiative to think about what are the opportunities for us to take preventative action in what is currently 25 cities in, I think it's 12 countries, 22 cities across 15 countries, to think about what are the actual tangible impacts that those cities can take to drive better health outcomes. So it comes back to what is the health component, and where is the health thinking when you start to think about sort of city interventions and design and usability and transport and so on and so forth. So in many ways, I mean, Dr. Jamila said everything I need to say.
Yeah, and just to build on that, so particularly for younger and growing health systems, what does building resilience actually mean, especially where resources are highly stretched?
Yeah, which is, Sophie, exactly the moment we're in at the moment. I think the one thing that's very important, and I've spent probably over 20 years working in infectious diseases in Africa, particularly around HIV. It took us a while when we were supporting the HIV response to realize that we had to help countries develop individualized responses, that there isn't a one-size-fits-all, which is easy and comforting, but wrong, because then people do lots of things that are not cost-effective. And resources are tight. We need to help countries work out what is the most cost-effective intervention for their particular situation. So Bangladesh and Kenya, for example, two vulnerable countries, but face very different threats from climate change, dry heats and droughts in Kenya versus flooding in Bangladesh. So we need to work out, help countries work out what's going to happen in their country, what's likely to happen with modeling, with data, and then work out what is the most cost-effective interventions, and then take a health systems approach. We need to think about supply chains. How do we secure supply chains? How do we secure service delivery so that we don't have women needing to deliver in a tree? That whatever happens, services will be available. How do we make sure that we design services that can accommodate what is likely to happen? Because we can't ignore this. It is happening, and it's likely to get worse. So I think, working on those national adaptation plans with clear tools, clear guidance, I think is going to be critical over the next 2 to 3 years.
Great, thank you. And Gary, you've spoken a lot about kind of the finance and infrastructure in terms of driving that real change. So how do we ensure that those kinds of interventions are reaching the people that really need them?
Well, it's a huge challenge, and the baseline isn't good. If you look around the developing world, 2/3 of healthcare facilities don't have access to water and soap, right? So nothing more basic than that. If you look at the scale of the problem about finance, trying to blend finance and innovation together, this is a $1.5 trillion problem to solve, just to get the world to be able to catch up with where we are with regard to safe sanitation and water. The coping costs associated with this lack of infrastructure is about $300 billion a year. That's healthcare costs, that's the disease burden, that's loss of life, that's women spending hours walking to collect water because they don't have access to water near their homes, girls missing school, not having that future education. All of these coping costs actually speak to the problem kind of containing its own solution. If you can just kind of rearrange all the ways the capital are flowing through this very inefficient system and redirect it to something that gives people access to affordable loans and to financing, that's the innovation. And so we knew that there was never going to be enough charity in the world to get $1.5 trillion to solve this problem. So we innovated our way out of it. We said, what if you could get an access to a small loan for a woman, and so she didn't have to walk hours. She could then monetize that time and then repay the loan, right? So we turned the problem around and said, what if the people who are facing the problem really are their own solution? It's just a matter of, like I said before, creating the financial plumbing that can connect her to the capital markets so that investors can get a reasonable financial return while we help through our network of financial partners get her a reasonably priced loan so that she can solve her own problem. And I think that's the key to this. You have to find the unexpected solutions in some of these problems and look at the problem in a little bit different way and say, what if you could do this in a different way? Could this unleash the potential from the bottom up to allow people to fully participate in their own solutions? And that's what we've done with, it seemed kind of crazy at the time that we as a water NGO were going to start an asset manager, and yet we did it. We went out, we created an asset manager, we're now registered with the SEC. We've raised nearly $500 million in committed capital to attack this problem, again, while targeting financial returns that are competitive to the market. So once you can bring the capital markets into some of these problems, that capital is theoretically infinite. It's just a matter of putting the pieces together in the right way that you can do that.
Great. And from a community and more grassroots perspective to a legal and policy, Laura, I'm going to come to you. What are the types of frameworks that can help ensure that human rights are central to real healthcare transitions around resilience?
Yeah, it's a great question. It's worth zooming out and thinking about what's developing in terms of the international legal picture right now. So I mentioned earlier that the UN General Assembly recognized the fundamental right to a clean and healthy environment. Of course, that's aspirational. We had the European Court of Human Rights last year in the Klima Seniorinnen case, so the senior Swiss women, confirmed that states have a climate adaptation obligation under human rights law, but that needs to be clarified further. This week, we're going to hear from the Inter-American Court of Human Rights, who have been asked for an advisory opinion on states' obligations to tackle climate change under human rights law. So there's a very evolving picture in terms of this authority, the international legal authority on the issues. What does that mean then at the national level? Well, a couple of things. There aren't not nearly enough countries have got climate adaptation and resilience provisions. No European state currently has a clear heat adaptation framework, for example, and we really need to see governments, as I mentioned, adopt health action plans as part of their nationally determined contribution, so under their national adaptation plan. So that needs to be based on human rights, the precautionary principle, and the prevention of health harms. Now, all of this is, and as I mentioned also, we need to litigate further to clarify exactly what is a state's obligation under human rights law, and how can we establish that that is non-derogable. The issue, of course, then is, well, you say there are all these positive obligations on states under human rights law to tackle these things. Where's the money coming from? Now, you've talked about redirecting capital flows. There's also a lot to be done on public money. So we have, there are various studies, but one I saw just the other day says that $2.6 trillion goes annually into environmentally harmful subsidies. So that's fossil fuels, it's unsustainable agriculture, it's pesticides, all these things. A redirection of those subsidies, imagine what you could do in terms of heat adaptation frameworks, health systems, access to water, and so on. So, for me, it's about, how do we really establish much more clearly a state's obligation to tackle these things under human rights law, with a little bit of litigation to nudge things along the way, and how do we get the money flowing in the right direction?
Great. And just to stick with you and kind of dig into this a little bit more, are we seeing enough progress on embedding climate resilience into regulation? And I'd be really interested in your take on how regulation and litigation can promote policy continuity in a political kind of unstable world.
Yeah. So what was the first bit?
Sorry. Are we making progress on embedding climate resilience into regulations?
No, not enough. Absolutely not enough. And it's, you know, it is the poor relative, I think. So we absolutely have to see. And at Client Earth, we've got a very big push on how national climate laws can close the gap between these international commitments made at the international level and real world action. So a really good climate law covers these things. It provides that framework, but there's a lot more. There's a lot further to go. And then the second bit of your question, I'm not very good with two-part questions.
Okay. Sorry, that was a bit mean of me. Thinking about a more politically unstable world, or you know, potentially a very different looking government coming in the UK.
Yeah, and that's of course the strength of, like the UK Climate Change Act, where you have that independent architecture of a climate change committee, that it takes it out of the politics. You set these long-term carbon budgets. It's beyond the short-term, you know, what's the next election, you know, what are the costs, and it really, you know, provides that long-term ability to plan and think about next generations. It's still hard, though. You know, our politics and our financial economic models all drive us towards short-term thinking, and that makes it much harder to do the intergenerational thinking about what's best for the environment, but what's best for future generations, to avoid, you know, where we started this meeting, the catastrophe of not getting this in order, the migration, the human rights impacts, the conflict, and so on.
Great, thanks. And just thinking about the politics, Hiten, I'm going to come back to you about the NHS. Obviously, there's been a lot of kind of reforms from this current government on how the NHS should work. So it'd be great if we could dig into what's the most effective kind of shift, I guess, that you've seen from care coming to community and more local levels, and also digital services being brought in, and what can other health systems kind of learn from those recent changes?
Sure. On your last point, I'll probably start there because I think it's a useful place to start to kind of couch where we are at, which is there's a lot that we can learn from other countries as well as they can learn from us. You know, I mentioned earlier that we were the first to kind of set a kind of net zero strategy out. There's now around 95 countries that or health systems that have done so. The World Health Assembly, I think last month, a kind of global action plan on climate change was adopted. So there is going to be more growth. So we'll be able to learn a lot from other countries. When we come to kind of the kind of community and kind of digital enablement, I think we have seen a real transformation when it comes to kind of digitally enabled care, basically since the pandemic. You know, there's been a significant rollout of kind of virtual outpatient appointments, as well as kind of general practice appointments. The NHS app, you know, you can now rebook an appointment. You don't need to kind of call up to book an appointment. There's paper that's saved. You can get repeat prescriptions. You can see your test results. There's a range of things that has kind of enabled and has changed the way in which we kind of deliver healthcare in this country. And then there have been kind of more specific interventions, things like the virtual wards initiative, which, you know, there was 0 virtual wards before the pandemic started. Now I think there's about 12,000 beds. So there's been kind of lots of significant kind of progress, and maybe the NHS app to kind of bring it into reality, like the kind of repeat appointments or booking outpatient appointments has saved, I think, 63 million pieces of paper since it's kind of launched, and over 150 million minutes of, I think that was the last I heard, I'm sure it's more now, millions of staff time. That's staff that can be going and doing other things. They can be more productive. We're saving money, and we're also being more efficient. In terms of the future and where we go to, you know, there's been lots of interventions over the last few years around social prescribing. The kind of forthcoming government's 10-year health plan will set out a kind of big shift when it comes to kind of digital to analog, from kind of sickness to prevention, and you know, and also from hospital to community. These are all positive things. Hopefully, you know, close to home, people, you know, don't have to travel so far to get to those places, and also all can get there, you know, different modes of transport. So these are positive changes that are beginning to take place.
Well, it sounds great, but yeah, lots to learn from elsewhere. I think we might have a mic going around. Would anyone like to ask a question from the audience? Do we have a mic? I think we've got time for 2 questions. So this lady in the orange top and this lady over here following. So we'll take both, and then we'll come to you. Just over here, sorry. On the second row here. Yeah, do you want to kick off?
Perfect. My name is Belinda, and I've spent my life in global health. I'm just curious to know, what do you think is the role of the private sector beyond CSR, philanthropy? How can the private sector really help in the climate health nexus?
Sounds like it's...
I can definitely take that to start with, but we very closely work with the private sector. So what we see is Reckitt, for instance, is a big supporter of us both philanthropically as well from an investment perspective. Ecolab, Starbucks, Microsoft, they all are actually donating, and really it's philanthropy that sets all this in motion in order to get to the impact investing. So we have to raise philanthropic capital to kind of do the technical assistance and make this work. The corporates will provide that type of capital to help us expand the model, and then they'll also use their balance sheets to invest in the funds. And so those two things are key to the model. They see for every dollar of philanthropy, we're able to leverage $20 from the capital markets to come in and solve the problem. So very much from a business-oriented case, we can make that very strongly, matching that kind of blended capital of philanthropy with the impact investing. It helps them meet some of their water goals around the planet and putting more water back into the watersheds where they have operations. And this becomes increasingly important as we look at AI and data centers and making sure that as those come online, it doesn't rob the local populations from access to water.
Yeah.
I would build on that. I think private sector innovation, I think that isn't to say innovation doesn't exist in the public sector, the third sector, or indeed in civil society. I think innovation in service of financial return, and one of the beauties is, again, I mean, I'm omitted to mention Reckitt's involvement in the Sustainable Markets Initiative. They've been a strong partner of Bupa's in terms of how we show up in terms of driving innovation across and resilience across the sort of urban environment. I think for us, it's about how you mobilize that capital beyond just philanthropy. Because philanthropic endeavors are important, but they don't kind of get you to the place where you're driving systems change, in my mind. So the opportunity to demonstrate that actually as a private sector organization, you can derive a return by making the right shift for the planet, for health, and for communities, I think is the critical piece. And I would like to think that Bupa is in that space, and there are a lot of companies who are. So the Sustainable Markets Initiative is a great organization or collection of companies that are doing it, but there are plenty of others as well. And I think the critical component, though, is the need to work across sectors. So it's no good a cluster of private sector guys getting together and doing something for their own good. It doesn't, and you know this already, it doesn't sort of adequately account for community requirements, community needs, the voice of the community, but also the public sector, the opportunity between public sector, private sector, and civil society to collaborate in a way that services everybody's needs is the kind of the secret sauce in some ways. And I would say but driving that through innovation is the pathway.
Great. And just this final question from the audience.
Yeah, thank you. I actually have a question for every single speaker, but I will pick one.
Well, we've only got 2 minutes.
Yeah, I'll pick one. So, Ms. Clark, thank you for bringing in this conversation from the legal side of this work. Earlier, Dr. Jamila Mahmood had mentioned, she's spoken to judges and lawyers, and they had this big knowledge gap. So I'm curious, from your work, what resources or tools has your organization been able to use to kind of bridge that gap and build that capacity to understand this intersection?
Yeah, it's a great question. Thank you. We've spent, we talk a lot about litigation, but a huge part of what we do is building the field and building the capability in the legal sector to understand environmental law, understand climate and its impact. So we've done a lot of training judges, lawyers, prosecutors, particularly in Asia, starting in China, now working across Asia. That's critically important because it's not enough to have the right laws in place. You have to have judges who really, really understand the issues and the impacts from a human rights perspective, from an environmental perspective, and so on. So that's really, really, really key. It's what we call building the field and making sure that you've got that widespread understanding. And the only other thing I'd just say while I'm speaking is, we would like to see, and this is not my area, but, but doctors, medical advisors, medical authorities being much more deliberate about how they record climate-related illnesses, injuries, impacts, deaths. I'm not sure we're yet as sophisticated as we should be in that, because that's then also going to be really helpful in informing policy, informing legal cases, and of course increasing awareness so that we can get from, we need to get from science to action. Yeah, thank you.
Great, thanks. And so I'm going to give you the final word, if that's okay. So what does success look like if we're thinking 10 years from now?
Sure,
in 30 seconds, please.
Yeah, that's a tough question, Sophie. I think success means that we continue the trajectory of improving public health, and we don't go backwards. I'd be very happy at this stage if we were able to continue to build on the success that we've had. So fewer children dying, fewer mothers dying in childbirth, to continue to control infectious diseases. People have access to vaccines. That's the success that I think that trajectory that we used to, we want to continue with that trajectory. But in order to do that, we need to take pretty urgent action to make sure that we are strengthening the systems that deliver all of those advances. And it's going to need a lot of innovative financing. It's going to need the laws and regulations. It really is a cross-sectoral, multi-sectoral initiative with huge leadership and courage.
Great, thanks. So yeah, we've heard there's been some progress, but obviously a long way to go. So we'll wrap up there, and I'm sure we'll dive into more throughout the day. Thanks very much.
Thank you very much to our panel for that insightful conversation. We're now about to move on to our next session, which will look at some of the biggest challenges that our health systems face in the form of new and ever-evolving diseases. So please, if you could welcome to the stage, if we could have a little hush for our next panel, that would be great. If we could welcome to the stage our panel on fighting infectious diseases, moderated by the Conduit's Charlotte Kilpatrick. We're going to have a science opener, a bit of a presentation from Philippe Bestin of the Institut Pasteur.
I'll just stand at the
end. Yeah.
Oh, sorry, John. Okay, thank you. Well, welcome. So in this brief presentation, I will try to give you an overview of on the impact of climate change on vector-borne diseases, and especially what we are doing at the Institut Pasteur to face them. So a vector-borne disease is considered when the pathogen is transmitted by the bite of a vector. It can be a mosquito, a tick, or a fly. This is the case of dengue and malaria, for example, but also of Zika, chikungunya, plague, or Lyme disease. It is estimated that 80% of the world population is exposed to at least one of these diseases, and altogether they are responsible for 1 million deaths every year. Unfortunately, these numbers are likely to increase because of climate change, and all the models agree to say that the impact will be very severe. And there are several reasons for that. The first one is global warming, of course, meaning that vectors can access areas they wouldn't access before, like in Europe, for example. The second thing is the deforestation. not only it increases the contact between humans and wildlife, but also if wild animals disappear, the vectors that were used to feed on them will feed on us. The third thing is us. We are always on the move. The airports in London and Paris are hosting more than 100 million passengers a year. This is huge. And that means that if some of these people come from endemic area, they carry pathogens, and if mosquitoes are present around, they can initiate a local cycle of transmission. That's exactly what we are witnessing now in Europe. And the fourth point is the vectors themselves. They are getting used to us, so their attitude is somehow copying what we are doing. So the typical example of this is the famous, or rather the infamous tiger mosquito, Aedes albopictus. So this one was introduced in Europe in the late 70s, and it is known for transmitting viruses causing Zika, chikungunya, or dengue. For 20 years, it remained confined to Italy, but now the picture is very different. So we see that the vector has colonized all Southern and Central Europe and getting to unlikely places like Belgium, the Netherlands, Scandinavia, and now the south of the UK, including London. So that means that we need to react, and I'll say a few words about what we are doing here at the Institut Pasteur in Paris and with our partners. So we are a private foundation that is dedicated to biomedical research, and we employ more than 3,000 people coming from all over the world. We have 140 research groups working mostly on infectious diseases, but also on other things like cancer biology, like stem cells, neurogenesis, or cell biology, to cite just a few. We rely on a core of facilities because you need very advanced equipment to deal with genomics, imaging, chemistry, etc. So what you see on that slide, this is too small to be read here, but this is the 25 diseases that WHO has listed as vector-borne. What you see in blue is the number of research groups at Pasteur working on these diseases, and orange are the ones that are planning to work on them. And so you will see that we cover all of them at different levels. So we do experimental work. So we breed, for example, mosquitoes or ticks or flies at the institute, and we monitor how they transmit the pathogens. We also work at the level of epidemiology, so to monitor the evolution of these diseases and to anticipate possible outbreaks. And finally, we have clinical studies where we have different cohorts in different regions. Of course, we are not working alone. We have a network of Institut Pasteur, or Pasteur institutes, that are found on all continents, and this allows us to deal with possible outbreaks everywhere in the world. In addition, we have partners with research institutions, with universities, and actually the UK is our second partner in terms of number. Just to give you a flavor of the things we are currently developing, we are putting a lot of emphasis on vector biology because the peculiarity of these diseases is the transmission is taking place almost exclusively by the bite of the vector. So if we can control the vector, we can restrict propagation. Another thing that we do, we have a medical center where people, before traveling to endemic area, get vaccinated or get prophylaxis. And thanks to that, we can monitor these people, these travelers, before, during, and after their trip. So this is like a really powerful surveillance network. But this is not enough, so we decided a few years ago, to build a new research center on the campus that is fully dedicated to research on vector-borne diseases. And you will quickly understand that working with mosquitoes or ticks is very different compared to working with cells or pathogens in culture. And so the aim is to produce an environment that is fully suitable to monitor the full life cycle of the pathogens, and so to be in the actual, closer to the normal conditions. So this will open in less than 3 years' time now. So the idea is to combine our three main assets. First, our expertise in vector-borne diseases. So the Institut Pasteur worked on these since its creation in the late 19th century, and currently we have more than 40 research groups studying vector-borne diseases. As I mentioned, so we'll have the right infrastructure to work in there. And the third point is to have the appropriate technology. State-of-the-art technology is required to make major discoveries. So from this, you will understand that the center will be interdisciplinary, very integrative, and the aim is to have a holistic view of vector-borne diseases in the current changing climate. This will be open to our partners, national and international partners, and the aim is to make discoveries at every level and to be able to translate these, to anticipate and to react against vector-borne diseases. So I will finish there, and I'll be happy to answer your questions.
All right, thank you very much, Philippe. That was very interesting. I'm going to introduce our other speakers today. So I have Samia Saad, Senior Advisor to the CEO and Strategic Lead for Climate and Health with CEPI. Ellen Tahone, who will be joining us virtually. Hello, Ellen. From the Netherlands, she is a lawyer and public health advocate with Medicines Law and Policy. Then I have Damien Unn, Executive Director of Next Generation Research at Julius Baer, and Anthony McDonald, Policy Fellow at the Center for Global Development. So Samia, I'm going to start with you and then go right to Damien. So first question, with the outbreak of COVID now 5 years behind us, what would you say is the biggest threat in infectious diseases, and how are we preparing for it?
The biggest threat is that people have forgotten about the pandemic and think that we've got all the tools that we need. So that from a political will perspective is a challenge. And I think we've had a series in the last 5 years since the COVID-19 outbreak of polycrisis. So we have the cost of living crisis, the energy crisis, wars in the Middle East, in Ukraine, etc. And of course, the climate emergency which persists, and the nexus of climate change and shifts in precipitation, temperature, and increased outbreaks. So in fact, 60% of pathogens, so with viruses, bacteria, fungi, and parasites, are actually exacerbated by climate change. And as Philippe highlighted, there's shifts in where especially vector-borne or waterborne diseases are happening, because some places are becoming much hotter. Actually, it's nuanced. So some tropical areas are becoming too hot for mosquitoes. Yet in Paris, what was the Olympic Committee last year most worried about from a health and safety perspective? It was dengue fever outbreaks. So I think the biggest challenge is we need to make sure to policymakers that we make the case that we are trying to make sure we're targeting climate and health resilience at the same time, and that is a cost-effective intervention. And I can give some examples in a minute on what CEPI and who CEPI is to sort of try to tackle some of these issues.
Great, thank you. Damien, I'm going to ask you the same question, and something that Damien said when we had our pre-call to brief for this, is that a Swiss private bank is interested in antimicrobial resistance, and I really want you to go into that.
Okay, first of all, I'm a research analyst at Bank Julius Baer in Switzerland, in Zurich. Well, first of all, compared to my fellow panelists, it's actually kind of odd that I'm sitting here talking about infectious diseases and antimicrobial resistance. But because in the year 2023, towards the end of around in November, I published a research paper on antimicrobial resistance. Okay, and that's scientifically peer-reviewed by a chief scientific officer in Basel, whose company is working on this field. Now, why our bank is involved in working in this field is because, first of all, we are also in charge of a theme which is called future health. Now, future health is very much related to, say, longevity, changing demographics, and also some of the health challenges facing the world. Now, during my research, which I have to really emphasize here, is that because, first of all, as a bank, of course, you talk about the investment opportunities for our investors, for our ecosystem, of entrepreneurs, and so on and so forth. I'm very struck and very surprised that there is so little awareness or so little urgency about the urgency of rising antimicrobial resistance. So for this reason, I published this and would like to use this opportunity to raise greater awareness about this growing challenge. But we can actually talk in greater detail afterwards.
That.
Yeah,
Thank you.
sure.
Which brings us very naturally to Anthony. Hello. Question for the uninitiated. Could you tell us very briefly about antimicrobial resistance and why it is so difficult to get a new antibiotic to the market, and then what excites you most about solutions to get a new one to market?
Great, thank you very much for having me. So antimicrobial resistance is quite simply, we have bacteria, they cause infections. In the 1940s, the first antibiotics came along, through penicillin and a raft thereafter, that could treat bacterial infections. And suddenly, one of the most dangerous illnesses in the world became very treatable. But as most people learn in school, evolution happens and we all learn to adapt to the environments we are in. And unfortunately for us, that includes bacteria, which have adapted to antibiotics. And the stronger ones outlive the antibiotic and then they pass those on to their children. And that leads to antimicrobial resistance. And there's several ways we can stop this. One is we need to reduce the amount of unnecessary use of antibiotics so that bacteria aren't coming into contact with them unless we need them to. And secondly, we need to come up with new antibiotics, as Charlotte mentioned, to replace the ones that are inevitably going to be lost, because we cannot stop resistance if we're using antibiotics. And we want to use antibiotics because they save people's lives. The challenges with new antibiotics are kind of twofold. One, as I mentioned, we want to protect antibiotics from unnecessary use. The ones we want to protect most are the most important antibiotics, and often new antibiotics, because those are ones that are most likely to work in kind of a last phase. If other antibiotics fail, you want to have something that is safe. And so that keeps the volume of drugs very low. And then antibiotics tend to be very cheap. Often we're used to antibiotics being cheap. They've been around for a very long time. Often several antibiotics will work for a patient and it's not clear that they need a newer, more expensive one. And if you have low price and low volume, then you don't need a degree in economics or business to work to recognize that the market isn't going to be very good. There's a few things that excite me a lot at the moment. One of them is diagnostics. At the moment, there's a lot more interest in diagnostics over the last few years. And if we can get investment into exciting diagnostics and use technology and AI to identify whether or not somebody needs an antibiotic and which antibiotic they need that would work best for them, then I think that will allow us to reduce resistance and also to match antibiotics that will work with the patients who need them.
Fantastic. Damien, can I get you to respond to this? The big question is investment, what I understand, of getting new antibiotics to market. And that, unlike any other drug, for example, a cancer drug, if I'm a pharmaceutical company, I'm going to push this cancer drug. But if I'm a pharmaceutical company and I've just got a new antimicrobial, the whole thing is you don't want to use it. So pharma companies are more reluctant to invest, and these things can cost billions. And my understanding is the last new class of antibiotics was found in the 1980s, so older than, I guess, most of the people in this room. So can you tell us a bit about the investment? How can we get more investment into finding a new class of antibiotics?
Yeah, I mean, first of all, I think the medical doctors themselves do not want to use, overuse too much or prescribe antibiotics to their to their patients, or antifungals or antivirus, for example, because that could raise or intensify or reinforce this problem, right? I think that's not what we want to achieve. So the stronger doses of antimicrobial resistance will be reserved as a kind of like a backup solution for that. Now, when it comes to investment opportunities, during my research, because I tried to contact or talk to many different farmers, for example, across, even in Switzerland as well, it's quite interesting to see that some large farmers have even exited the space altogether, because under 1% of the total revenues come from antimicrobial resistance. So in other words, all these large farmers are not making enough money. But on the other hand, when it comes to oncology, it is different because it's high margin, it is much more, it's more profitable for the companies. For sure, they will actually put all the focus, dedication to developing oncology drugs. Now, having said that, in order to improve it, that's where, I think it's quite special or unique that as someone, a research analyst, for me, working for Bank Julius Baer in Switzerland, they were one of the pioneers when it comes to, say, tackling this topic, because there aren't a lot of, say, investable stocks from that perspective that have large market cap, because most of the companies are very small market caps. You have them based in India, for example, because India actually, or South Asia, has one of the highest burden when it comes to AMR, and then other locations as well. Or in the West, but it's actually very small base companies. But how to increase investment opportunities? That's the reason why I would like to engage with my fellow panelists as to why is it actually that the large farmers are so reluctant, of course, apart from profitability, maybe from the human perspective, from how we can actually build this ecosystem of different stakeholders, from banks to investors to NGOs to the governments to scientists, or Institut Pasteur, how we can actually come together to build a more resilient ecosystem.
To put the numbers in perspective, I was researching this last week, that it is predicted that by 2050, antimicrobial resistance will kill more people than cardiovascular disease. So it will become, as Anthony, I'm sure you can touch on in a bit, one of the biggest causes of death. And I think there's a Netflix show about a killer fungus out there. I don't know, I don't have Netflix, but it's not, from what I understand, speaking to people, that's not so far out that there is a killer fungus possibly coming for us. So very good we're having this conversation. I want to pivot quickly to Ellen and Samia, and then Philippe, get you to join in. So earlier, was it, Ellen will correct me, last month, the month before? In May, the Pandemic Preparedness Treaty was finally signed after lots of work on your behalf. Ellen, can you please tell us a bit about the treaty, what you like about it, and maybe what you don't like about it and what we can get a bit stronger, and then Sammy, I'll get you to jump in.
Sure. Thank you. And first of all, thank you very much for inviting me. And I regret not being able to be with you, not only because I'm speaking to you from sweltering south of France, where the first heat wave is hitting, and the villages without water. So if my voice goes, you know what's going on. So the pandemic accord there's an agreement amongst the members of the World Health Organization on the pandemic agreement, and what the agreement actually is, it's a response to many of the things that went wrong during COVID-19. In a way, it is a manner of learning from a pandemic, and set out a different international framework, a different set of rules to be better prepared for the next pandemic. The objective of the agreement is to have better frameworks for the prevention, the preparedness, and the response. It touches upon many different aspects. The agreement is not entirely finalized, because an important part that still needs to be negotiated out before the agreement can enter into force, before it can be ratified and enter into force, is an annex that covers pathogen access and benefit sharing. But overall, of course, the importance is a multilateral response to what was also an international failure in many aspects. And the part that we have worked on the most are the sections that deal with access to innovations, access to countermeasures. What we saw during COVID-19 was this phenomenal success of science, public investment in the development of COVID-19 vaccines, and then a colossal failure in the rollout of these vaccines, where low and middle income countries were really at the back of the line, and high income countries were procuring these vaccines multiple times over the needs of their own populations. All while the countries that actually had or would have had the manufacturing capacity and the companies that asked for access to the know-how and access to the technology to be able to help with the scale up and have a more diversified production of these COVID-19 vaccines were told no. The companies that by then had acquired the intellectual property and the know-how to produce these vaccines really established very firm monopolies, perhaps with the exception of AstraZeneca, which was developing and marketing the Oxford University vaccine that had a close collaboration with manufacturers in India. But overall, the issue of sharing of that scientific knowledge, sharing of that manufacturing know-how, was a huge stumbling block during COVID-19. And this is a subject that was it was a difficult subject during the negotiations, and it very quickly showed the fault lines opening up, the sort of traditional fault lines between the countries that were very much sort of running with more pharma-type talking points, and the developing world that said we need firmer commitments. Someone mentioned earlier this morning the role of the private sector in innovation, and that is a very important role. But so is the financing. That is the role of the public sector and public research and the public financing into these to make these kinds of innovations possible. Also very relevant for AMR, by the way. But what did not happen in COVID-19, and doesn't happen in many other cases as well, is governments using the leverage of that financing. Billions were spent on the development of the vaccines. That was fantastic. It was great success, in phenomenal scientific success, but a failure in using that leverage, that financing, in saying, here, you come up with the vaccines, but it doesn't mean that you get to say exactly what will happen with them. You will have to share that knowledge with others once it is developed. And that is a subject that has been addressed in the agreement. How that's going to play out in real life remains to be seen. We'll find out when the agreement is being implemented, but it is clearly recognized, and countries have agreed to establishing policies with regard to the public financing and the use of conditions of public financing to have a more equitable distribution of that knowledge.
Yeah. Thank you, Ellen. I think the summary is we get the science right, but we need to get the humanity right behind it. And if the public is financing this, what say does the public get in how a public good is distributed? So, Sammy, I've seen you nodding along. Yeah, would you like to jump in on what Ellen said?
So, thank you, Ellen. That really nicely sets the scene as to what some of the political challenges that persist when the pandemic agreement gives us some hope. For those who don't know who CEPI is, it's a bit of a tongue twister. Coalition for Epidemic Preparedness Innovations. CEPI's easier. Was set up and launched in 2017 post the West Africa Ebola outbreaks in 2014-15. Why? Precisely because outbreak diseases are unpredictable. So it's very difficult to convince the private sector to invest and take that risk alone. So CEPI was set up as a multilateral partnership funded largely by governments, by the way, not just the G7, but Malaysia, thank you, is the Malaysian government, Singapore, Ethiopia, Senegal, Mexico, all recognizing that there needs to be some funding of vaccines for viral diseases that cause outbreaks, known and unknown. COVID was our unknown within 3 years of our existence, and we rallied. The challenge that Ellen highlighted was CEPI was the only entity during the COVID pandemic that had access terms, and we exist in terms of making sure the tools that we fund the research for actually reach people in need wherever they are, especially in low middle income countries, right? So that equitable access piece is core to our mission. We were the only entity that had access terms at the R&D, the fundamental point, which Ellen highlights, where public sector philanthropic funding was being used to fund the research. And we required that there was technology and knowledge transfer to the vaccines that we were funding. So AstraZeneca, for example, we funded where we supported them in doing tech transfer to different partners so that they could manufacture in different parts of the world. The pandemic, so we didn't have a level playing field because the high-income countries really cornered a lot of the vaccines, and we had to, with Gavi, UNICEF, WHO, set up something called COVAX, which really we funded the R&D pieces, Gavi, UNICEF funded the procurement and then delivery pieces, WHO set out the normative in a very constrained sort of supply, who should get the vaccines first, of course, frontline healthcare workers, etc. So the agreement gives us hope because there's an agreement, a recognition now that you've got to bring the leverage you have with public sector funding is where you take the risk early on, right, in the R&D stages. And so it's no good coming to negotiate with a private sector company in a constrained supply environment when you procure. You have the leverage early on. And that's what the pandemic agreement, we hope, will now sort of facilitate better and have a better playing field. So I've got we talked about some of the challenges. We've got now a policy environment that talks about some of the hope in terms of trying to make sure we have that leverage earlier on. And then maybe Philippe and I can tag team a little bit on some of the technical solutions and the evidence base we're bringing to policymakers, especially this year at COP, where the government of Brazil has 3 health days, which is unheard of. And there's also going to be a big focus on infectious diseases. So it gives us an opportunity to bring the environmental policymakers and the health policymakers better together.
Perfect. Philippe, yes, would you like to take the baton from there?
Sure, yes. So the key feature here is knowledge. Actually, we like to compare with war, you need to know the enemy. And this is true at every level. So that means we need to work on existing pathogens, but also on the ones we don't know yet. And this requires investigation, curiosity, and I can tell you that it is very hard to get these projects funded. I can give the example of my colleague Arnaud Fontanet, where 15 years ago, he started to work on Zika viruses, and I remember that some colleagues said, why do you bother? Because Zika was barely known for a few cases here and there in Africa. 5 years later, Zika went all around the planet. And so it's really critical to be able to invest in the discovery at every level, not just work. Often the research or the funding for research comes as a reaction. COVID crisis was a typical one, but actually what's really critical is anticipation. And this can come from research in research institutions, in universities, in pharmaceutical companies, but also we can associate the public with that. Typically when around Paris, in the Forêt de Sénart, we see quite a lot of ticks in there, and so we encourage the public to send them they find ticks stuck on their trousers, to send them to us, and then we can dissect them and determine the DNA content of the type of tick, the type of pathogen, or viruses, microbes they might carry. That's how we can anticipate and improve. So everybody can contribute to research at every level. And the second thing is the long term. So you don't make discoveries in one day. You know, this takes often a long time, and the difficulty that we have for funding, typically for public with private funding, it comes for 2, 3, sometimes 5 years. So that means that often you are limited in time, and actually you need longer investment to make major discoveries. The RNA vaccines that were used to fight the COVID crisis, actually the RNAs that were discovered in the 60s. People like François Jacob in Institut Pasteur was involved, and that's 50 years later that this translated into a product. So the long-term investment is really critical too.
Wonderful, thank you. We've got 9 minutes and 30 seconds left for questions to our wonderful panelists. And we've got microphones going around. If I see any hands, I see one hand down there. Yes.
Hi, thank you so much for an interesting panel. We touched on it very briefly, but I find myself always surprised that tuberculosis is not more discussed when we talk about infectious disease and climate change, given that it's the leading infectious disease killer in the world. I know we discussed antimicrobial resistance, and I'm sure that's a big component of the discussion for tuberculosis. But I'm just curious if you are aware of any work investigating the impact of climate change on tuberculosis, and should we be more worried?
Yep. Who would like to take that?
I mean,
yeah.
Do you want to take it? Go ahead.
You go ahead if you want. I know there is some work in this. I'm not a TB expert, but it's certainly the case that in higher temperature climates you do get more TB, and we are seeing temperatures starting to rise through climate change, and it's on the long list of things we need to be concerned about. But I agree, it probably is an area that needs more concern.
Maybe I can say a few words too. So TB is often associated to poverty, and of course climate change is going to increase poverty. The conditions in which people are exposed to are often responsible for the lack of treatment, or the poor treatment. And of course, if we have storms, if we have drought, this will promote poverty and will contribute, maybe not directly, but indirectly to the cost of TB throughout the world. I don't know if you want to add something?
No, that was precisely right. It's the nexus of, again, the climate crisis and hitting the most vulnerable people again, where the health systems are weaker and sort of people then don't necessarily have access to the tools that they need. But there is some hope, because there is now a very large clinical trial, thanks to our friends at the Gates Foundation and the Wellcome Trust, for a new TB vaccine. Actually, there's another one as well in the pipeline. So, you know, the many of you are too young here. I'm a little bit older. So I had my BCG vaccine when I was very little, not very effective. But that vaccine, you know, and even the drugs that we're currently using are decades old, right? So I think there's new opportunities with some of the new technology platforms that we sort of validated during COVID, the innovations in the system innovations, whether it's manufacturing, how we do clinical trials, AI to look at regulatory data. There's a lot of innovations now, and also including computational, that are going to help us design better vaccines, better therapeutics, etc. So the hope is that some of the technological advancements will help us both in the fight against antimicrobial resistance, TB being the biggest killer, and sort of being able to do these things faster. And one of the things that CEPI has set out a challenge for the world is, can we make a new vaccine against a viral pathogen? TB is bacterial, by the way, but viral pathogen in 100 days from when we know the sequence of this new virus. And the reason we think this is, it seems like a big moonshot, but actually during COVID, Philippe highlighted RNA vaccine, RNA work, coronavirus work was decades in the making. It didn't just happen overnight. But from when we knew the sequence of the virus, the COVID-19 virus, it was 326 days till we got a signal that we had a vaccine that could create an immune response. We think we can do it now in 100 days in the near future because of all these system innovations, AI to design better vaccines. And we know, for example, a lot of the vaccines we have 2 vaccines for dengue now. They're old-fashioned technologies. They cause reactivity and severe disease because you get something called antibody enhancement, because you've got more than one clade circulating at the same time. now with the power of looking at large sets of data, using artificial intelligence and computational biology to design, whether it's a TB vaccine or a vaccine against other antimicrobial and bacteria that are causing resistance, or viruses that could cause outbreaks. The power is that you can design and fail quickly so that you can progress quickly. And I think some of the solutions we're excited about is, wouldn't it be great if we could have a combination vaccine for 4 or 5 diseases that are carried by this nasty Aedes mosquito, right? So you hit, from an efficiency, because our policymakers and our financiers are the ones we've got to convince. We've got to bring more efficiency in our R&D and delivery systems in the healthcare system, and have climate and health resilience sort of more bang for your buck, as it were. So a combination vaccine means in lots of places where there are no adult immunization delivery systems, which we discovered during COVID was really scarce, you could hit, chikungunya, Zika, dengue, Orapuche, which is a new one, by the way, that's cropped up in Brazil last year. They had 4 outbreaks simultaneously carried by this little Aedes mosquito. Wouldn't it be great if we could design a vaccine that could circumvent some of the current challenges with the existing vaccines that are also old-fashioned? So you can't use them in older people or in very young children who are the most vulnerable to these diseases. And that way you really try to help the health system to be more carbon efficient, more people efficient, etc., right? And you're saving more lives because you don't know which of these outbreaks is going to happen when. And the other innovation I think that is really powerful is bringing mathematical modelers and biological modelers together to predict, as the temperature increases, as mosquito habitats change, etc., or where people are migrating to because people are using farming in different ways, you've got refugees movements, etc. Modeling all those population societal pieces, mapping them over with sort of where mosquitoes are moving to. You can hopefully predict better using sort of historical evidence, but extrapolate to where these outbreaks might happen in the future, and then be able to inform the government of Malaysia or the government of the UK or the government of France or the government of Indonesia, where is the next dengue or Zika or West Nile fever virus going to appear, and what kind of size of a stockpile of vaccines or antimicrobials do we need that is efficient, right? So again, it's bringing the terms of, can we be more efficient in the tools and use the innovations that to sort of bring more efficiency in the system? By that way, we're preventing people going into hospital and reducing our carbon footprint. So it's both health adaptation and mitigation to climate
That's
change.
incredible. Thank you. I've got 1 minute and 30 seconds left. Do we have another question? Yes, we've got microphones coming around over here. I saw a hand up back there. Yes. Here we go. 1 minute and 22 seconds.
Hi. Just a quick question. The previous panel and this panel have been discussing the sort of problems we're having under the assumption that the international rules-based order that we've all been under, the multilateral system, philanthropy, as well as ODA, which has essentially been running it for the last 50 years, is going to continue in the ways that we've known it, which I think all indication is that it's not. So how do we respond to that when a whole new order has to be put into place to make whatever we're discussing happen? And by the way, I'm Maliha Khan from Women Deliver.
Great. Thank you. Great question. Ellen, can I get you, you've been working with all these organizations, can I get you to chirp in?
I get the easy one, right?
Yes.
No, but that is of course the dark cloud hanging over a lot of the progress that we've been discussing. But I just wanted to make a couple of comments before I say some more about that. I think a recognition and a revaluing somehow of the role of the public sector is really key. if you look at where the successes in disease outbreak and responses to diseases come from, that it depends hugely on public sector investment. And I think it's also fine to say there are certain areas of innovation where we should not be counting on pharmaceutical companies. They have a certain roles to play, but if it isn't driven by the public sector, it will not happen. Further, in order to have uptake of the products, we can develop the most wonderful vaccines, but if there is no uptake, we've got continue to have the problems. That requires equity, but also solidarity in the system, because in fact, if people don't feel they're part of a larger community and of a community in which solidarity is key, it will continue to be a challenge to persuade people to participate in, because in fact it's an act of public health, taking vaccines. You protect yourself, but you also protect the greater good, but the greater good needs to be there. In how's all of this playing out in the changing multilateral environment, the changing global health financing environment? I think we're going to see much more activity at regional level. Countries at the regional level coming together and also filling gaps that are being created by the current political situation and the challenges to the multilateral system. But I do take some hope and optimism from the pandemic agreement. There was a spirit in Geneva of we need to come together on this, and we need to make this happen. So I'm not ready to declare the multilateral system dead as yet. But I do think we're going to see a lot more activity and developments at the regional level, and that can also have a lot of positive further developments, of course, including for science and innovation.
Wonderful. Thank you so much. I like that we can end on a somewhat hopeful, positive note. Thank you all for the questions, and thank my panelists. That was a really interesting discussion, and I learned a lot. Thank you.
Thank you again to Charlotte and our panel. For those who are scheduled to join the Clear Air Fund breakout session, that will be starting now on the 5th floor in the pergola. For everyone else, there is tea and coffee on the 2nd and 3rd floors, and we'll be back at 11:55. Thank you. Hello, everyone, and welcome back. I can see a few more coming in through the back door. Just wait for you all to get your seats. Our next session may have a certain resonance for anyone who's been on the tube in the last week. We're looking at the impacts of extreme heat, which are significant. Extreme heat claims around 500,000 lives a year globally. And so the big question is what we can do to tackle it. So please welcome to the stage our panel on solutions for a warming world, moderated by Fiona Walker of the Bureau of Investigative Journalism. Thank you.
Can you join us? Thank you. We're here to talk about getting hot, very, very hot. So thanks to the Conduit today for keeping us nice and cool. And specifically, how it affects our health. And in cities. Cities, partly that's where most people live, but also they're vulnerable to heat in different ways. So we have a panel of experts to cover all bases. First of all, we have Peter Badudu, who is the Executive Director of Impact on Urban Health. On the screen, we have Francesca Racciopi, who is head of the European Centre for Environment and Health at the World Health Organization, WHO, and she is all things policy. We have Dimple Rana, who's an associate at Arup, who you may have heard of. She's our built environment expert, using data to understand the climate and cities. Meet the engineer. We have Lina Liakou, who is the global director at the Resilient Cities Network and has been a deputy mayor, so she's actively been involved in making decisions about climate solutions in cities. And we have Jeanette Ikovics, who's a professor of social and behavioural science at Yale School of Public Health. She is our academic, and between them, we can take you around the world in solutions. Now, we heard actually from Jamila earlier, the crisis is not one of ignorance, but one of inaction. So to kick off, each panelist is going to help us understand why we need to act now and through a tangible example of their own work. Lina, could you start for us? Thank you.
Sure. Tangible example. So we were doing a workshop in Quezon in the Philippines with students in a school. And there was a student saying, well, when the school closes because it's hot, I go home, which is hotter. Let's not forget that they also go to a house, to their home, without adult supervision, because their parents usually work. So the question here is what it means to have schools that actually are not refuges, are not safe places for our children, and when the alternative, it's actually worse. And what does this mean for their mental health, for their learning, for how their body reacts to the stress? And for me, that's the trigger to actually work on this.
Absolutely. Peter, could you pick up?
Certainly. And so Impact on Urban Health, we're part of Guy's and St Thomas's Foundation, and our focus is on, we're a philanthropic funder, and we try and address the root causes of what make you healthy. And climate represents one of, if not the biggest long-term kind of factor affecting health. Examples, looking at our Guy's and St Thomas's Hospital Trust, which we're based near, if you take your mind back to 2022, when we had a really hot summer, critical IT systems across the trust went down. That meant surgeries being cancelled, and not just that, community practices, GP practice going down as well. The trust had to spend $1.5 million trying to get IT back up. That took weeks, and through that time you were having cancelled operations and much more.
Yeah. Dimple, what example have you come across in your work?
Yeah, so for me, it's really trying to use data and modeling to bridge that gap between heat perception and the reality. So I think, we've all seen the headlines over the last few weeks. It's summer now in the Northern Hemisphere, and we're seeing increasing number of headlines about record-breaking temperatures, all of these things. But there is still a gap between what people perceive as the risk of heat and the impacts of heat and the reality. And I think what motivates me with the work that I do is we look at cities, we look at mapping heat over cities and understanding where are the hotspots, what are those temperatures. Some of the work that we've done has found that sometimes in urban centres it could be 5, 6, 7 degrees hotter than the temperatures that we measure. And so it's really important to understand where those hotspots are and who they're impacting, because that's really kind of the key here. So with the work that I do, is we sort of zoom into those things and then look at solutions. So it's that kind of bridging that data gap and bringing that sort of perception to reality.
Yeah, Jeanette, what would you point to illustrate the urgency of the situation we're in?
Thank you, Fiona. Good morning. I want to I think Francesca's going to address some of this as well, but I think a couple of things. First of all, as you mentioned, just in the last few days, this heat wave, somebody said earlier this morning, this heat wave in the UK will kill likely 600 people just over the last few days. And it's not just the immediate risk of, let's say, heat stroke. There are long-term health consequences of profound heat and prolonged heat on the heart, on the lungs, on the brain, on mental health. All of these risks are really profound. And we'll come back to this later, but of course there are things we can do to mitigate, to adapt, to prevent. What I wanted to do in starting was take a high-level approach and tell you a little bit about some work that Resilient Cities and Yale have done together over the last year. It's a project we call Urban Pulse. And I think this will just set the stage a bit, because we surveyed nearly 200 city leaders in 118 cities in 52 countries. Let me tell you what they said about heat. More than 70% had a high concern about unpredictable rise in temperature, including even more than that, who were concerned about their impact on vulnerable populations, like children and older adults. And about half increased a high level of concern about outdoor activities, for example, children in schools, labor capacity, and heat-related deaths. Second, more than half, 52%, said they had already had economic losses due to heat. And this was more than than flooding, storms, and air pollution. So the city leaders themselves were more concerned about heat than flooding, storms, and air pollution in terms of the impact on health of their residents. And finally, cities were not as prepared as they should be. About 40% had no climate action plan or resilience plan. And of those that did, only 23% addressed climate and health concurrently. So we'll come back to that. I think the optimist in me says these are all big challenges, and yet they create opportunities for us to act.
So the statistics are pretty stark. And Francesca, what's the view from Europe?
Yes, good morning, and thanks for having me. Sorry for being connected remotely from Bonn. Yesterday we had here our little peak of a heat wave here. But when it comes to Europe, I don't know how much it is common shared knowledge, but in fact we are speaking of the region in the world that is warming up at a much higher pace than any other part of the world, twice as much. And these are the facts. We were just reminded at the beginning of the session that there is an estimate 500,000 of deaths attributable to heat worldwide. Well, Europe has its own fair share, unfortunately, here. And just between 2022 to 2023, we had some 100,000 deaths together, but only in 35 out of the 53 member states of the WHO European region. So it means heat is killing. Heat is killing a lot. Heat is killing particularly in cities. And there is a lot that we can do. And here, allow me to flip the coin on the positive side. What keeps me running and going is that at the WHO here in Europe, we are leading the update of guidance for the development of heat health action plans, because our organization sits at the intersection between evidence, where evidence is created, and how we can put evidence at the service of member states. We are in the process of updating this guidance that will be released the next year, together with the European Commission. It's a project supported by them. And I'm very happy to say that one of the new items that we're going to have in this guidance is increased attention on cities. And I'm sure that we will come up back to this point as we move through the session, because in cities we have a huge potential to make the right things at the right time and for the right people. And I'll stop here so that we can continue later.
Okay, so I think you're not left in any doubt that the urgency is there, that the need is right now. Lena, what's your statistic of the day?
I'm going to follow up based on what Janet mentioned. I'll just say that 4 out of the 10 large cities, only 4 have actually robust early warning systems, which means understanding the risk and having the right protocols and have the communication with the communities, have the integration with the public health systems, and then being able also to respond and recover.
Yeah. Rana, we measure temperature. It's not as simple as we think.
No, absolutely not. So just not a statistic, but just something to think about in terms of what exactly is heat. So we talk about air temperature, we talk about peak temperatures, but in reality, what people really experience when they experience heat is not just the air temperature, but we need to also start being a bit more sophisticated and thinking about the humidity in the air movement, as well as solar radiation. If it's 20 degrees and you've got the sun beaming down on you, you're going to feel a lot warmer. So there are other indices out there to measure heat, but we need to increase that communication and understanding. The other thing is sort of instantaneous heat versus long-term heat. So Jeanette, you already mentioned the long-term effects, but quite often you might be at a moderate temperature, but if it's sort of over a period of 4 or 5 days, that could have a worse health impact. So if you've got 5 days of sleepless nights, that's going to cause mortality, morbidity, all of that. So it's important to think about the long-term effects, not just in a heat wave, but also over many months. If you're in some parts of the world, heat waves and sort of that heat period is getting longer and longer. So if you've got sort of months and months of temperatures not dipping down, again, that's going to have an impact. And then the last thing is really, where do we measure heat? So we talk about sort of temperatures outside in the built environment, which is important, but most of the time we're inside buildings, and most of the time we're inside our homes. Countries like the UK, much of Western Europe, North America, our homes are designed to keep the heat in, and we start seeing excess mortality in the UK when it's 16 degrees. That's not hot. You're wearing a jacket at 16 degrees. But what's actually happening is that when it's 16 degrees outside, in a lot of people's homes, it could be 20 plus degrees inside. And so we need to understand more about what are the internal temperatures that people are actually exposed to when we're seeing some of these health outcomes. Again, coming back to sort of modeling data, we're getting increased amount of data on all of this, so we can start understanding the places that people are actually habiting and having a bit more of a sophisticated conversation.
Well, you were promised solutions. And the good bit is we are here for real-life solutions. I mean, we can practically take you around the world, as you probably picked up a bit already. How many cities, how many countries has your work gone into?
101.
100, well, there we go. That's a pretty good start. So, well, Lena, do you want to start then? You have solutions, you're bursting with solutions. So do you want to kick off with a couple to inspire us?
Sure. And I would like to create, like in our mental mind, like 3 categories. One is governance. What a local authority needs to put in place in order to be able to respond to heat. We see great examples all around the world where cities are appointing chief heat officers, chief resilience officers, like somebody that is able to work across the different departments and agencies. Let's not forget, local government is very siloed, as generally public sector. We are talking about plans and strategies, heat action plans, resilience plans. Then you have the response, how you actually respond before, during. This is the early warning systems. This is the naming the heat waves, which was a campaign. Seville did it, which is great. Like, why naming only hurricanes? Like, this creates awareness. This is also around building the right protocols, whether this is, for example, with workers outside, that work outside, with schools, when this needs to be closed, and so on. You have the cooling centers, resilience hubs. We see more and more cities creating this type of ad hoc places where communities can go. And then you have the third one, which is the reimagining our cities. Because we need to actually redesign our cities in order to be able to address and minimize the impact of extreme heat. And this is where we're talking about building codes, right? New materials. This is where we have the transformation of the schoolyards, like the Oasis project in Paris, and then many others have replicated. This is the urban forests that Freetown is put, like the 3 million or 30 million trees until 2050, or Melbourne with their small urban forests. This is around the Cooling Neighborhoods project that, for example, New York is doing. So the issue is that there's no one solution. A city and its ecosystem need to be able to mobilize itself and try to address all three pillars, both how, the timing, like actually responding, and then the long term. Again, our cities need to look different if we want these cities to be livable and healthy.
Jeanette, could you pick up on a couple of those and tell us what they actually mean on the ground? What happens in these kind of cooling areas? Thank you.
I'll give an example, a real practical example, sort of building on Oasis schoolyards, but the idea of these nature-based solutions. But I think also I'm sort of a systems thinker, so building across this panel and then also some of what we heard this morning. So we've got sort of the nature-based solutions like the schoolyards that are not just for schools, but really are community resources. And then tying to what Dimple said about the built environment, we really need to think about how those talk to one another. We go from inside to outside and outside to inside. So we need to be thinking about those together. So I'll give you a specific example. In New Haven, Connecticut, my hometown, we had a collaboration between the university and some artists and residents using cool paints. Not the only city to do this, of course, but creating beautiful spaces with murals and cooling paints on walls and roofs to try to begin to address in a passive way some of the indoor heat, while so enabling this safe passage. And then I wanted to give two examples that tie to some of what Gary White was talking about this morning on some financial innovations, I'll say, and this came from the work that we did with Resilient Cities Network and the survey last year. So in Ahmedabad, India, the Self-Employed Women's Association used microinsurance to protect the income of women who were unable to work. And I think that's an incredible way. And we're not talking about $1 million loans. We're talking about really microinsurance, but protecting women and women's wages at those moments when they're most needed by creating collective action. And a second example is, and there are many, I'm looking at a list, so I'm being selective here, but another example is, for example, the opportunity not just to build trees, to plant trees, very, very important for carbon capture, for shade, and for heat reduction. But a place like Nairobi, Kenya, that is incentivizing building owners with tax breaks and tax assistance to develop and implement these nature-based solutions. So it goes a step further.
And so that would be things like rooftops with vegetation on top, which, I mean, is such a simple step. It doesn't require the billions and trillions that we've been hearing about all day, but could be replicated quite easily in many parts of the world. Dimple, I mean, you have this kind of bird's eye view, which you can create using modeling and data. Talk us through what you can see and how you can then use that for solutions.
Yeah, absolutely. As I sort of mentioned before, through modelling and heat mapping, we can start looking at how we prioritise solutions in cities. So we did a bit of work for the Greater London Authority last year, where we mapped heat across cities, but then also layered that with socioeconomic vulnerability. So we know that older adults, younger children, people under income deprivation, they're going to be more vulnerable to heat. And then we also mapped vulnerability of buildings. So what buildings are not actually cooling down. You take those 3 layers and you get a different kind of hotspot map. You get a risk map. And then you can start zooming in and thinking about solutions. So the other thing that we can do is then test out things quite rapidly. So we took an example of an area in Fitzrovia in central London, just up the road, where it is pretty hot. And we thought about how can we layer different solutions together and what difference can that make? So we really maximize things like greenery, adding as much green cover as we can, putting in trees, cool roofs, all of the things mentioned, as well as adding moisture, so irrigation. What difference does that make? So we tested that for the 2022 heat wave, where we were getting 40 degrees. And we were starting to see sort of 2 to 3 degrees reduction in temperature. That might not seem like a lot, but when you're in the middle of a heat wave, every degree, every half a degree makes a massive difference. So we know that we can maximize those passive measures, and we can do sort of interventions at scale, and we've got tools to sort of measure that. The other side of the scale is looking at buildings and overheating, as I've mentioned before. So again, we can start testing, what interventions are going to make a difference. So we did a bit of work with roof over our heads for informal settlements in India. And this was really looking at sort of settlements that have materials that retain heat. So things like corrugated, metal, all of those things, where inside it could be much hotter than outside. So what are the quick solutions that we can test? So one thing that worked really well was putting in a layer of plastic bottles in between the sort of corrugated roof materials. And you can find that there could be a 12-degree difference between the outside and the inside. We can model this, measure it, and then we can pilot it. So it's kind of different solutions at different scales. Lena, you mentioned sort of different pillars, but I think we need to think about layering solutions, thinking about urban scale measures as well as building scale measures, and then thinking about context as well. What works in one country and one climate is not going to work somewhere else. So we may be able to plant loads of trees in the UK, but that might not be the solution in parts of Africa or Asia, where it's something else. It's a cool roof, or it's sort of using sort of more local planting in nature. So yeah, all of those things, testing can bring us to the right solution.
Francesca, you also get that overview at a continent level. What have you seen that you can describe to us that cities do to get on the front foot here?
Yeah, I was listening to that, and I was very happy to hear examples like the Paris project on schoolyards and so on. And I think that there is a lot of super inspiring stuff that is going on in Europe at the city level. So they are really, real life laboratories where things are happening. But there is an element that I believe we can and we should use more in a way competently when we are advocating, and it is that the huge benefit that we are getting is, of course, and certainly in terms of what we want to achieve is preparing and making cities more resilient to heat waves. But so many of these interventions greening the cities, providing a higher quality green space that is adapted and it is well thought through so that we are not creating some of the risks. We don't want to have more allergies. We don't want to have to create unintentionally breeding ground for vectors. And we have to know how to do that correctly. But when you do that, you have so many health benefits for your city. And then I think that as a policymaker, this is something that we really need to help them to take forward and to advocate. There are contexts where now the sea world, the climate world is becoming a little bit controversial. But, an intervention that makes a city greener, it makes a city healthier because of the heat, but also because you create opportunities for people to be more physically active, because we are reaching out to communities that otherwise would be more deprived. So it is very important that we learn how to make our narratives more effective. And going back to the first point that was brought up by Lina about the governance, I think there are also inspiring examples at the city levels where, for example, in Athens, they have established the chief heat officer as like a coordinating function within the local government to bring together all those elements from the early warnings down to the response of health systems. And you will allow me one last moment to remind everybody that although WHO is not, we are observers in the climate convention, but last year at COP29, we issued a special report. And indeed, the special report that was published with the support of more than 300 scientists and 100 organizations, so it was not done, back of the envelope in my kitchen. We have identified very important, very effective actions, many of them acting at the level of the cities. And these are implementing heat health warning systems, electrifying primary healthcare facilities with the solar power, improving water and sanitation infrastructure, transitioning to clean household energy, and reforming fossil fuel pricing. And what is estimated is that if we were able to move along this path, we would save more than 2 million lives per year. And for every dollar invested in one of these, $4 of return for that investment would be accrued. And many of these, perhaps with the exception of reforming fossil fuel pricing that normally requires national, if not international action, everything else is also available. And there are beautiful examples of actions taking place in cities.
Thank you. Peter, your work is rooted here in London, so right down to the micro. I mean, we've spent decades in the UK and elsewhere, insulate your houses. And in fact, in some places they have those communal heating systems and they don't even have control over them. All that was done to try and save the planet, which we might not have done particularly well on so far. But now we're too hot. What have you seen, and how do you enable cities like London to do both and to do it equitably, to make sure everyone is taken along?
Yeah, really great questions. I didn't think we were going to get to district boiler systems. I'll try not to bore on with those. I mean, just a couple of things we draw up. One is that equity point, recognizing that those who are most impacted often those on lower incomes, those with multiple long-term conditions, and recognizing that even at the kind of London scale, we've got much more kind of localized those who are being affected distinctly worse. And it will often be people who are kind of least well positioned to then respond to the situation that they find themselves in. And they've often kind of contributed less. They may not drive a car. They may be living in a smaller home as well. And so we see that very much in our place. We're based in Lambeth and Southwark, so both in the south of London. And there you have really intense inequalities of, you can have people who live streets apart who have as much as a decade difference in life expectancy. We funded a project working with the Bureau of Investigative Journalism, where on a pilot basis we tracked some of the indoor temperatures of homes within Southwark. And this wasn't in 2022, so it wasn't that it was the hottest summer, but over the period of the 40 homes, found that all of those were 25 degrees or over during the period. A quarter of them were over 30 degrees, and in two of the household, we had people who were hospitalized ultimately by the temperatures in their home. And off the back of that project, kind of one of the big things we've done, almost drawing on some of the other examples from the panel, one is working with councils in our place, so including Lambeth, to map a bit along the lines of what you said, create a heat inequality index, so you could see that combination of both kind of who are people living in housing that's more likely to get particularly hot, where do we see the kind of highest levels of deprivation, and tracking that data together, then looking at what's likely to be the best way to get messages to them, get early action that they can actually do at that very localized level. For us, one of the striking things is that lots of the techniques that even kind of well-meaning, intending councils do not reach into the level of some of those estates that you'll see around the boroughs in which we serve. And so what we've been piloting, the work's not finished yet, is working with not just the council, but also with local voluntary sector organisations who are more likely to know the kind of older residents that can't otherwise be reached, who are likely to be able to kind of translate relevant messages. And some of and lots of what we've been talking about in this session and throughout the day will be about major, big, long-term solutions. At that really localized level, some of the things we're talking about are immediate practical steps to mitigate the here and now. So that can be about kind of energy vouchers for household, that can be distribution of fans, that can be getting people blackout blinds and doing other immediate steps that mean that those who are, unable to navigate changes they need to make can in the short term, through kind of trusted networks and organizations, get a more immediate response. And fast forward a couple months, we'll get more of the results from this pilot. We're hoping we can work with more councils up and down the country to get some of these approaches tested, because it really is those who are the kind of furthest from health equity that are likely to be the most exposed to climate inequity as well.
Before we go to questions, a quick 30 seconds from each of the panel members, because there's always something that they wish they'd said and they've been thinking over it in their heads. We could just go along the line. Jeanette, do you want to start?
So many things. I think being a professor of public health, I have to come back to a word that's been said throughout the day so far already, which is prevention. We do know what works. We know we have many solutions, some traditional, some more innovative. We need to act boldly, and we need to act now. And I think also we need to be aspirational. We need to really be thinking about what does the healthiest, most resilient cities look like, and how do we create them collectively? How do we co-create them to be equitable, to be fair, to be resilient to both climate and health? And gratefully, I think there are many of us working collaboratively on this effort, and we'll continue to share out these solutions.
Lena.
We talked about the urgency. I think a problem is that that cities and city leaders don't have always the agency to act. And they need, especially in the connection between the impacts of heat with health and the health outcomes, they need better data. They need better evidence, and they need also models and business models in order to make the case of why to prioritize X investment over Z. We actually initiated last week a new partnership with Bupa and Reckitt under the SMI initiative, together with Yale and Mode Economics, in bringing, first of all, these city leaders that are pioneering in their cities together, creating the necessary evidence, the right data, and the right frameworks to help them Again, being able to prioritize their investments, because in the end, everything comes down to the finance. So how do you make the case that, yes, this is the investments I need to make because it will save me X amount of dollars in the health systems, but also add also the social and economic aspects.
Thank you. All about the money. Actually, I think you were going to come to that point as well, Dimple.
Yeah, a little bit, but just building on what these guys have said is that, coming from the world of data modeling analytics, what's really important is communication, and I think communication is key. I live in a world of jargon, and that doesn't work for everyone. And it is about a collaborative effort and bringing everyone to the table. So from the public sector, city governments, through to the community, but also the private sector, so the economics, how do we communicate that? And that's the important thing, is that we are speaking in a language that everyone can understand and that can incentivize action across the board.
Peter.
Equity would be the kind of big takeaway that I would push. If we don't have solutions that work for those who are most at risk, we don't really have solutions. So recognizing that solutions need to be built with equity in mind, and in that I think there's a hugely important role for, like, how do you leverage the broader social infrastructure of places, working with local charities, working with community groups to make sure that solutions actually reach those that they need to.
And Francesca?
Yes, I think that there is a shared sense of impatience here, because we have the feeling and the understanding that it is by now not so much a matter of evidence of the impacts. Of course, we need better data, more data, particularly in places for which we do not have those data, not yet then. But the point is, how can we move the action at the scale and pace that is needed? So from my perspective, I would see two main prongs for this. So one is about the political will and resolve at international, national, and local level. And for that, in our region, the WHO European region is just convened an independent pan-European Commission on Climate and Health, which is led by the former Prime Minister of Iceland and supported by Sir Andy Hines from the London School as our chief scientist, to help taking the messages and formulating recommendations for policymakers to accelerate action. But at the same time, we also need to empower and to support the vast community of professionals, practitioners, and civil servants, because they are the ones who, at the end of the day, will be pushing and turning the cranks of the governance machinery. And for that, I'm very happy to see a growing number of countries coming together. Here in Europe, we have 12 of them under the leadership of Ireland, coming together in a partnership for health sector climate action. And it is really a community of practice that is learning from each other. So we need, it is not either or, it must happen at the same time. Political resolve and empowerment of the community who will take forward the change.
Empowering, thank you. Please put your hand up for questions, even if you want to name the next heat wave as well. We start here at the front. Sorry, the lights make it.
Thank you. I've probably learned more from this panel than most. It's been a wonderful discussion. I have a question, because there's a Best Buy that I haven't heard mentioned all day long. And I'll have to caveat by saying I'm not representing the organization that I've worked with and have pioneered decarbonizing healthcare or trained 70 countries on how to get started. I'm not representing my role on the governing body of the ATTACH, which represents 90 countries and 80 technical partners. I'm not representing the Lancet Commission, on which I'm a commissioner for the sustainable healthcare. This is from me. Why is it, if we're interested in prevention as a Best Buy thinking philosophy, social determinants, equity, resource use, and the inequities around that, why is it that no one has mentioned closing the gap for demand to and access for contraceptives? That's my question. Thank you.
Very interesting. And if we take another... thank you.
Okay, thank you for this nice discussion. So how would you reconcile the concept of a green city with the risk of vector-borne diseases? Because we know that mosquitoes thrive in this green and humid environment. So that's a challenge. So I would like to hear your views on that. Thanks.
Okay, let's take those two to start with. The contraception point, I know, Jeanette, you've worked in sort of maternal health and so on, so maybe you want to pick up on that to begin with.
I haven't thought about it in this context, but I think it's an excellent question. And when we think about population growth and density, of course, we're talking about demands on all systems, city systems, healthcare systems, and so on. I think I haven't seen that connection made so explicitly. I think it's something that we can and should do more. I think it ties to public education and to public health systems and the healthcare system. I'll just say briefly in terms of pregnancy, which in some ways is the counterpoint to contraception, is we know that heat, of course, affects safe pregnancy and has a terrible risk for preterm birth, which affects health along the lifespan. So I think dealing both in the perinatal period with contraception and preconception all the way through would provide, as you say, a lot of bang for buck. So thank you for raising that.
Francesca, on the vector-borne diseases, I know that you've mentioned that in some of your coverage.
Yes, and I think that this is a very important, aspect that one needs to consider. And it is a part of how we do the right planning for the right places in the right way. So it is not just any greening that will work. It is very important to be fully aware of what are the geographical, the climatic conditions of the places where interventions are taking place. And it is equally very important to be mindful of the need to have very robust surveillance systems when it comes to vector-borne diseases, because now we are seeing them appearing here in Europe. It was reminded before, in places where they were unknown. So are our health systems prepared to conduct the appropriate surveillance? And whenever we are implementing green projects, are they sustainable in the long run? Because this is one of the projects. Very often cities fight with the limited budgets. And of course, there is a big danger into start developing a green area. That the green area will not be tended and will not be properly maintained, ensuring that it is delivering what is meant to deliver, which is a health, well-being, a beautiful city, a thriving city, rather than disbanding.
Thank you. Judging from the number of hands that went up, I think they're going to be bombarded afterwards. I'm sorry we've run out of time. So thank you to all. I hope you're now buzzing with ideas. But your next bit of inspiration is coming up. Let me introduce the Global Witness panel Closer. It's a presentation by Alice Harrison, who's head of fossil fuels campaigning at Global Witness.
Should we?
The automobile and the power behind everybody in this country has oil supplies filled underground. We can drive anywhere we want.
Miss Harrison from Global Witness. We're actually going to start by playing a very short film for you. I'll introduce myself properly after that.
The automobile and the power behind everybody in this country has oil supplies filled underground. We can drive anywhere we want.
Eugene was a United States postal carrier in Dallas for 36 years. That particular day, the heat index was 119 degrees. So just imagine how hot it was. He passed out in one of the homeowner's yard, but it was the heat that actually killed my husband. The summer now in Dallas is not like it was 20 years ago.
This summer was the hottest we have ever recorded on Earth, and that's because of the climate crisis. The biggest cause of all of this is fossil fuels.
I had a particular patient, very healthy, very active. He came to our ER with 105 temp. He ended up with brain damage, and he actually passed a few days later.
The heat affects everyone in the community. It doesn't discriminate.
My husband was healthy. He was a healthy 66-year-old. Step up to the plate and make some changes.
Thank you. It's quite a powerful one, that, isn't it? Hi, everyone. I'm Alice Harrison, and I work at Global Witness. And for those of you who don't know us, we are a campaigns organisation, and we are working to try to get accountability for the industries that are driving the climate crisis. No surprises, that includes the fossil fuel industry, which, as most of you will know, is the biggest driver overall. Now, obviously, we can't put a dollar figure, a monetary value on human lives, like those of Eugene Gates, who died of extreme heat. But one of the things that we are calling for is for oil and gas companies to be made to pay to cover some of the costs of extreme weather. And that is, frankly, because we don't think that the rest of us should be made to pick up that tab when, you know, our homes get wiped out in storms or our farms are unviable because of droughts. So the video that you've just seen, that was part of a campaign we ran in the US last year to try to drum up a bit more support for a bill that was working its way through Congress at the time. The bill was it was designed to force the fossil fuel industry to pay into a federal fund that would help cover some of the costs of climate breakdown. Sorry, I'm trying to... Here we go. In that video, you saw flashes of this gas sign which we produced. Anyone who is familiar with America will know that Americans obsess over the cost of petrol. And as that video hopefully helped make clear, something that we were trying to do was to play on that controversy by showing that actually the cost of fossil fuels is so much higher than you might think. So we pulled official data on the number of people who have lost their lives to extreme heat in the US. The numbers that you can see here, really conservative estimate, by the way. We also, however, we wanted to bring the fossil fuel majors more into the picture here. So we tried to find out how many more lives are going to be lost to extreme heat if the big five, by which I mean BP, Shell, Chevron, Exxon, and Total, if those 5 companies get to produce as much oil and gas as they plan to between now and 2050, and we found that the emissions from burning those fossil fuels would result in an additional 11.5 million people dying of extreme heat this century. So that's 11.5 million, and that is a death toll that you can pin to just 5 companies due to heat alone. So we aren't talking about all of the lives that would be lost in floods or storms or because there isn't enough food to eat. And we also aren't talking about companies like, you know, Saudi Aramco, the really big state-owned enterprises. This is just those 5 companies, and this is just extreme heat. When we were making the video, we spoke to loads of people like Carla, who had lost loved ones in the States to heat. And one of the things that we were really struck by was, you know, most people had no idea that the fossil fuel industry had anything to do with extreme heat. So we hooked the video to a digital campaign that we ran, which meant that with the click of a button, US citizens could write to their senator to ask them to support that polluter pays bill that I mentioned at the beginning. This is Senator Merkley. He was a sponsor of that bill. This is a quote that he gave us to use in the press outreach for the campaign. A few months later, Donald Trump is re-elected, and it won't surprise you to hear that that bill died a death in Congress, and we're not going to see anything like that anytime soon at the federal level. But similar laws have been passed at the state level in New York and Vermont, and they are being debated in state legislatures around the country, including in California, where we are working with partners there in a kind of a similar way to drum up more support for that bill. We are campaigning on this in the UK too, so we're working with MPs from across parties to try to put more pressure on the UK government to hike taxes on oil and gas companies to help cover some of the costs of climate breakdown. This is actually a really popular idea in the UK. We carried out a poll which was published in The Guardian last month, and it showed a very clear majority of Brits want to see oil and gas companies made to pay to cover some of the costs of climate action. And this is where you come in. If this is something you agree with, we would love it if you would sign our Polluter Pays Pact. You can access it via the QR code here. This is an initiative we have just launched with Greenpeace and a number of other NGOs, including Oxfam and others. It is a global pledge calling on governments to make polluters pay for climate breakdown. We would love it if you would add your signature and spread the word. I've exceeded my time, I can see here. Thank you so much for listening, and I'm around if anyone has questions.
Thank you very much to Alice and Fiona and our panel earlier. We now move on to more directly address the question of mental health. The impacts of climate change are most often referred to in their physical effects, but there is a growing body of evidence that demonstrates the impact they have on mental health too, from eco-anxiety to spikes in depression and psychosis in heat waves. So I'm delighted to welcome to the stage our panel on protecting mental health in a climate crisis, moderated by climate activist Tori Shu. Thank you.
Hello, everybody. Good afternoon. Can you hear me all right? Great. Well, thank you so much for being here this afternoon to this panel titled Protecting Mental Health in a Climate Crisis. My name is Tori Choi. I'm a climate justice activist and campaigner. I'm a senior advisor for the Fossil Fuel Non-Proliferation Treaty and a consultant and advisor to the Stop Rosebank Coalition. And 2 years ago, I had the absolute privilege of writing a book where I interviewed young people about their impacts and their sort of experiences with mental health in a time of climate change. And, you know, as we just heard, this is quite a nascent topic in the field of, you know, the discourse, the wider environmental discourse, but the reality is that the impacts of climate change on people's well-being is nothing new. And so in order to explore the sort of depth of this field and answer some really pressing questions, I am joined by some phenomenal experts, researchers, panelists. And I'm going to start with Dr. Colin Ziwuji, who is a professor of global health and HIV medicine at Brighton and Sussex Medical School, University of Sussex, and a faculty member in population science at the Africa Health Research Institute in South Africa. His research focuses on evaluating interventions, strengthen health system resilience to extreme weather events, the intersection of climate change with HIV, and the impacts of climate change on mental health. And then next to Collins is Professor Andrea Miceli, who is a clinical psychologist and a professor of early intervention at mental health at King's College London. He is the principal investigator on Urban Mind, a 10-year project which explores how living in cities affects mental health in urban communities. His current research focuses on the negative impact of heat waves and air pollution on mental health, which is very relevant to London. And he is especially interested in how urban nature can mitigate these negative impacts and support mental resilience. And then on my far left is Sarah Klein, co-founder and CEO of United for Global Mental Health, a UK-based global mental health charity that exists to advocate, campaign and fundraise for greater political and financial support for mental health around the world. And over the course of her impressive career, she has developed and delivered successful national and international campaigns and initiatives aimed at governments, international institutions, and political parties at the highest levels. And dialing in from Portland, Oregon, is Dr. Thomas Doherty, who specializes in applying environmental perspective to mental health and well-being. Thomas provides individual and couple services through his business Sustainable Self, and also consults about climate change, health, and well-being to groups and organizations. His book, Surviving Climate Anxiety, A Guide to Coping, Healing, and Thriving, will be out later this year, so please make sure to pre-order it. Welcome, everyone, and thank you for being here. So, first things first, we all come from quite unique, but also overlapping perspectives in the context of mental health and climate change. And I wanted to start by asking, how did each of you get into this field, and what does the phrase climate mental health mean in your context? Colin, should we start with you?
Yeah, thank you. In 2014, I lived through a 2-year drought in rural KwaZulu-Natal, and then I was an HIV. I'm still an HIV physician, actually, but you wouldn't know that because of the kind of work I do now. Then I wanted to look at how the drought affected people living with HIV in terms of having to make difficult livelihood decisions as around food security, as well as adhering to the antiretroviral therapy. But I was so busy at the time, I couldn't get to it until about 5 years ago when I started looking at that and talking to people around that community. They were also more interested in mental health, just beyond HIV. So in addition to investigating climate and health system, and also how it impacts HIV, we developed a program of research looking at how climate change impacts mental health as well.
Thank you. Andrea?
Yes, so I was always curious about the mind. So I was curious about why some people develop mental illness, some people seem remarkably exempt, and what happens in the brain when people become ill, and can we reverse these changes, and perhaps most importantly, what can we do to support people who struggle with their mental health. So for a long time, these were my main research questions, and I must confess I wasn't specifically interested in the environment or nature or even climate change. But all this changed in 2015 when, together with an artist and an architect, I developed a project called Urban Mind, which was all about understanding why people who live in urban areas are at greater risk of developing mental health issues. And we also wanted to understand what are those factors within a city which might actually make people more resilient to mental health issues. So to my surprise, there was one effect which was by far the strongest, and that was the effect of nature. People who spend time in urban nature tend to be much more resilient to impacts of mental health issues. And similarly, we could observe negative impacts of extreme heat, air pollution. So all of these then got me on a journey to better understand how the environment interacts with the mind to shape our mental health. So to answer your question, what is climate mental health for me? To me, it means recognizing that our mental health is part of a wider ecosystem, and there is no mental health without the health of our planet.
Absolutely. Thank you.
For me, I think there are a couple of different things. We started the organization because when we looked at, I worked in WHO for a while and other parts of global health, there weren't people at the UN and in international meetings talking about mental health, advocating for mental health in the same way they had been respectfully on HIV or TB or malaria. I'd done that work before. And so it was missing. And the second thing that was missing was people from low middle income countries speaking for themselves. So I think one of the things that powered us to start the organization was to enable this, to try and push open the door for mental health, but secondly, to bring people from low middle income countries to be the ones having the conversation. So yes, my organization's based in the UK, but actually over half our team are based in Africa and Asia, and we are deliberately trying to bring people from those regions, based in those regions, to be global advocates. When it comes to mental health and climate change, so we also run what's called the Global Mental Health Action Network. It has 7,000 members in 170 countries. It's a huge mix, and all of you are very welcome, it's free, as a way of engaging people on mental health and again bringing people into the conversations both at a national and a global level. And one of the reasons we started working on climate was because our members were already working on climate. It's already a massive issue for people living in many of those countries, and of course we're talking about Europe as well. And so we could see our members were already trying to make a difference, trying to advocate for change. And so we as an organization wanted to facilitate and support that, but also take those messages to the global level. So we've heard a little bit about it already today, but that's about how do you get mental health up the agenda in the COP? How do you get conversations at the WHO? How do you get national adaptation plans, national determination contributions, including mental health? So we can speak more about that, but that's the angle we're coming from.
Brilliant, thank you. And Thomas?
Can you all hear me okay, I hope?
Yeah. Yeah.
Thank you very much. It's so great to join you. My story, it's interesting. If you go back about 20 years or so, there wasn't the interest in general education about climate change. And so when I was getting started, there was the American Psychological Association had a task force on climate change, and I was getting started as a clinical psychologist with a background in researching nature and mental health. And so they needed people on that task force, and there wasn't at that time any clinical psychologists that were actually studying this issue. So I raised my hand and got involved, and that's led me to where I am today, which is doing some of the early research and since then working in various ways in this area. The idea of climate mental health is such a great question, and all the speakers spoke to different aspects of it. I think in this kind of context, like you're gathering today, one aspect of climate mental health is what I call climate cosmopolitanism, which is really understanding many different ways that people understand the phenomenon of climate change. And often when I'm teaching with a group, I'll remind people of the old parable of the blind people and the elephant, and how when people come upon this big object, they all find different parts of it and think the object is the tail or the head or the side. And I think the climate elephant metaphor is really great for discussions like you're having today, because it is impossible to see the entirety of the issue. We can only really know how we come into it, and we have to have compassion and humility, understanding that people are going to see this issue quite differently. And the best we can do is be a cosmopolitan and really learn to speak in others' languages. And some people are being crushed by the elephant, some people are sitting on the elephant's back. But I think that one way to be healthy is to understand we have our truth, and then there are many other truths, and we work together.
Absolutely. Thank you so much. And I really, really appreciate that analogy. And I think this is a really good opportunity to pivot over to Collins, who's going to be sharing with us a digital story to highlight the African perspective.
Okay, thank you. Okay, next slide, please.
My name is Ashford Salim. I have been living in Mukuru.
I was going to introduce this. So WEMA is a welcome-funded project investigating the impact of extreme weather events on the mental health of vulnerable populations in 4 African countries: Kenya, Mozambique, South Africa, and Burkina Faso. As part of the project, our community members with lived experience of flooding are trained in digital storytelling, and I'll be sharing one of their stories with you now. Okay, thank you.
My name is Ashford Salim. I have been living in Mukuru kwa Ruben for 23 years. I remember the time of heavy flooding like it was yesterday. It was early morning and I was sitting alone at home. I heard a neighbor calling out, "Hey guys, the Kingston Bridge is overflowing and the children need to cross." I pulled on my boots and raincoat and stepped outside. It was drizzling and cold. I could feel goosebumps on my skin. When I arrived at the bridge, I saw water pouring over and many children waiting in their school uniforms. We lifted each one onto our backs and carried them across. My legs got wet and the rain poured heavily. Once the children were safe, we rushed to sit underneath the bridge to hide from the rain. As I was sitting beside my friend, I started feeling worried because I knew that the houses in my neighborhood often flood when it rains. I decided to go home. While walking, I saw a neighbor and asked, "Niaje, umeona mama yangu anywhere ama hayuko?" He replied, "Yes, nimesikia pia yeye akitoa maji hiyo pande." I walked closer to the house. There was water everywhere. It was dirty and the terrible smell hurt my nose and brought tears to my eyes. As I was stepping through the water, I could see trash floating around and feel things touching my feet. I reached home and opened the gate. I found my mother knee-deep in water, using a bucket to scoop water out of the house. I was shocked to see that she was barefoot and her face was dripping down with tears. I called out, "Mom, sai ndio nafika. Wacha kulia, niambie naweza fanya nini nikusaidie." She responded, "Unasema nisilie na vitu zote kwa nyumba zimeharibika. Ingia unisaidie kuweka vitu zingine juu zisianguke kwa maji." As I was entering the house, I saw her boots and asked, "Kwani mbona hujavaa gumboot?" She answered, "Hata ukivaa kuna maana gani na maji inapita mpaka inaingia kwa gumboot ndani?" I was not happy to see her barefoot because I know that the water brings diseases. We stayed there the whole day, removing water and gathering everything that had fallen. When night came, I slept on the chair with my feet on the table. I was shivering because it was cold and there was still water on the ground. My mom slept in the other room. 2 days passed and I noticed that she was not herself. As the days went by, her health grew worse. Her friend offered to watch over her and gave me her phone to call my older brother because we needed to get her to the hospital. Unfortunately, he lived far away and could not help us easily. A few days later, when I entered my neighbor's house, I found my mother just lying there. She had not eaten for a long time. Thoughts gathered inside my head. I could not concentrate because loud noises kept screaming. I had little money and decided to go to the chemist to try buy some cheap medication. I found myself walking in circles, feeling confused. A man called out, "Niaje bro, mbona unahangaika hivyo?" I replied, "Mam ni mgonjwa na sijui kenye naweza fanya kumsaidia." He introduced himself as a community leader and offered to bring doctors to our house the next day. I remember waiting outside the room, sweat pouring, my heart beating loudly and praying that she would be safe. Eventually, they came out, gave me some medicines and told me that she would be fine. A few days later, I got a call from the leader saying that he would like me to register for a youth program called Climate Works. One day, while we were busy collecting trash from the riverbanks, we met some people from the Nairobi Water Company and decided we could work together. Earlier this year, they gave us some gloves, face masks, boots, rakes and other equipment to help unblock sewer in our community. I am so happy to be part of this program because it has helped so many people.
Thank you. So, Collins, on the basis of that that visual story, and you can obviously see the sort of physical, but also the mental impacts on the protagonist in the story. I was wondering if you'd be able to sort of unpack your experience of working with these communities and the vulnerability, but also agency that exists within them. And on that note, what research practices need to do better when working with communities like the ones you engage with?
Okay, thank you. Mukuru kwa Ruben is an urban informal settlement in Kenya. And as researchers, what we've noticed is that we need to move beyond the deficit narratives because people in urban settlements also have agency. While co-creating research agendas and talking about vulnerabilities, we need to also surface their strength. As you could see from that story, that people in informal settlements, they are first responders, they are caregivers, organizers, innovators. So, and we also saw community solidarity coming through and local leadership. So as researchers, I think we have an ethical responsibility to sort of recognize and reinforce that agency while addressing systems that undermine it. Secondly, also, we need to sort of avoid top-down extractive data collection practices. As I said, these are people in the community who have been trained as co-researchers to work with us. So they're not just there to give us their stories, but they're there with us in terms of formulating the study design, data collection and data analysis with interpretation, and they'll be helping with dissemination of the results from the study. So that is what I think meaningful community engagement looks like. And they're also part of the governance structure of the studies. So thirdly, I also think we need to foster long-term engagement. Like a community like Mukukwa Ruben would have noticed waves of researchers come and go, and sometimes they leave nothing behind, but we've built in research capacity development within our project. And hopefully, we don't want this to be a project-specific engagement. We want to be able to engage with them long-term, co-create solutions on the problems that we are identifying, and hopefully with long-term funding, we'll be able to keep that engagement going. So, and then we need to also combine evidence generation with advocacy, because we've just completed a population prevalence of common mental disorders in that community, looking at people exposed to flooding in comparison to those that are not exposed. And we found the prevalence of PTSD to be 44% in those exposed to flooding and 30% in those unexposed. Even regardless of exposure status, the prevalence is so high, 30% in unexposed and 44% in the exposed. I mean, if we talk these findings away in fancy journals with high impact, the policymakers are not going to read it. So that's why it's important to maximize impact, to combine that with advocacy, to turn the evidence we're generating into policy briefs, because apart from the sort of social dimensions of vulnerability that you've all saw through the story or heard through the story, there's also political dimension to vulnerability. We saw evidence of governance failures, infrastructure neglect, and systemic exclusion, and that's something advocacy can address, or probably activism as well.
Yeah. Thank you. Yeah. And I think this is a good segue into the work that you're doing, Sarah. And I just wanted to know, sort of on a global level, what is being done to prioritize climate-related health?
That's a huge question. Maybe I'll answer a little bit of it. I think from our perspective, what we've been particularly looking at is around whether or not mental health is considered at a global and then a national level. At the moment, only 3% of national determined contributions reference to mental health. And of the national adaptation plans, we're seeing around less than half reference mental health, and in the non-health one, and also obviously there are non-health ones as well. But only 5% of national adaptation plans and 22% of health and adaptation plans include specific actions to address mental health. So in very practical terms, what does that really mean? So in a lot of countries, they spend between 60 and 85% of their mental health budgets on institutions. That's locking people up. Think about those people and whether or not they then have a climate-controlled environment in which they're living. They can't leave.
Right.
So is that environment climate-controlled? What happens if there's an emergency? Is there provisions for flooding, for lack of electricity, for perhaps lack of access for staff? What happens from an emergency food distribution perspective in those institutions? So some really practical things. I think another thing for mental health, and I live with bipolar and anxiety, I'm very open about that. One of my concerns is that what about these drugs that cause problems with thermoregulation? Yeah. Does that mean that I'm not going to be able to take my medication anymore? Right. It takes years to develop new mental health medications. What does that mean for the millions and billions of us that are living on mental health with mental health conditions? These are really urgent things. They affect people's lives today. And to what Colin was saying, when we talk to different partners who are working on this issue in different countries, mental health is a concern now. So if you are in the Caribbean, you're a young person trying to go to school, trying to go to university, you are regularly suffering from disruptions in your schooling or your education. It's struggling for people who are trying to work. So when we had COP, in Azerbaijan, we did a series of case studies about farmers and the impact for them of floods and droughts. That's obviously a universal experience now. So there's some very practical things that need to happen today that need to be included in some of these global but also national plans.
Thank you so much, and thank you for sharing openly about your experiences with bipolar and also medication, which I think leads on quite nicely to the next question, and I'll be asking Andrea. I'm also on SSRIs, and that makes me extremely prone to overheating, especially during heat waves such as now. And I wanted to ask Andrea how extreme heat can influence mental health, and alongside people who are on these sorts of medications, who's most impacted?
Yes. So it's important to consider that extreme heat influences mental health through different types of mechanisms. Because if we don't think about the mechanisms, the pathways linking extreme heat and mental health, then we can't develop effective solutions. So we can roughly say that there are at least 4 categories. There are physiological mechanisms, as you have mentioned, those people who take antidepressants, antipsychotics, but also beta blockers and many other types of medication will experience extreme heat in a more pronounced way due to the body's thermoregulation being affected by the medication. So that's an example of a physiological mechanism. But there are also psychological mechanisms. For example, in our focus groups with lived experience experts, we find that young people worry about climate change, worry about extreme heat and how this might affect their mental health. And obviously being very worried all the time is also something that exacerbates mental health issues. There are also behavioral mechanisms. For example, when it's very hot, we all find it hard to sleep, and we know that sleep is key to mental health. We might also exercise less, and once again, we know that exercise is really important for keeping us healthy, not just in terms of our physical health, but also our mental health. And finally, there are social mechanisms. For example, during periods of extreme heat in a city like London, young people report becoming socially isolated, and over a number of days, this can really affect their mental health. So it's really important to consider the mechanism at play, and of course this is going to be specific to each group and specific to each location, which means that solutions will also have to be developed in a context-specific way. And this takes us to the next question, which is, who is the greatest risk? So we know that there are well-established risk factors, particularly those people who have an existing physical health condition or an existing mental health condition are at greater risk of a mental health crisis during a heat wave, but also those who have a limited mobility or a learning disability are at greater risk because they have lower capacity for adaptation. It's already been mentioned that certain types of medication interferes with the body's thermoregulation, so that also increases risk. And also we know that people with lower income, or people who don't have access to cool spaces, like the homeless, they're also at greater risk, because once again, they have a limited capacity for adaptation. And interestingly, age is also a factor. Young people are at greater risk of experiencing mental health problems during a heat wave. Particularly, they're at greater risk of suicide, whereas older people are at greater risk of depression. So we need to be mindful of that. Now, I've mentioned quite a few groups who are at greater risk, but it's important to also think about protective factors. And I just want to mention two of these. So one is social cohesion. If someone reports having strong social connections within their community, with their families, friends, they will have less of a risk to experiencing mental health issues during heat wave. And the other one, which I feel very strongly about, is a tree canopy. If you live in a neighborhood with higher levels of tree canopy, of course this will mitigate the urban heat island effect, which means that your home and your neighbors' homes will be not as hot. And this is really important because, as someone mentioned earlier, we spend the majority of our time in our homes. And I personally feel that there's so much evidence for greening our cities, indirect effects through the mitigation of the urban heat island effect, but also direct effects, because having trees, plants, is something that directly benefits our mental health, helps us make us more resilient. So the evidence is there. We just need to embrace it and implement it.
Thank you. And Thomas, I'd just like to kind of build off of that, because these are sort of preventative measures and perhaps more sort of wider systems change measures within urban environments, but you focus on trauma-informed care. And as like psychologists, I'd just like to sort of describe what that looks like and explore perhaps what's missing from the conversation.
Yeah, that's a great question, and I think we can do our.
You on mute? There we go. I think
Is
we
that
can
better?
hear you. Yeah, we can hear you now.
Thank you. Yeah, it's a great question, and I think we can all do our own work. Everyone that's attending today. I mean, there's basically three kinds of mental health impacts of climate change. There's the direct disaster impacts that we've been hearing about, like the young man with the floods, and then there's the indirect impacts, all the ripple effects through society, refugees, migrants, issues with the economy, or with sufferings of incarcerated people. And then we have the vicarious impacts of just sitting and observing the dangers and the damages, even if we're not in harm's way. And we can ask our own self these questions: what have we experienced? So when we're thinking about trauma, we can think about, well, has your trauma been through directed disaster, or concerns about the economy and your business, or just your ethical sort of suffering with the weight of this? And that's an entree into this. The general trend has been, unfortunately, that many of us, even in this gathering, have sat with the vicarious impacts for quite some time, if we have certain values and ethics. But the disasters are all finding us, and when people are actually exposed to a disaster, that's often when they're kicked over into this action phase that we're talking about. But underneath this, there's a saying in therapy: we hurt where we care. And so the reason that this is traumatizing is because these issues or events impact our values, impact our identity, impact our ethics. And so the key here in treatment is, we're not trying to create more victims, we're trying to create more survivors. And we need to check in on what values are being impacted, what ethics, what meaning. And when we focus on people's values, and maybe later on I'll talk about environmental identity, but when we get into people's values, identity, and meaning, this is what's being threatened. And when they can express those things, that becomes their foundation for action.
Brilliant, thank you. And I wanted to open this question up to all of you, because you've all offered very different perspectives on climate change and mental health, and we've perhaps spoken about it more broadly. But as we know, the term eco-anxiety has become quite a popularized term to describe a lot of relationships between mental health and climate change. And when I was researching for my book, one of the things that was really evident to me, especially when talking to activists from frontline communities, is that they didn't really resonate with this term eco-anxiety, and they also felt like it had an element of futurity which didn't account for the trauma that they had experienced as a result of systems of oppression intersecting with climate change. And so I just wanted to ask, how do we ensure that this conversation stays inclusive and relevant to those most affected? And in your research, is this a term that people ascribe to? Did they feel like they related to it? And what other offerings could you give to people who don't necessarily relate to this term eco-anxiety?
I can start. In the network that we run, people don't subscribe. Eco-anxiety is that thing that the West or high-income countries are talking about. I mean, that may not be experienced for everybody, but certainly for quite a lot of our partners in Africa or Asia or Middle East, it's not an existential question. It is a reality every day. So the anxiety piece, it goes beyond kind of an anticipation, I guess, is I think what you're getting at. So certainly it wasn't a term that resonated, but when you talk about, and even climate change, the environment as a whole is changing. Exactly. So we'll come later to air pollution. We'll talk about other things that are impacting people's environment. So it's seen as, for many of our colleagues, it's seen as something that's in a broader way, changing the overall way in which we live. And how do we adapt for that, and how do we change for that? But also, frankly, we're quite angry. Like, why should we have to adapt and change? People are very frustrated. They're frustrated with the polluters. We've heard a bit about that, but I feel like we haven't heard enough frustration and anger yet. There's been a lot of quite passive conversations today, but people are really angry. So I think that also comes across sometimes in some of the work around mental health, which is the anger and the sense in which how do we make sure we don't feel futile in the face of really difficult changes and challenges. And then how do we redress that balance through government action, but also, to the point earlier, critically community action as where something where you feel that you have a direct impact and can feel a value.
Yeah, absolutely. And I was reading some research papers a few years ago that suggested that anger was actually a more powerful catalyst for taking action and mitigating experiences like eco-anxiety than the actual feeling of eco-anxiety and the paralysis that comes from it. Collins, I wanted to ask you, from the African perspective.
Yeah, so one of our digital stories in South Africa actually captured eco-anxiety quite nicely. But the background to that was that in 2022, South Africa experienced catastrophic flooding that sort of resulted in about 600 fatalities, 20,000 homes were destroyed, 40,000 people displaced. And then just last year, a tornado tore through one of the towns, killing some people. So now, as soon as the skies become overcast, people start to get anxious, they look really worried. Those I work with start to pack up and leave because they don't know whether if it starts raining, if it will stop raining. Like the last time, their experience of 2022 is just left them with this chronic anticipatory mental health effect. So people get really anxious as soon as it starts raining in South Africa now.
Yeah.
So I'm no expert in eco-anxiety, but to me, it often sounds like almost like a sort of illness that some people have, or we need to help those young people who have eco-anxiety. Actually, to me, it seems something that is a completely normal response to the situation. What we need to do is address the causes of eco-anxiety from the outset. So I think it's a tricky concept because, as I said, it's often presented in the media in a pathologized way, whereas actually it's a healthy response to a very urgent situation. So I'm just thinking, perhaps trying to frame all of these not as doom and gloom, but in more positive ways. What can we practically do to address things, and sometimes even simple things like starting a vegetable garden, doing something within your community, which will increase social cohesion and will also increase the amount of plants and trees. It's a win-win because it brings direct benefits to the individuals and the community, but it also brings direct benefits to the environment where these people live and work. So yeah, I think it might be time to reframe eco-anxiety as a normal response.
Absolutely. In fact, that's some of the work that researchers like Caroline Hickman are doing at the University of Bath, where she tries to depathologize an experience like eco-anxiety, because it's truly a rational and adaptive response to the times that we're living in. And I think that leads on quite nicely to this conversation around prevention and also the true causes of something like eco-anxiety and other ill mental health in response to climate change. Because to me, I argue that actually dismantling the fossil fuel industry is good for my eco-anxiety, as 86% of all carbon emissions in the last decade are owed to coal, oil, and gas. And on the subject of prevention, you know, as a psychologist, Thomas, what would you argue are some really important preventative measures to ensure people's well-being in a time of climate change?
Yeah, that's a great question. Coming back to eco-anxiety, you know, there's an elephant of eco-anxiety because there's many different ways to think about it. The term eco-anxiety, you know, really emerged in the early aughts around people's concerns around chemicals in the environment. Actually, it wasn't originally used for climate change. And so eco-anxiety is literally ecological anxiety. It's threats coming from systems around us. And it's going to manifest differently. And so rather than getting caught in the vast number of threats, again, coming back to our values and our identity, everyone has an environmental identity, a way they think about themselves in terms of nature and the natural world and their place in global systems, and their basic values that are threatened by climate issues, either idealistic values for oneself or altruistic values or ecocentric values for other species in the system. So I think turning the conversation to the person's identity and their values is really helpful. It depends on the person. Some people have this somewhat well developed, and then they can just tap into this. And then for other people, it's more implicit, and we need to be educating ourselves about this. And some people obviously live in nicer places in the world where they can have some positive connections with nature and the natural world, and other people, again, are on the front lines of social justice and change. But really, bringing it back to our environment, our environmental identity, our environmental values is the first step, because that's empowering. That's empowering. And then the basic mental health goal is to expand our capacity in two directions. One is to deal with the difficulty, because there's a learning curve in this work. As you get involved in it, you're going to learn about a lot of troubling issues. But there's also a learning curve in terms of the positive side. Think of all the expertise that you've seen today and all these people that are working. There's a paradox that it's quite inspiring to get involved as well, because there's a bright ecology of all the positive things you learn. So almost the biggest challenge is building our capacity to take in the good, because our nervous system is naturally going to focus on threats. So how can we balance and take in the good honestly, legitimately? That's not bright-siding or anything. That's literally the reality of the situation. Think of all the gifted people that are gathered today. And how can we help people sit with both of those? And then the art is balancing where people are at any given moment. All of us can fall into feeling disappointed and scared and gloomy at different times, and then helping people toggle between the dark and the light.
Brilliant, thank you so much. And my final question to all of you is, if you could challenge this audience to act on one piece of information from today's discussion, what would that be? Collins, do you want to start?
From the context of climate and mental health, I'll say plant more trees.
Amen. Andrea?
Yeah, so I'm going to say something similar. I think in this conversation, there is a bit of an elephant in the room, which is the fact that, while we all say that we need more trees, we need to connect with nature, actually, plenty of research is showing that the opposite is happening. we are becoming more and more disconnected from the natural world. And this is especially true for young people. The ones who are most affected are going to be most affected by climate change. Their life is becoming increasingly screen-based. And this, I think, needs to be part of the conversation. So, going back to what you've just said, my invitation to the audience would also be to not only just plant a tree, but maybe create a mini meadow in a tree pit or start a vegetable garden. It doesn't really matter what it is, but I predict that that intimate relationship with nature that you develop when you're actually touching a plant, a tree, you're planting a seed, you're seeing a seed grow. It's something really powerful that changes the way you think about yourself within the environment. And also you then find yourself talking to your friends, your family, your community, and you're kind of influencing other people in a positive way. So to answer your question, plant a tree, start growing your food, and plant a mini meadow or anything else.
Thank you. So this is a mental health session. Those are great and really important, but I guess it would be beholden on me as a mental health advocate to say break the stigma. Mm-hmm. Start talking about your mental health in the way that, I'm very grateful that Tori also spoke about it, but start talking about your mental health and talk to other people. And you've heard some of who may be most vulnerable, but also some solutions and ways of supporting people. But when it comes to mental health, it needs to start with breaking the stigma.
Thank you. Thomas?
Yeah, great question. I think in terms of mental health, we need to see if we can transcend a fixed mindset in general about how we think about ourselves and problems and develop a growth mindset that we can grow and change. And that includes ourselves, our families, our communities, and also the world. And that allows us to sort of imagine what happiness and flourishing might look like in the world as it is now.
Brilliant. Can we please give a massive round of applause to our amazing panelists? Thank you so much for joining us. And next up, I would like to invite Vanessa Nakate and Ava Lee from Global Witness to present a short presentation.
Alan was telling me about you just now.
Hi everyone, my name is Vanessa Nakate. I'm a climate justice activist, a researcher at E3G, and a new trustee at Global Witness. And this is Ava, a lead campaigner on big tech and climate change at Global Witness.
Thanks, Vanessa, and thank you for the brilliant panel just before. So we've heard a lot about the mental health impacts of climate change and what we should be doing at a society level and also individually to help combat that. I wanted to talk about something else that can actually be improved relatively easily, but this time by social media companies. So I'm going to share a couple of stories with you and also hand over to the brilliant Vanessa to talk about her experience of being a very well-known and in the public climate activist. So first off, climate scientists. I think we can all agree that we want them to keep doing their work and being able to talk about it. So we polled climate scientists from all over the world to find out about their experiences online. And the findings were really shocking. We found that half of the climate scientists that we surveyed had experienced online abuse. 1 in 5 reported depression. Almost 1 in 10 had received death threats. And all of those numbers significantly increased when we were talking about climate scientists who are regularly in the media and who regularly have publications. And perhaps unsurprisingly, nearly half of them said that their experiences had made them think twice about talking about their work, both in the media and online, and even question whether or not this was work that they wanted to continue doing more broadly. But it's not just about climate scientists. The BBC looked at their own weather presenters and the experiences that they were having online. So I've shared a couple of quotes here from some of their weather forecasters. This one particularly stood out to me. My legs were shaking, my hands were shaking. I was trying to hold it together on air. Obviously, you've got a job to do. You have to present something to the public. I felt I had a job to do, but I also felt very anxious and scared at the same time. And that was Alexis Green from BBC South Today. And at Global Witness, we are about to bring out the first of its kind poll looking at climate activists and environmental defenders from all over the world. I can't share the exact results with you yet. That's coming out next month. But there are a couple of stories that really stuck with me. So Disha Ravi, who many of you will have heard of, a young Indian climate activist, shared how when she first started posting online about the work that she was doing, a really horrible disinformation narrative spread about her, saying that she was pregnant and single, and at the same time people posted her address online. So her mother and her family were hounded in the streets. She also received loads of gendered abuse, particularly in her DMs, and threats of violence and threats of sexual violence. At the other end of the world and the scale, we spoke to George, a Jesuit priest from Germany, who, when he started going online, he did it just because he'd got into climate activism. He was basically pushed offline and pushed away from climate activism because, again, people were spreading false narratives about him. This time it was a disinformation story that he was only getting involved in climate activism so he could get closer to young people, so he could abuse them, which obviously was something that really has pushed him away from wanting to do any of that work and wanting to speak about it more publicly. Now, I'm not claiming that this is only because of social media. You know, this hate has happened for a long time, and to quote Taylor Swift, haters are gonna hate. However, social media companies can do something about it, and right now what they're doing is making things much worse. So the fact that there is this engagement-seeking business model, that they want to keep people online for as long as possible, and that they know that hate and anger and disinformation is what keeps people online the most, they promote that. It's clear that that's what they do. And we also know that they are reducing their trust and safety teams, their content moderation teams. Elon Musk did that as soon as he took over Twitter, now called X. And Mark Zuckerberg also made those announcements as soon as Trump was inaugurated, that he was also hugely reducing their content moderation teams. So these are all things that can be switched, you know, like they could be turned on tomorrow if they wanted to. We saw that in 2021, on January the 6th, Meta instituted these break the glass measures literally in an instant. These are things that they can do if they want to, and they could do them tomorrow. But enough of me talking. Vanessa, it would be great to hear about your experiences of being so in the public eye as a climate activist.
Yeah, thank you so much for sharing, Eva. Well, social media did a great job in helping me in my activism. However, that came with also its challenges. I think with social media, first of all, if you are a young person getting into activism of any form, if you share anything, you're going to find people saying you don't qualified enough to talk about these issues, you don't understand how the system works. And if you are a woman, it's also different because you're going to receive attacks on your physical appearance, you're going to receive attacks on how you speak. With every video that you share, there's going to be someone saying you're too loud or you're being too bossy and women are not supposed to be like that. And that's something that I have seen myself, especially coming from, you know, a background where we've been taught how women are expected to behave. And the other is being a Black woman. That also comes with its own challenges on social media because we still live in a world where people don't think that Black people deserve to be in spaces or they deserve to share on issues like climate activism on social media. For me, my biggest challenges with social media have been on those 3 points. when I started activism, being a young person and just being a woman and, yeah, being a Black woman as well.
Oh, thank you, and I'm so sorry that's been your experience. Did it ever make you think twice about the work that you were doing, being on social media? Yeah, how did it impact your work?
Yeah, when I was much younger, that was like 6 years ago, I mean, the world expected young people to constantly show up, and I would say that the youth movement, we got so much pressure to show up always. So even with attacks on social media, we kept on going and responding to, reacting to every government post or everything that fossil fuel companies are doing, because we just felt this pressure to constantly speak up. And in a way, I feel like we were not protected from the dangers of social media. And it's later on that I realized how impactful this was for me, because 6 years later, I started to just feel so tired and so exhausted. And I actually deactivated my Twitter account, my X account, like months ago. And it was hard for me to do that because people always expect us to show up. But I decided to show up for myself because it was having a lot of impact. Yeah.
Oh, thank you. Did you ever reach out to social media companies? Did you look at any of did you report any comments that you were getting, and did you receive anything back from them?
I did report some comments. I blocked some people. I muted some notifications. But I don't think if I'd written to Mark or Elon, I don't think they would have responded. Yeah, I wouldn't know how to reach out to them.
No, fair enough. What we have found with the people that we've been reaching out to with this survey is even when people are reporting, like real threats of violence, that they're just not getting anywhere near the type of responses that they need to get from all of these companies. And I know that we're over time, but just in the last minute, do you have any advice to other young climate activists and how they might also show up for themselves while also showing up for the movement online?
Well, it's really hard to advise fellow activists because the fact that they're showing up and speaking up on different social issues like climate, I think that that's really commendable. The activists that are speaking out bravely on Free Palestine, like my friend Tori, Greta Thunberg, I think they're all doing an incredible job. I think my advice would be for all of us to take care of ourselves as well. Sometimes it can be really hard not to stop. I have experienced that. There is a time when I said yes to like 5 invitations that were happening in 1 month. And I didn't know how I did that. I didn't know why I did that, but I just felt like I needed to show up. I think it's really important for us to know when to stop or when to pause. And also it's important for the older generation to really protect younger people in this space, because sometimes when you are young, you just don't know when to stop because even the world is demanding so much from you. Yeah.
Thanks so much, Vanessa. And
thank you.
And a final QR code from us. If you'd like to see the report, will be coming out within the next couple of weeks. Please do sign up. I'm conscious we're standing between you and lunch, so we'll let you go. Thanks.
Thank you.
Very much. Thank you very much, Ava and Vanessa. It is lunch now on the 2nd and 3rd floors. We'll be back at 2:35 sharp, where we'll be hearing about water and air. It's got quite an elemental theme to it. And we'll be hearing about leadership from Mary Robinson too. So join us then. Thank you. Bye-bye. Hello, everyone. Welcome back. I hope everybody enjoyed their lunch and had a chance to catch up and discuss and talk about the things that they heard this morning. One thing that none of us can escape is the air that we breathe. And in this very city, it's estimated that about 4,000 people will die of air pollution-related illnesses in every year. So the question is, what can we do about that? Now, we have a panel to take us through the possibilities. So please welcome to the stage our panel on tackling the health crisis of air pollution, moderated by Alejandro Colsa of C40 Cities. Thank you.
Hello, everyone. Can everybody hear me? Yeah? Hi. Thank you, everybody, for staying after lunch. I hope you had a great lunch. And I wanted to welcome all of you to this panel. I wanted to start by introducing myself, Alejandro Colsa. I lead up the Breathe Cities initiative within C40. And Breathe Cities, it's a global initiative helping cities drastically reduce air pollution and protect public health. And we do that jointly between C40, the Clean Air Fund, and Bloomberg Philanthropies. And I'm very excited that we're here on the first day of London Climate Action Week with a session on tackling air pollution and health. More often than not, I find that air quality doesn't have the prominent spot in climate conferences as it should have, and I'm glad that we have it here today, and that I want to thank the club for really hosting us today and this incredible panel. And it's very important because air pollution and the climate crisis are heavily linked. They share many of the sources, they also share many of the solutions. But it really is health and the health and socioeconomic inequalities that put the human angle in the focus of all of our action. And we're going to hear today many of the stats on the negative health consequences of air pollution. And I think it's just important to understand that of all the things that are around climate action, sometimes air quality and cleaner action can be that first point of contact with communities that can really get them motivated to interact and to partake on the changes that are needed on the climate. So today we're here with an incredible panel that we're going to bring together the science, we're going to bring together the personal experience, philanthropy, city action, health data, to really understand how clean air, not just as an environmental issue, but also as a human right and a smart health investment. So we're going to start with a presentation by Professor Zombo Shi. He's a professor of atmospheric biogeochemistry at the University of Birmingham. And then we'll join the rest of the panel, which we have Jane Burston, is the CEO of the Clean Air Fund, the leading global philanthropic effort to tackle air pollution through policy, data, and public engagement. We have Marina Romanello, the executive director of the Lancet Countdown. We have Agnes Agipon, founder and CEO of Global Child and Maternal Health. And we have Elliot Terhane, assistant director for connectivity, air quality, transport, and infrastructure, a big portfolio within the Greater London Authority. So we have this brilliant panel, but we want to start with a presentation for Professor Zombo.
Thank you very much. I'm Zombo Shi from the University of Birmingham. So to start with, I'm saying, what is air pollution? I don't know how many people are very familiar with the air pollution. Two biggest air pollutants that worries us is particulate matter and nitrogen dioxide. So just think about the particulate matter. So the ones that really worry us the most is called PM 2.5. Those are the particles that are less than 2.5 micrometer. How small they are? The size of your hair is about 70 micrometer. So it's about 20, 30 times smaller than the diameter of your hair. So you cannot see them. However, they can get into our lungs. So the ones that worry us the most is called the PM 2.5 earlier. They can get into our lungs. And then the even smaller ones called PM 0.1 is particles that are less than 100 nanometer, they can break into the lungs and go anywhere in our body. So you can see from that figure, it can go into our brain. That's not helpful. That's not good for us. So how many particles we're breathing every breath? It's about 2.5 million particles. Think about it. We have to get rid of them. Even that's 10% of the deposit. We have to get rid of them. That's hard. It takes, energy, takes our body to fight against them. So they're not good for us. Now, we all remember COVID. Everyone do. I'm pretty sure. 3 million premature deaths in 2020. But if we look at the health impact of air pollution globally, every year, it's about 7 million premature deaths. We have put so much effort, we're worried so much about the COVID, but our emphasis or our energy hasn't been goes anywhere close to air pollution, even though that's a much bigger health problem. Now, I'm not saying COVID is not a big health problem. For the UK, the air pollution has air quality improved. So we're talking about 30,000 premature deaths every year now, which is good. It's reduced from 40,000 earlier. But the cost is £27 billion every single year. But air quality is not just for everyone. It's a big inequality issue. If you look at across the UK, the figures may be a bit complicated, but on a y-axis basis is the concentration, on the x-axis is basically deprivation. If you look at on the right side towards you will see that basically the more, the richer population has a lower concentration. The other side is the most poor also has relatively lower, that's mostly like rural areas. But the air pollution in the UK caused about 6 months reduction in life expectancy on average for the whole population. However, that's not the same for everyone. For some people, that's 70 years. For the little girl called Ella Kissy Deborah, who tragically died in 2013. And the medical record have the first time gave that contributory because of the air pollution. And she died when she was 9 years old. So it's not the same for everyone. But, we have made huge progress improving air quality. And that brings huge health benefit. If we're looking at what London has been doing, the first ultra-low emission zone, look at one of our studies, recent studies, which hasn't been published yet, is the first phase of the illness has reduced nitrogen oxide substantially. If you look at in the center, the really green space. But that also have a benefit to outside London as well. How does that come? Because that policy had promoted people to change their behavior. That is, from my personal view, probably the most important impact. If you look at it globally, look at the figure on the right side, you'll see that over the time, the death attributable to air pollution has reduced substantially over time. And the UK is one of the cleanest places in the world, but we still have a big pollution problems. The other thing I want to talk about is we are talking about climate here, so why air pollution is such an important thing here. Climate change and air pollution are the two sides of the same coin. So a lot of the sources of air pollution and climate change are the same. So when we take climate actions, we're not only reducing carbon dioxide, we're also improving the quality, bringing health co-benefit. So this is a study by one of our colleagues, and you can see on the y-axis is the concentration, but over time, when we are taking climate actions, we're reducing air pollution, the PM2.5 pollution. But one thing we also need to remember that, yes, we're going to improve air quality, we're going to improve health, but if we didn't do it properly, we could left those most vulnerable people behind and it become worse off. For example, when we make our homes more sealed to reduce energy consumptions, there is a possibility that the most vulnerable, poorest population who will suffer because they don't have enough money to heat their homes. With the problem will be then they will have the potential indoor air pollution problem. So thank you very much for your attention, and this is a part of the research that's funded by Wellcome Trust and also UKI and NHR. Thank you very much for your attention.
Thank you. Thank you, Sombo, for highlighting the urgency of the challenge that we're facing. Now would like to move into a section where we're going to ask questions to the panel. I think we're quite short of time, so I'm going to ask my panelists to keep it short and sweet, so that I want to make sure that we have 5 minutes for audience participation. But I want to start with you, Professor Sombo. Just to follow up from your presentation, you've talked about, data really can highlight a lot of the negative impacts, but also the positive stuff and the importance of equity. When it comes to the data that you've seen, what are some of the real wins that you might have seen following specific policies, and particularly in equity? How easy or hard it is to really be able to quantify improvements on the inequalities when you take bold action on air quality?
To answer your first question about what works, I mean, there are lots of examples across the world. The UK is a leader. And by phasing out the fossil fuels, we have substantially improved our air quality. That has been, proven elsewhere. But also there is a potential problem like other solid fuels, like a wood burning, which is probably, from my point of view, is not that essential in terms of for heating, but they have a huge problem for the UK at the moment. In terms of how do we quantify the impact of those on the inequalities, we have to have the kind of data in a finer scale, and that data should be linked to the health impact as well, which is typically pretty hard to do. So you have health data, you have the environment data, they don't link, and then you can't really use them. I think there are ongoing efforts in trying to do that, but only when there is a wide access to such kind of data, we'll be able to better quantify the inequality impact, but also to quantify the benefit over time, how the air pollution decrease would have resulted in a better air quality and a health, and also reduced inequality.
Thank you. And Marina, maybe I'll jump now to you, linking to this. So there is, Professor Sombo was talking about the different types of data and how they talk to each other, might not talk to each other. From your point of view, from a public health system perspective, how do you feel is working? What it's working, and how do we feel that the health systems are treating this as the emergency that it is, based on the data that is coming out of incredible research such as the one from Professor Sombo?
Well, I think Professor Songo made it very clear when he showed us the COVID graph, right? We're not really treating this as the huge health emergency that it is. We know that air pollution is one of the biggest factors of ill health and death globally. It's a silent killer. And because it's so quiet, because it's so silent, we struggle to respond to it. People don't just drop dead from air pollution. Right? People have chronic illness that overburden our health systems, that reduce our labor capacity, that deteriorate the quality of life, that increase the burden for care. And the full range, we generally measure it as the tip of the iceberg, right? We generally measure mortality, but mortality is really just a very small tip of the iceberg. The big problem with air pollution is the huge morbidity, is the huge impact that it has from young children to older adults throughout the whole life course. So we're not really addressing it with the urgency that we should, most definitely. There's also stories of success. As you mentioned, we estimate through our data that about 150,000 deaths were saved every year due to improvements in air quality, mostly because of reduction in the use of coal. So we have a lot of low-hanging fruits. We know that in urban centers, the biggest source of air pollution is generally road transport, and we know that shifting away from fossil fuel-based road transportation towards more sustainable forms of travel can not only reduce air pollution, but also make cities more livable, reduce traffic, improve people's quality of life and underlying health conditions by improving active travel, improving walking. So I think there's a need for a system change around particularly in our cities, to make sure that those cities are built around people's life quality, people's health and people's well-being, that we're not quite doing. So it's, I think, beyond the health system itself to all of the broader determinants of health.
Thank you. I feel there's a nice segue there with, from the health systems to then who are the health systems serving, which is the community, and what are the perceptions from the community about whether this is being done well or not. And Agnes, I'd like to ask you, many years you've been telling the story of how, from your own family experience, have you got engaged in advocacy for clean air. And I just wanted to gather from you, based on this experience, what do you think is missing at the moment of that link between a health system that is for the community and then the link with the policymakers that are then trying to, kind of walk around this very complex issue?
Yeah, so I think it's two. I think it's community engagement, and I think it's lived experience taking center stage. I'm not ashamed to say I'm the least likely clean air advocate. I always say, what am I, you're inviting me? And that's because it was just not a conversation that I had growing up around environment, around clean air. I'm born and raised in Southeast London. That's the only air I know. What's cleaner than the air I've been breathing all my life, right? But then my daughter got sick, and I kept on going back and forth to the doctors, and they kept on fobbing me off, and she kept on getting admitted into hospital. And in a very short period of time, between the age of 4 and 5, she was admitted finally, because I had to pick her up from school, with community-acquired pneumonia, which at that time was one of the leading causes of death of children 5 years and under. And at that time, I didn't know about, again, clean air, I'm just a concerned mum for my daughter. And then as I start researching, I find out I live in the same borough as little Ella, that we kind of saw earlier. At that time, I was heavily pregnant, and I still am a maternal health advocate. And I was really shocked that, hold on a minute, even though I started off saying I'm one of the least likely, there's a black maternal health crisis happening at the moment in the UK, where, and I would say in America as well, where black women are nearly 4 times more likely to die in pregnancy, twice as likely to experience a stillbirth, and a whole host of other reproductive health issues. These things do not just happen when you rock up to the hospital. You don't just develop cardiovascular heart disease and so forth. So with what was happening with my daughter, coupled with what I was seeing in the work that I'm doing around black maternal health, I could directly see a link, but nobody was speaking in my language and speaking directly to us. So I developed an organization, at that time was called Global Black Maternal Health, which was about putting research back into the hands of black communities as leaders and change agents, and looking at the engagement and actually speaking directly to black women who were either pregnant or had children 5 years and under, to understand what are their attitudes, what are their knowledge, and what is their behavior around air pollution, so that at least then when we're looking at the data, we're saying, okay, then how do we communicate this message? But also, the families will tell you, right? There's a language. I know we spoke about kind of eco, right, earlier on, I forgot the other part, but we were speaking, that's not how I and anybody in my community would even engage, or because we don't have time to fragment these issues. We're dealing with a whole host of different issues within our community. So for me, it's really about then engaging the community, engaging in a way that the language is not exclusionary, right? And then building from there.
Mm-hmm. So we've talked about a little bit about the data and what we're seeing from the analysis that we're able to do. We're talking a little bit about the need for system change and the way where we are approaching many of our public health interventions, but we also the need of engaging the community in the way that actually would help them mobilize and continue to support this work. So I want to now go into solutions-oriented and a bit highlighting the good stuff that is happening on the ground. And perhaps, Jane, if I can start with you, you've seen dozens of amazing examples through the amazing work that it's done through Clean Air Fund, through Rich Cities. Like, would you maybe share with the audience 1 or 2 of those, top of the class where you feel this has been done well and it has yielded these positive co-benefits for both health and inequalities?
Yeah, absolutely. And we see a lot of mayors taking ambitious steps towards reducing air pollution, I think because they're closest to the people, but it is never done without the data and without the community groups. It's always a partnership. So one example of huge amounts of success actually is Warsaw. Clean Air Fund has been working there since 2019, and we've seen over just a 3-year period air pollution reduced by 15%. So that is massive. It's also massive that they have measured it, and that's facilitated by some low-cost sensors that we launched with the Breathe Cities initiative. They've done 2 things. One is a ban on coal use for domestic heating. Everybody was using these stoves that they call smokers because they're so bad. They're just puffing out black smoke. And it was quite an interesting move because they banned them in the middle of the Ukraine war when everybody was very worried about energy security, which they still are. Poland is the 2nd largest coal producer in Europe, so they feel like that coal is where they retreat to for energy security. But it was because of these health impacts that we've heard about that citizens were still getting out on the street and saying, we can't have this anymore. Our kids have asthma. The health impacts are too big. So the central region of Masovia banned coal-burning stoves. Warsaw started it off in October 2023, and then the rest of the region is going to copy in 2028. The second thing that they did was they've launched Eastern Europe's first low-emission zone for vehicles. Poland has some really old cars. I think at the time the average age of a vehicle was 14 years. Actually now, interestingly, it's getting older as there's more clean initiatives in Western Europe and we're selling our cars to the east. But it's hard for them to put in bans because of European Commission and Union rules. But yeah, average age of the vehicles was 14 years. And what they found when we did a study on the actual exhaust emissions of the vehicles is that 6% of the cars were producing 1/3 of the pollution. So a clean air zone is quite a good way of being restrictive just for a portion of the population with benefits for everybody and a real significant increase in clean air for the citizens. I think just to add before I finish, this isn't just a kind of developed country thing. Through this Breathe Cities initiative that you mentioned earlier, there's cities around the world that are starting to do the monitoring and the health impact studies that will set them on a path to cleaner air. And we just saw last week, I think it was, that Nairobi launched a low-cost sensor network of 50 sensors around the city. And the importance of the number is if you can have a sensor in lots of different neighborhoods, then you can see who's breathing the dirty air. It's not just 2 or 3 big kind of reference grade monitors on major junctions. It's in every neighborhood. And you can make the data available to citizens who want to campaign, like what is the pollution on my street? How might it be affecting my child? There's youth groups being mobilized around these African cities to then showcase the data to politicians to say, we want something to be done and can we be part of the solution?
Amazing. And yeah, there are all these cities that, for example, like from Breathe, have started to make this ambitious action that we're hoping it will, and we know it will, yield those results that we have seen in many other places. And I think moving on to, we're in London Climate Action Week, and we have an amazing guest, which is Elliot. We can speak about the incredible experience that London has had implementing very bold, ambitious, cleaner action. And Elliot, ULEZ and the overall package of air quality measures that London has put in place since 2016 is often cited as one of the key examples of how ambition can't yield those results. And from C40, a lot of our cities they look at London, and even though contextualizing that every city is different, they see it as when you put ambition to words to actual action, it could actually yield those results. But would you tell our audience, Elliot, from your experience, things that maybe you learned from the process that you would advise other cities so that we can really try to ensure that it's not just positive stuff, like there is also very difficult decisions and processes. So are there any learnings that you would highlight on what has been taking place in London in the last 8 years?
Yes, absolutely. And maybe just to echo a little bit what Jane was saying, is that we know that these tools that we're using, that these policies can be hugely impactful. And that's because we do have data. That's because, much like Jane was talking about Warsaw, we've also been a Breathe City. We set up a program called Breathe London, which built on a long program of air quality monitoring that we have done in the city since the mid-90s. So we've been able to track and understand some of the biggest sources of pollution in the city, and that has helped us design the approach that we've taken. So the ultra-low emission zone is probably the most well-known of those interventions, but there's also been work we've been doing around promoting walking and cycling, around switching vehicles to zero-emission vehicles, to cleaning up our bus and taxi fleets, and that package as a whole has been very, very important. And we've seen some really transformative and important impacts in London. So thanks to the ultra-low emission zone, we now think there's been about a 27% reduction in roadside nitrogen dioxide in the city, which again is a huge impact. But as Alejandro was saying, these things are not always easy to do, and we've got to be very mindful of the impacts that they can have. And one of the things that we were very keen to do when we were implementing the ultra-low emission zone was to think, how can we help people make the transition to cleaner vehicles? And that's why we introduced a scrappage scheme, which was designed to help people, if they need a vehicle, to scrap their old one and then be able to maybe get a new one. But a lot of people actually, thanks to the other improvements that we were making, actually were switching to walking, to cycling, and to public transport. And the investment that we've been making there has been very, very important. And I think for people to have confidence in, or to think that a scheme like the ULEZ is an appropriate one, it's really important that we're leading by example. And that is why we invested a lot of time and a lot of money in cleaning up our bus fleet and our taxi fleet. And it was interesting, again, Jane highlighted in the Warsaw experience, a very small number of vehicles were responsible for a very large amount of the pollution. And going back to 2016, our bus fleet of around 9,000 buses were responsible for about 20% of our NOx emissions. So again, that's why we really targeted and have focused improvements in our bus fleet. We now have the largest zero-emission bus fleet in Western Europe, with plans to go further and to have a fully zero-emission fleet by 2030. So it shows you what you can do, but you do need to take an holistic approach. You need to think about, I think Agnes's point was absolutely crucial, talking the language of the community, understand what's important to them, explain what you're doing, and we're still definitely learning. We are not there by any stretch of the imagination, but we are, part of the reason we engage in groups like today is to be able to share and to learn our experiences.
Thank you, Elliot. And I think I'll take that point on data that you mentioned about Breathe London, and also Jane, how in Warsaw, by communities being aware and not stopping, they actually were able to get the kind of policy changes they were demanding. So Marina, from your point of view, are there other examples where maybe using data for building momentum and driving action, either where cities have got it right or maybe where cities have got it wrong and that others can learn?
Yeah, look, I think those examples were kind of quite phenomenal and quite representative. I come from Buenos Aires, that is a C40 city, where there has been a big restructuring of our city, our urban center, much of it around shifting away from fossil fuel-based transportation with enormous benefits to health, really, really substantial benefits to health. The public engagement has been horrendous. So to your point, I think you make a very crucial point, the public engagement, the benefits, and the consultations with the local population, I think there is where perhaps the data and the political action do not come together. So I do think that there's a lot more that we need to be doing about understanding. We know the data, we know the sources of emissions, we have very good data that tells us what emission is coming from where, what are the sectors where intervention is most needed. Now, implementing those interventions often affects people's lives, and that's where we have to be very careful about which type of data we're valuing, because it's not just about the hard data where the pollution is coming from, but also the data about how tackling that sector of pollution affects our lives. And I think there's a big gap in information and awareness.
Thank you. I think we talked a lot about cities, and cities. I'm from C40 cities, so I definitely always want to talk about cities. But sometimes cities definitely need the support from national governments, and we need national and international level action. Jane, zooming out a little bit on that, what do you think? Should national governments be doing now to ensure that cities are supported, and particularly when it comes to financing and investment, what should we be telling our national governments to do more of?
What should national governments do more? I think, devolve powers is one one option, because we do see city mayors
the world over being the place where ambition is happening on climate action and air pollution. When we first set up the Clean Air Fund, one of the first grants that we did was with C40, and we were putting together a coalition of mayors to announce that they would be trying to meet these World Health Organization guideline limits to reduce pollution. And we set ourselves what we thought was an ambitious target of getting 10 mayors to sign up. We wrote the with the mayors, really quite stringent targets that they would be signing up to. And in the end, 37 signed up. And now I think we have 50 or more than 50. So it's where the action is happening. And I think they meet a lot of barriers to implementation because of lack of powers. So that is one thing. And then on finance, I mean, it is a particularly difficult time now to get clean air actions funded, less development aid, really restricted national budgets. There is a source of funding, though, that I think is a no-brainer, which is repurposing fossil fuel subsidies, something that would have to happen at a national level. But there's more than 7 trillion, I think, every year going to fossil fuel subsidies. The World Bank just came out a few months ago with the price of clean air, or at least halving air pollution by 2040. And it was half of that amount for the next 15 years. So the money is there, it's just going to the wrong place and actually making the problem worse.
Indeed. But I think we have a challenge with financing and getting the right money in the right places, but that's even more complicated when you actually add the inequality layer and the most vulnerable. So just maybe a dual question very quickly, like 30 seconds each for Elliot and Agnes. And when we're looking at using the little resources that we have, how can we make sure that we're doing it right, making the most value of our money to tackle those that need it the most vulnerable? What would you say that resources should be put into?
First of all, and I know this might sound contradictory, but it's not necessarily putting it into clean air in that kind of way. It's actually putting into the health impacts that the communities are actually experiencing and then working back. Because oftentimes, when we're talking about air quality and PM 2.5 and nitrogen, once you think you need to have a PhD to understand the task, it already kind of pushes people away. But if you talk about your health, the reason that you're in A&E consistently, the reason your child's taking time off of school, that resonates. So really about looking at those kind of groups that are already doing that work and then bringing in the conversation around how the environment plays a role.
Elliot?
And similarly, I think if you think about air quality and the impact that it has on deprived communities, one of the things that we've been able to do is really target some of our interventions. So I talked about the work we've done cleaning up our bus fleet. Initially, what we did was we designed low-emission bus zones where we could actually target areas with high levels of deprivation, high levels of exposure, and actually prioritise those new cleaner buses joining our network to actually go through those communities and in those neighbourhoods. And through policies like that and the work that we've been doing in schools, what we've actually been able to see, and ULEZ itself, of course, is that we've been able to halve the exposure gap between the least and the most deprived communities in London. So it shows you with the right kind of policies, you can actually make progress on this, and we want to go even further than that. But this goes to, I think, the wider discussion about needing to be able to get the right levels of investment, the right kinds of policies, the right kind of community buy-in to basically make sure that there is no gap in exposure to pollution because we've eradicated exposure altogether.
All right. I think we have probably 5 more minutes total for this, and I want to make sure that we opened not just questions from me, but also from the audience. So if I can maybe raise hands if you have a particular question for any of our speakers, and maybe we can take 2 questions at a time and see if we can get for a round 2. So there's a lady here in front, and there is a gentleman at the very back.
My question is, how do you reconcile the fact that air pollution reduces global warming? Heat increases when pollution improves.
And a second question? While you think about it?
Yeah.
Thank you. My question is about data. So we heard a lot about PM 2.5 data and other kinds of data. What about human perceptions data? Because PM 2.5 means very little to a lot of people, but what about what people think about air pollution, and is that important for your work? Thank you.
Great. Should we start maybe, we know obviously Dieselgate doing something for climate turn out to be a complete disaster for air pollution? Are we taking into account all of those things to ensure that unintended consequences when it comes to global warming and others are taken into account? Anyone wants to take that one? Jane?
I can do the cooling question.
Yeah?
Yeah. Yes, so you're referring to sulfur dioxide, which for the non-climate scientists in the room is white particles, and it reflects sunlight, and so it might be cooling, well, it is cooling the planet. I think that there are also scientists that think that the effect has been overstated. But either way, I would say two things. One, it's never emitted by itself. So it's often being emitted with carbon dioxide when you burn coal, or black carbon, which is black bits of stuff which are absorbing heat rather than reflecting it and re-emitting it into the atmosphere. And so you can't take the impact of sulfur dioxide by itself. And secondly, it's a funny argument when we're also that these people are making, not that I'm suggesting that you're making it, to stop reducing sulfur dioxide, when we're also talking about health. There are huge health implications to all of this, and it seems ridiculous to me that people would suggest that we want to keep on emitting certain kinds of toxic substances because they might be short-term cooling for the planet, A, when they're co-emitted with other things, and B, when they're so damaging for our health.
Right. Dr. Sommer, you want to talk about the data? The data question?
What question is that?
The one, how are we doing enough to take into account data for
the perception data.
Yes.
I'm not the right person to answer that question.
I think no. We launched our Black Child Clean Air Report in 2023. Black Londoners in the UK are 3 times more likely to breathe illegal levels of air pollution. And I was shocked and astounded to find out that it was the first report from me. Like, what's going on here? So that within itself, looking at that kind of particular populace, the fact that that's only kind of just happening there needs to be a lot more done around the engagement piece. Otherwise, it becomes an echo chamber of the same people that kind of understand the science talking to one another, and the community are then left behind.
And just to echo that, I think this is an area where we're still, as I say, trying to develop and improve the way we communicate and the way we explain concepts, and the way we also involve people in these kind of decisions. So that's something that, again, tools and partnerships like Breathe Cities are designed to bring people in at the kind of policy development and implementation phases.
Last 10 seconds, Marina?
Yeah, just to say that perceptions are the core of whether we will do or not the transition. It's not a technical problem. It's only a political problem. It's only a problem of political and personal will. So looking at perceptions is basically at the core of it. We have one of our 5 working groups is focused on perceptions. And encouragingly, what we do find is that when we put health at the center of the climate conversation, then the appetite for climate action grows quite significantly. And we always talk about the health co-benefits of climate action, but we never talk about the climate co-benefits of health action. So we could just not talk about climate change, keep on talking about air pollution and tackling air pollution. And back to the other point, end-of-pipe control, so control measures that reduce air pollution without tackling climate change, achieve very little. If we do both of them together, we have enormous benefits both to climate and to the environment. So we have to start putting health at the center of all conversations.
Perfect. Well, thank you so much. I want to thank everybody in the panel for your time in such an important first day of London Climate Action Week. We've talked a lot about different aspects of the action that is needed on the ground. We talk about the need for systems change and really make sure that we're going for the low-hanging fruit first, because there's a lot of action that can have immediate effect. We're talking about data and how data needs to talk to each other, but it also needs to talk to the people and engage the communities to make sure that it's resonating to the conversations that people are having at home. And we need governments to empower cities to do the things that city can do well, whether it's through more devolution, whether it's more funding from the institutions. So I hope that this was, even though there's a lot of always negative, the negative consequences of air pollution that we all know, but I was in a session earlier today that things are negative until you turn them in positive. So everything that is a health negative consequence, it can be a gain if we actually take action now and we're able to quantify it. So I hope this is inspiring, and it's the first day of London Climate Action Week. We have a week full of events. Make sure that you join us to the conversations. And thank you all of you for your time today.
Thank you very much for another insightful talk. Thank you to Alejandra and our panel. We're moving on next to food. According to some estimates, we will not be able to feed the population of the planet by the year 2050. And obviously, access to nutritious food is vital for our health. Nutritious, fairly priced food. So, for our panel on ensuring sustainable food security, please welcome to the stage our panel and host, Hannah Pathak of Forum for the Future.
Come along, gentlemen. Well, before we get into this, I just wanted to first say this is going to be a town hall format, so actually a little bit different. So we do have some questions that people have shared with us in advance, but I'm going to keep pausing in between those to take questions from all of you, because what we want is a kind of lively conversational tone to this. Food is deeply personal to all of us. We all interact with food every day. It shapes our culture. Many of us are very disconnected from where it comes from, and maybe that's part of the problem. And what we're going to talk about here is particularly around food security, but in that we're going to dive into some of the themes around soil health and regenerative farming and the potential for that, but also think about some of the food narratives that sort of sit with us, and think about context and where that matters, and what are the different narratives around food in different places. So I'm Hannah Pathak, I'm the CEO of Forum for the Future. We work on food as one of our key themes, and in that we work on regenerative agriculture, but we also work on things like the protein challenge. How do you sustainably support the protein needs of different people across the planet, a growing population, but in a way that is accessible and also sustainable? I've got with me an amazing collection of people. So Azadeh is with us, obviously, online. And then we have Alejandro and Stuart. And between us, collectively, we're passionate about soil health, about food systems, and about food equity. And I'm sure many of you in the room are very familiar with some of the challenges. So our global food system is estimated to be responsible for about 30% of the greenhouse gas emissions. But it's also the one sector that actually has the really incredible potential to be the solution to the problem. And quite often when I'm at sort of food conferences, people talk about the food system being broken. But I think a more interesting way to frame it is to think about what are the goals of the food system that we have. And we have a global food system, and then we have many different food systems that are very context specific. But if the goal of the global food system, really since the Second World War, was to produce high volumes of food and distribute that around the world, it's actually been incredibly effective in that. And many of us will have directly benefited from that, and our nutrition has significantly improved. But there are many challenges. It is a very polluting sector because of the way the practices are done, and it's already deeply inequitable. Many people around the world need to consume more, whilst many of us arguably need to consume less or differently. So hopefully we're going to dive into some of those challenges. But what I'd first like to do, actually, is to invite each of the speakers to talk about their personal connection as to why they're passionate about food. And I'll just quickly give my example whilst they think about theirs. So I grew up next to a dairy farm in the Yorkshire Dales, and I used to follow the cows up to the milking parlour, and I used to love watching them all go up. They'd go from the meadows, then they'd go up to the milking parlour. I'd go and watch them get milked, and then I'd buy milk from the farmer, and it was still warm from the cows. That same farm, unfortunately now, keeps its cows indoors all year round, milks them 3 times a day, and their life expectancy is about 2 years shorter, because the farmers are just so acutely under pressure economically. And even with those shifts to more intensive dairy farming, they struggle to turn a profit. So there's something really sort of challenging in that about kind of even something so fundamental as food. Farmers, many places around the world, are struggling to make that viable. So Azadeh, I know you're passionate about soil health, and you have a wonderful story of how you came into this. So over to you.
Yes, happy Monday, everybody. I hope you have a good start today for the week. So I grew up on a farm. My both grandparents were farmers, and my mother came from the same farm. And she didn't want to become a farmer, so she quit. She left the village to the city, and then she decided to become a nurse, and then met my father, and I came into the world. So when I shared with my mother that I'm going to study agriculture, I think this was the first crisis of her life. And she said, I get out of that shit. You want to get into that shit again? And I was like, yes, sorry, Mom, but this is, I think, where I come from. So yes, and then I studied agriculture. I came to Germany, studied sustainable international agriculture, and then worked some years on the topic of soil, climate, and yes, and this, I think this is something that I cannot really ignore. I wanted to become an actress anyway, but I use now the camera to raise awareness on the soil.
Amazing, thank you, Azadeh. Alejandro, what was your route in?
I'm an outlier here because I was not born in a farm. I'm a city person. I grew up in Bogota, Colombia. But I think that's, in my mind, I never thought about food growing up, really. It was just kind of there. But it is a miracle, actually, that food exists in cities, if you think about it. And so it was maybe more of an intellectual and curiosity thing that really struck me, like in my 20s or something. Just like, how is this, all this stuff, making it here to my table? So it's more of a sort of awe kind of feeling about the food that we do have.
Thank you. Stuart.
Yeah, about 42 years ago, I was volunteering on a project in a teak forest in southern India, and over time, well, in a short time, I realized that food was a really interesting and important marker of well, the human condition, but also justice, you know, whether and who and how people have access to food or not. And the particular tribal peoples I was working with did not have ready and easy access to healthy diets, and I ended up taking that forward, and I wrote a book on it, and ended up doing a PhD. That's my sort of entry into that.
Amazing. And I'm going to start with you. So we've had 4 questions pre-submitted by people. So start thinking up your questions, and the team will go around with mics as well, and I'll just keep checking in with you all as to how you want to engage in this dialogue. But Stuart, sort of how do you see population level inequalities being considered in discussions around food, sort of food access and food inequality?
Yeah, I think, well, I don't work in food production. I'm looking at the downstream impacts on people and on society. But I think we often mistake inequalities are the downstream differences in outcomes, nutrition, health, food. We look upstream, we look at equity, and we need to really be clear about what equity is, and there are 3 pillars of equity. First is fair shares, and that's a proper distribution and a fair distribution of resources, but also a fair distribution in the case of climate, for example, climate crisis, of impacts, and we do not see that. Obviously, those least able to respond to the climate crisis are the most impacted, you know, smallholder farmers, fishing communities, indigenous peoples, and within households, women and children, and future unborn children. That's the first part, fair shares. Fair play is a whole bundle of things that relate to human rights, to food and health, to governance in a political level. The third pillar is fair say, which is not about us, without us. So that's inclusion and active participation. So, and we don't see that embedded in those discussions that within the entire food, not just food production, but within entire discussions on food from farm to fork. So I think we need to keep shining a light on those 3 pillars.
Thank you. Alejandro, I know something when we had the pre-call that you're passionate about is really bringing into people's awareness that there isn't a single global food system. There's actually many, many food systems around the world, and there might be practices that have been part of people's heritage that are now sort of moving perhaps into the mainstream as the dialogue around regenerative agriculture grows, but actually have been people's, just their knowledge systems for a long time. Could you speak to the question that came in that was around kind of the role of local food production and consumption, and what that means for us kind of understanding where we go with our food systems?
Yeah, that's a really nice, it was a nice question actually. Maybe I'll say 2 things. I can hang 2 kind of thoughts at the same time.
Yeah.
One is, I think we need to absolutely be totally aware that most things have been invented already when it comes to food. So what we today have some buzzword for, like regenerative agriculture. People have been doing crop rotation, no-tillage, all sorts of things already. So just the richness of breeding, even just at the production, but also processing, fermentation, all the things that people have been doing for ages is coming to the mainstream, I think rightly so, because there are solutions to problems that have existed for a very long time. People have been breeding seeds to deal with changing climate. The climate has always changed, and farmers have always dealt with that. So in today's challenges, it's really important that we learn from that and we don't start from scratch. But I said I hold two different thoughts. The other is, I think there's a danger and a risk in sort of idealizing and romanticizing these local context-specific things as the solution. And so like everybody now is going to be doing X or Y. I don't think that's the case, and solutions tend to be quite context-specific. So I think it's really important that we kind of appreciate the importance and the value and treasure and cultivate that value, but not then assume that whatever works in the highlands of Bolivia is going to work in the rice fields of Indonesia and so on.
Wonderful. Yeah, great. So kind of the nuance in when we're talking about these different cultural practices.
Yeah.
Thank you. Azadeh, I'm going to come to you with the question about vegan protein alternatives, which came in from someone. So someone had submitted a question. As a vegan, I'm interested in the sustainability of newer dietary options. And I wondered if you could answer that from a soil health perspective and kind of the potential there on, beans and pulses and nitrogen fixing, and maybe just bring some of our knowledge up around soil health and how it's created, which is something I know you're passionate about.
Okay, so on the global scale, our agricultural land is divided into two parts. So we produce meat and also we produce crops. So 1/3 of our global land is dedicated to cropland and 2/3 for producing meat. And the problem with producing meat is that we have to eradicate, or we have to deforest a lot to make the land or to use it for as a pasture and for animal place. But for cropping land, this is not a big problem because you can integrate cropland also in forest and also on different hectares that have trees, that have bushes, that you have different elements of nature. So the problem with everybody wants to eat meat is that automatically we have to turn more lands to pasture, and we have to eliminate biodiversity because we have to remove them. There is only one space on the piece of land which is for the cow. But eating meat is not a bad thing when you control it. So we need animals for soil health. We need bacteria. We need the cow shit for the soil health, when you call it that way. But we do not have a lot of them, a lot of this component for the health of the soil. We need to bring back the nutrients to the soil because the cycle of nutrients should be closed. So if you are a vegan, it's a good thing. If you are vegetarian, it's a good thing. If you eat meat every day, reduce it to once a day. So not 3 meals a day, but maybe one. If you can, reduce it to 1 time in a week. And with this, you're improving the nature and you're also making land for other animals. 99 or 97% of the animals on the earth are our livestock, and only 1 to 3% is wildlife. So we do not really have a lot of habitat for the wildlife. We are turning the wildlife into meat production, and this is something that we are doing not in a good way. And there is a way to make it more sustainable, like through agroforestry systems. So you are combining agriculture, pasture with forestry. It doesn't mean that you plant your crops and also put your animals within a forest, but it means you plant trees on an agricultural land, on a cropping land, on a pasture land. Make it more sustainable, make it more drought resilient, make it more water friendly, make it more heat friendly, because when it's too hot, it's also too hot for the animal. So yes, eating less meat is a good thing, and it's also healthy. This is also an event for health. So if you can reduce it, go for it. Why not?
Great, thank you. Okay, over to everyone. So, yeah, hopefully you've been thinking up some of your questions, and I'm sure many of you in the audience are passionate about food, and I can see a question coming from over there. Person with the glasses.
Hi there, I'm Stephanie from the First 30. We're a VC that invests in technologies that translate soil health to human health. So this whole day is very topical for me. I actually have two questions that I'm going to cheekily combine into one question. So the preface is, how far away are we from, firstly, nutrient density to be factored into the value drivers in the food supply chain as they pertain specifically to human health? And then the second part of that question is, how far away are we from factoring in and charging a tax, if you want to call it a tax, for the negative climate impacts of, for example, the conventionally farmed beef or meat or whatever food production? How far away do you think we are from really factoring that into the cost of food?
Amazing, great. Great pair of questions, thank you. Alejandro, do you want to start with?
Yeah, hard, far is, I think, the answer, yeah. I might qualify that, but yes. So when we track what companies, and I'm going to speak out big companies now that are driving some of this, what they're doing in terms of the nutrient content and the nutrient density, it's an area where there's a lot of progress to be made, but it's super hard to get companies to act on that one. So for example, we see lots of progress and have seen lots of progress on an agreement on things like climate change, emissions, even land use change. But when it comes specifically to the nutrient portfolio of companies, it's really, really hard to make progress. There's some progress, there's some advances, some companies make advances, but it's one of the most, I think, challenging ones to pin them down. So when you talk about, I assume you're talking about things like, what are investors looking at when incentivizing companies? That's an area where it's really, really hard to get. So let's say, when I say far, I think we're far from consensus. There's action, and there's lots of multiple things going on, but I think we're far from consensus. And I think then on taxes, well, obviously, we do have now taxes on some things, like, for example, sugary drinks in many parts of the world. And so they're health taxes mostly, but they have potentially big environment implications. And I think actually there is progress there. We're still quite far away. I think on some of these contentious issues, we're quite far, and companies will fight it. But on other issues that seem to make more sense for companies, I think we'll see that they will be moving ahead.
Great, thank you. I'm sure you both have bills, but I'm going to take other questions because I'm keen to hear other views and perspectives in the room. Other questions from people?
Thank you. Andrew Mackenzie from the Physiological Society. You've touched on it there a bit in your answer, but I'd be keen to get your views on the strength of the food lobby or the meat and dairy lobby. It feels like we don't really need much more research in this area to know what we need to do, and yet whenever action is tried, there seems to be a lot of well-funded vested interests pulling us in the wrong direction. How do we tackle that?
Yes, Stuart, I wonder if you want to jump in on that.
Yeah, you're absolutely right. Yeah, I did some work with the Food Foundation and led to a report, Broken Side of the Plate. You may have seen it on corporate lobbying. It was a kind of a deep dive. If you look in 5-year period in this country, there were just 35 meetings between ministers and public interest NGOs. There were 1,300 meetings with big food and big pharma. It's outrageous, 40-fold difference. And number one. Number two, we don't really know what they talked about. There's meant to be proper disclosure, online, available, publicly accessible. It's not. You often just see things like to discuss business. And And we have a situation, we have had a growing and increasingly serious situation of corporate capture of the food system across all stages from production to consumption, wherein just a handful of large transnational corporations really control between 60 and 90% of those different stages in the food system, and they drive profit. They use that capture, that control to drive and maximize profit, which ends up being more or less defaulting to ultra-processed products. They're not even proper foods, most of them, which are the most profitable, and they're the least healthy. They're the least healthy for us as humans. They're the least healthy for the planet. That's the crux, I think, of the challenge we have right now in the food system. But what I would say, just to finish on, the public get this now, I think, and there's much more of a demand. So I think now is the time, especially in this country with a new, almost still a new government, to step in and actually set the guardrails and the parameters within which a healthy for people, healthy for planet food system operates. And we're waiting to see if that happens.
Great, thank you. Other questions? The gentleman who's standing up at the back first, and then the person in front of him.
I was just asking about the replacement of glucose and sugar in the artificial sweeteners. And we know that probably a lot of the artificial sweeteners for climate, because they use less soil, obviously, and compared to sugarcane. So the shift over to artificial sweeteners, but they've got obviously their health problems, and they've got their environmental problems as well, being the system. How are we going to address this issue? Because obviously sweetness has to come into food somewhere. So where should we be heading? Which sweeteners do we take? Less sugar? Are we, how are we going to balance the health and the environment in choosing where to go?
Azadeh, I'm wondering if you want to start from a sort of soil health, literal ground up perspective.
So I can only answer it partly, I think. I'm not an expert on artificial sugar products, but about, for instance, producing sugar beet. Sugar beet is produced mostly in monoculture, so it means it's really demanding on soil. And if you only have one crop every year, the soil does not get enough nutrients from your crop. So when we talk about soil and a crop, it's like a neighborhood. So the soil has some benefit from the crop, and the crop has some benefits from the soil. When you have only one crop, this is one-way street. So the crop is only benefiting from the soil, and the soil gets no benefit out of this. And this is really damaging for the soil. So when you do the cropping in a rotation, so you do not really have sugar beet in each season and every year, and you replace it with other crops, for instance, with legume or with let's say clover or some other crops that are really giving back a lot of nutrients to the soil, this is regeneration for the soil. Otherwise, when you plant in monoculture, that is really the case for industry production or industrial production of sugarcane. You have to deliver, and you have to be sure that this amount of sugar is delivered from your suppliers, and you get it as a company. So you put more pressure on the supplier side to produce and to deliver. So this is only possible in terms of when you have more environmental damage and climate damage. But when we do it in a crop rotation, this is more, as I said, regenerative for the soil, but this is nothing really that the global industrial companies are aiming at. In many cases, they are pushing towards more one crop or monoculture. And the more demand on this consumer side for sugar, the more pressure the company has and the more pressure the supplier has. So I don't know how it is in terms of environmental damage of artificial sugar products, but if they can reduce it in case of you have less environmental damage when you produce it in a laboratory, this will be a kind of alternative to reduce the demand on sugar cane, and also do it in a polyculture, so not in a monoculture. But at the end, I'm not an expert on this.
Yeah, no, but I think you draw up an important dimension, which is part of this is a consumption problem. The more we drive towards high sugar foods, then the more whichever sources we're using, there's problematic dimensions of that. Don't know if either of you have quick builds on that before we take Alejandro?
You do?
I haven't.
I did. Sorry, I have just very quick. I have absolutely no idea whether they're good for your health or not. I have no opinion on that. But I do love sugar. and so do a lot of people, and there is, but they're really bad for you as well. Like simple sugars are really bad for you, like in excess. But the point I wanted to make, going back to you, Stuart, about I'm not denying the corporate capture, as you called it, or power, immense power, but I'm kind of an optimist on this one because like there's like a shit ton of money in research and development going on those things. And so there's a lot of innovation, and this innovation is going to come from those big companies. And I'm not sure in this particular case where the solution is worse than the problem or not. I'm just kind of using it to illustrate an area where like people kind of know that they can't keep on drinking so much sugar, and like that's going to match eventually the business case of companies, and I think we're going to see progress there. So I'm kind of like, I think it's a nice window of opportunity.
I think we also maybe get points as the sweariest panel so far. I'm going to take one more question. Well, there was a person who had their hand up for the back. I don't know if they've lost their question. Yes, go for it, and then we will have to close. Yes, thank you. Sorry.
Hi, yeah. Oh, can you hear me?
Yes.
Yeah. Florence Jones, Sustainable Views at the FT. I just had a couple of questions on some of the things that have been mentioned. So we've got like, everybody should be trying to eat less meat and dairy, that's good. And then the comment that Stuart made that like the public gets this. I just wanted to ask, like, at this cultural, political moment we find ourselves, like, how do we avoid this kind of culture war around food and around plant-rich diets, especially for like young men with like Andrew Tate telling them to eat steak? Like, how do we ensure that this remains scientific and also like available to everybody and accessible?
Yeah, and it's fascinating that certain types of consumption get aligned with certain types of ideology. Stuart, I don't know if you have
Yeah, I mean, I've got a view about, we've basically got a very imbalanced, non-level playing field with regard to the food system. What we need is government to step up and up-regulate the good, down-regulate the bad, especially with low-income families and marginalised groups, so that there is a real choice on an individual, on a household level, in terms of what foods are chosen, and accessed and eaten. At the moment, there absolutely isn't. And so the default, especially if you're poor, is towards ultra-processed products, which aren't good for you. What we need is a proper, and it was talked about earlier with regard to fossil fuel subsidies upstream, which are $1.4 trillion. It's unbelievable. Similar thing with big food. I don't know, it's around 600 to 700 billion dollars. Those need to be radically reassessed, plus proper taxation on foods which are known to be harmful. We've had sugar taxes, they work. But using the tax dividend, and this is a government-driven initiative, using the tax dividend to earmark it to, in certain ways, and to improve the access on the part of low-income families to healthier diet in their neighborhoods, locally accessible, good foods, fruit and vegetables, obviously a lot more plant-based, obviously for climate reasons, minimally processed. It's a simple, it sounds simple, but it's that leveling of the fiscal seesaw, and that needs to be driven by governments, and it needs to be driven by citizens demanding that their governments do it.
Amazing, thank you. I'd hope to wrap up with a sort of couple of words of what you feel excited about and positive for the future, but I think we're out of time. So thanks everyone for your questions. That was wonderful. Thank you all.
Thank you very much for that hugely insightful and slightly sweary panel. That was great. It's now a chance for you to get some sustenance of your own. There'll be coffee and refreshments on the second and third floors, and we'll be back at 4 p.m. sharp for our In Conversation with Mary Robinson. Thank you. Hello, everyone. If you'd like to grab your seats, we'll be starting again in 1 minute. Hello, everyone. Welcome back. It's great to see so many people stay through the day. I hope everyone's feeling suitably caffeinated and ready for the rest of the afternoon. I can see there are 1 or 2 seats over there if people are standing at the back and would like to, and are worried about the health of their knees. You can take a pew there. We've heard a lot today about the health impacts of climate change. We've also heard a lot about potential solutions to those impacts, but we haven't yet heard in great detail about the leadership that is required to make those things happen. And so for that portion of the day, I'm delighted to welcome to the stage Mary Robinson in conversation with Paul van Zyl.
That's my tutu impact. Archbishop Tutu.
I get the privilege of speaking to a large number of people at the Conduit, and this is an incredible treat because you are in the presence of one of the most important leaders of our time, a person who's done a remarkable range of things in her enormously distinguished career.
Paul, can I stop you there? Nobody needs to hear all of this. Let's get down to business. Let's get down to business.
Unnecessary modesty is one of the many. So I got to know Mary Robinson because I worked for a while with Archbishop Tutu, and she worked with him in this remarkable institution called the Elders. And before we came on stage, we were picking which of Mary's many hats she should be wearing for this conversation. And that speaks to all the things she's done. So we're going to get to business, as she's admonished me to do. And we're going to talk a little bit about the Planetary Guardians. And tell us a little bit about that institution and what it seeks to do as a way of framing the conversation we're about to have.
Well, currently there are 20 guardians of the planetary boundaries. And when I say this to my grandchildren, they're very impressed. It's like Star Wars, you know, it's a very impressive hat. But actually, it builds on the work of Johan Rockström. I'm sure many of you are familiar with his work. Quite a number of years ago now, but he could only afford to do a sort of report every 7 years on the planetary boundaries. There are 9 of them. Don't ask me to tell you all 9, because I think I won't be able to remember. Climate is obviously one of them, the oceans, what we put up into the air, the ozone layer. In fact, the ozone layer is the boundary we retrieved. I'm sure many of you will remember the worry in the 80s that we were going to fry because the ozone layer was opening up because there were these chemicals. And then, happily, we learned And we got the Montreal Protocol and very quickly dealt with that. And that's one of the planetary boundaries that's in the green, if you like, not in the red. There are 6 at least, maybe coming up to 7 planetary boundaries where we're entering into danger zone. This is really worrying. And what I've learned from being a guardian of the planetary boundaries is the direct connection between the planetary health, the health of the systems that sustain us, and our health. It's really very interesting. It's, you know, you could, and I think you talked about quite a bit of it today, because I understand there are a lot of health experts in the room, and the link between health and climate is so close. But it's more than climate. It's a planetary framing, because, you know, if you undermine biodiversity, I'm sure you talked about that, the impacts on food security, the pollination of bees, etc. If you talk about heat caused by carbon emissions, the deaths from heat, the worries about heat, even in London and Dublin to a certain extent. I mean, we're less hot usually, more rain, less heat, but we're very much in touch in Project Dandelion with SEWA, the Self-Employed Women's Association, and they had so many of their members who were dying from their outdoor work, and now, happily, they've been able to get insurance from heat. So that's the other thing. But what the planetary boundaries is about is having a planetary health check every year at the UN General Assembly, and that tells us, how fragile and how connected these ecosystems are. And if we lose the coral reefs, if we lose the Arctic ice, how connected all of this is. And then we want to have science right up there in decision making. And this is really the last point I'll make about the planetary boundaries. We think, do you remember during COVID how much attention we paid to chief medical officers? Because we were scared. We were very scared. And we paid a lot of attention. We need planetary scientists, chief planetary scientists in countries that can, make the policy linked to not just science, but actually planetary science, the holistic approach. And I think there's so much value in that.
So the Planetary Guardians, a group of distinguished people across the world who do the annual health check, who send out a clarion call about the risks that we're facing, that reaffirm the science, and then issue a call to action. If it were that easy, we would all be doing it. And so I guess the question I want to ask you, you've had so many hats. You've been the head of state, you've played a crucial role at the UN as the High Commissioner, you've convened a whole bunch of civil society organizations, you played a leading role in the elders. You are well placed to say what kind of leadership we need at this moment. This room knows the facts, they don't need to be told the facts, they know the linkages, they have many of the solutions. We seem to be in short supply of effective leadership at this moment. How do we get from where we are to where we need to be?
I think we need a combination of the leaders who are at the important tables, because they make the decisions, and it's very important that as many of them as possible make the right decisions. At the moment, we're in a really difficult position because our multilateral system is cracking, and it's the worst of times, actually, particularly because of the United States, because the leadership of President Trump doesn't believe in collaboration with other countries, multilateralism. It's America first, and it's transactional, and it's about power, and it's about lots of other dark things that we needn't go into. That's not good for the international system, but we still need as many countries being part of the coalition of willing countries to maintain what is so important for the world: rule of law, international rule of law, the messy but necessary diplomacy of COPs. We need to improve COPs, make them smarter and more effective, but we need them. And as well as that, we need an extraordinary community building up of civil society. And I use the word community deliberately, and I'm trying to think of the Brazilian word. Is there a Brazilian in the room that can tell me the lovely word? Muchara. Yeah, that's right. Very good. Well, there's an Irish word, mehel. There's Ubuntu in South Africa, but actually there's a human rights framing, which I really want to emphasize. A lot of people think about the Universal Declaration of Human Rights in terms of Article 1, and it's a lovely article. All human beings are born free and equal in dignity and rights. And dignity comes before rights, which is really very important. But we've individualized rights too much. Yes, we need women's rights, children's rights, we need to focus on the individual, but we also need Article 29, which says, everyone has duties to the community in which alone they reach the free and full expression of their personality. Isn't that very interesting? You have to know you have duties to the community, do something about it, and then you yourself have grown somehow. You're more rounded. You know. Many people say, you know, I know that when I give to others, I get back far more. I mean, you would have known that with Archbishop Tutu. And we need communities to grow and work together to show that we are actually moving in the right direction. We are on the cusp of a much better, fairer, safer, healthier world. It is just around the corner. We're moving, but we're not moving fast enough because we somehow are not connected. We don't know our strength. We don't connect what all the communities are doing, which is what Project Dandelion, we as women leaders are trying to do, to have this radical connection, radical communication, radical collaboration to help the decision makers at the top. If they don't feel the pressure, and they don't at the moment, the focus is elsewhere. It's on these awful conflicts at the moment, on defence, on defence spending, cutting back ODA in order to build up defence, especially in Europe at the moment because of the war in Ukraine. So we need this combination of the still countries of the willing who understand the importance of international rule of law, international collaboration, multilateral dialogue, etc., and communities taking the responsibility as communities, not just as individuals, to be the swell up of support for that.
I'm so glad you invoked Ubuntu. It is the motto of the Conduit, and every day we say to ourselves and the team and our members that I am because we are, and that we have obligations to each other, and that we're more effective, more resilient, more creative, more entrepreneurial, kinder, happier, more generous when we affirm the connections between each other and stitching ourselves towards each other and building those networks is civilization's great work. So,
and look what young people are doing.
Yes.
Young climate activists. I mean, I'm so impressed when I have intergenerational conversations now, as I had even earlier today with a young Brazilian climate activist, and they're so connected. And it's across all boundaries, and it's, as you say, exactly as you say, the Ubuntu spirit.
So, the one strategy is, let's just drop an Ubuntu bomb on all our societies and create the sense of building this fertility and these connections and create change from the bottom up. I want to, and that seems a self-evidently correct, and everybody in this room is doing this in their own way, and we need more of it, and we need more people to collaborate. I want to ask you the question from the other way around, not from the bottom up, but from the top down. You've sat with the elders and as a head of state where you've seen what are the characteristics of exceptional leaders. And I'd like you to just maybe reflect on that a little bit. What did you see when you rubbed shoulders with leaders who were exceptional and good for the world? What qualities did they embody? And how do we produce more of those?
I would say the qualities are relatively simple. Humility, service, the idea, if I'm elected in particular by the people of my country, I'm there to serve them. And therefore, whatever I do, it must be for them, but also with them, bringing them with me on the journey together. And that's also very much part of it. And frankly, it's not necessarily a relevant thing, and yet it is. I find with the elders, for example, humor helps greatly, because humor is a very humanizing thing, and that's why I did my silly little dance coming up here, and people, because in a way, we need to move people from the heart. we need to, leadership is about that. Leadership that can really move people and it has to also be leadership of integrity, leadership of principle, leadership where you're prepared to pay a price and be unpopular at times because you've got to be true to the real sense of a vision for your people or a vision for the issues that you believe in.
Where do you come down on this sort of debate about, in this moment where there's an enormous sort of chilling atmosphere that has descended on the world, right? If you say the wrong things, you may have your funding cut or your university closed down or your entrance to a place denied, or corporates suddenly can't say things that in the boardroom they were saying with great conviction a few years ago. And the boundary between principle and prudence is something that leaders have to think about a lot. Yeah. So what's your reflection on that?
Yeah, it's certainly a moment where the fear factor is greater than I've ever known. And it leads to censorship of people outside the realm of the fear, if I could put it that way. And that is annoying. There's a lot of censorship going on far away from being impacted by autocratic leaders of one sort or another, and I'm thinking particularly what's happening in the United States at the moment. But there are others who are somehow, normalizing this and, kowtowing to it in a way that is not acceptable. At the same time, when you are in a situation where you've got to worry about your university or your workplace or you've probably got to, in the short term, stick to your principles, but don't necessarily talk about those wonderful words, diversity, equality. You can stick to the principles without necessarily using DEI. I think that's the smarter way to continue to believe that rule of law is absolutely essential, that DEI and ESG are important steps forward that we found, but we don't need to necessarily use the precise titles, especially for corporations based in the United States at the moment, and so on.
So I did an interview about 6 weeks ago with the head of the Wellcome Trust, and one of the most staggering things he said in the course of the interview was that the cuts in global aid, particularly in public health, is likely to have an impact in excess mortality terms higher than COVID, which is a kind of shattering statistic that a series of decisions taken somewhat capriciously can have that much of
an impact. Leave out the somewhat.
Capriciously can have that much of an impact. So, and you've seen, regrettably, in this country, cuts to aid in order to fund arms from a pretty progressive government, in all things being equal. So, if you were to advise us on how you go about making the case again for multilateralism, for an investment in public health by the state, in addition to organizations like Wellcome and the people here, how would you make that case to persuade leaders that that's not the path they should be going on?
Maybe I'll make the case in the way that the elders are trying to suggest we need a case for long view leadership, which is leadership that knows that we can't resolve the problems that we face, the existential threats, the climate and nature crisis, the planetary crisis, the nuclear weapons crisis, which is at the moment more at risk than it's ever been, and the pandemic crisis, because we still haven't fully learned. We've got the pandemic treaty, which is weak, but at least we have a treaty. But we need much more. All of those need collaboration based on reason and basically science, and multilateral frameworks, because no country or no region can deal with them on their own. And they also need empathy, understanding that people are affected differently by these decisions. And when we were talking about our long view leadership, we were also taking part in intergenerational conversations. We actually held an event at the UN General Assembly last September with younger leaders in their late 30s, early 40s, on existential threats, on exactly this type of long view leadership. And it was a great conversation. We realized we'd learned a lot from that conversation. And then at other times during the UN General Assembly, we were with much younger climate activists, much younger people talking about their perspective. So we've now kind of modified our original idea of long view leadership, and we say long view leadership and co-creation between different generations. You know, think about if we had a world where we had the wit and the sense to know we need the longer view, but we also need the input of different generations. Those in their 30s and 40s and 50s, but also those in late teens, early 20s, different perspectives. I think that's really, really important because there's a shared knowledge base now that and people are very creative and very able to see the world in a particular way that we need to listen to. I need to listen to.
So Archbishop Tutu and Nelson Mandela would always say it's always darkest before dawn. And it's in these moments of depth and despair, the depths of apartheid, hearing people who have experienced their children being assassinated in the Truth Commission, that you feel the highest amounts of sadness and despair. But in those moments, you also see light, and you see turning points, and you see causes for optimism. So give us your reflections on optimism now. Like, what are the things that ought to be stealing us for the next couple of years when the cycle of history returns to greater normality?
Well, rather than optimism, because I learned this from Archbishop Tutu, I say prisoner of hope. But there is so much going on in the world, and a lot of it has to do with what we're talking about. A lot of people are trying to make life better at local level. And we've touched on that, and I think we really need to re-emphasize it. And if you look at the Paris Treaty, we were heading for a world of at least 4 degrees of warming at that time. We knew it, and we were scared. It's now come down to about 2.6, 2.7 degrees. It's still not acceptable. That's not tolerable. But we have achieved, and I think we need to have the perspective of progress. We have made a lot of progress on, child mortality, maternal health, lots of things. The trouble is, the cutbacks at the moment are undermining that, and that's a very grim moment, as you say, a dark moment. And there are so many people suffering. I know so many stories, and so do you, of lives being lost. And look at Gaza. Look at what's happening there. I mean, to have in real time, because it's on our social media every day, children starving, being shot at, families being shot at when they're desperately trying to get food for their families. These are very heavy, difficult things. I think, to some extent, they prey on our mental health. It's hard when you know that this is going on, know what's happening in Sudan, which is so neglected, and know now that these attacks on Iran are going to distract everyone, and we're going to think even less of the other problems. So we need a kind of determination to keep focusing on humanity, on the need to understand that we are one human family, on the need to have a vision for this world that is a better world, that is a safer world. And part of it, of course, is to deal with the planetary crisis that we're in, the planetary health crisis and the human health crisis that goes with it, to do, every day what we can on that. But more than that, it's coalitions of the willing to reinforce. It's still completely true that rule of law, international rule of law, is what keeps the world a bit safer. And once we start undermining that, we get all these wars. It's very clear. So we don't have to reinvent wheels. We do need a reformed UN. We always did. When I became UN High Commissioner, there had been a reform package that gave the Office of High Commissioner a lot of new responsibility, and et cetera, et cetera. And we need that. We need that sense of reforming, but we need institutions and rule of law and a sense of fairness and equity. And we need this more and more, because one of the things we haven't talked about is the misrepresentation, the disrepresentation, actually the attack on truth itself. That worries me greatly, which brings me back precisely to the importance of community, to the importance of spaces like this, the importance of our conversation here, actually, because we are talking and we're listening to each other and we're believing in essential truths. Let me give you a personal example. There is a Facebook image of me, and I recognize myself. It's done presumably with AI and all this fancy stuff. And I'm saying, I'm asking people to buy bonds or something. I have never heard of them, and please don't buy them if you ever see this. But the wording includes, I'm your former president, you can trust me. And this really hurts me. But this is only the beginning of the kind of worries that we need to have about what is truth. We have to be very, very strong now in understanding what really matters. And what really matters is our relationship with each other. Archbishop Tutu was right. It is Ubuntu, and then Ubuntu writ larger and larger, spreading out from the local to the national to the international, but it's that sense of people coming together in strength, in determination. And I love a phrase of Kofi Annan's that he used very often, especially as an elder. He would say, you are never too young to lead, and you are never too old to learn. And I think there's something very nice about that, being young, going for it, but also learning and listening and improving.
We're out of time. We have to end. But a coalition of the willing and a coalition of the possible galvanized together to solve things. And too old and too young is just a wonderful way to end. So thank you so much.
Thank you very much. Thank you. Thank you very much.
Thank you.
Thank you.
Thank you.
Okay.
Thank you very much to Paul and Mary for that fascinating chat. We now move on to a slightly more cultural element, which is important, I think, because culture has a huge impact, as we've heard at various points through the day, on how we perceive health and climate change. So, from the Welcome Collections exhibition on Thirst, In Search of Fresh Water, please welcome curator Janice Lee and artist Karan Shrestha. Thank you.
Hello, everyone. I'm Janice Lee, curator at Welcome Collection. So for anyone who's coming visiting internationally, Welcome Collection is a free museum and library not far from here in Euston. I think we're quite unique in what we do. We have a historical collection, a library. At the same time, we do temporary exhibition exploring health through the lens of art, science, working with community, working with different people with different lived experiences, engaging with history and society. So our latest exhibition opens this week called Thirst in Search of Fresh Water. When I started working on this exhibition, I really wanted to find a way in for us to understand the really interconnected issues with climate and health, infectious disease, and mental health, which are three priority areas that Welcome works on. And instead of focusing on water as a subject to be studied, the crux of a lot of our issues lies in our relationship with fresh water as this valuable, sacred source of life that is declining in exponential rates right now. And what is interesting is with the concept of thirst, you can think about a desire of water, the search for water, but I think in some culture it is also an allusion to greed. And I think we can agree that sometimes that greed that drives exploitative, colonial, consumerist behaviors that really contributed to a lot of the issues we face today. So today here I have Karan with me. I've commissioned Karan for one of a new commission. I'll let you talk a bit more about your practice and your work.
Hi, my name is Karan Shrestha. I live in Kathmandu and Delhi. I work across disciplines, and my work gets at the complexities that are embodied in the socio-economical and political dimensions of Nepali life. And for the exhibition curated by Janice, In Search of Fresh Water, I have an installation titled Water Givers, Memory Keepers, and the Shifting Forces. Yeah, that's the work. It gets at, it speaks to the interconnected issues, as Janice was mentioning, about illness, disease, polluted water, but also how it is connected to social stratification and many other aspects of our life. If you see on the left-hand side, largely this work is about dengue in Nepal. For the longest time, people couldn't come from the north because of the mountains, pretty high, but also not from the south because of the forests. They were really thick and laden with malaria, and it was quite an important player in how it shaped history, the mosquito. And when I got this commission, Janice put me in touch with DHIS2 and World Mosquito Program. There was a lot of this conversation with Scott from the World Mosquito Program that I learned more about the Aedes aegypti, which originates from the sub-Saharan Africa, but which spread around because of maritime commerce, imperial expansion, and transatlantic slave trade, and also it has reached all parts of the world. And because of climate change, dengue is now in Nepal. It's there in 72 out of the 75 districts. Each year it is found in higher altitudes. And last year, around 40,000 people were infected with dengue. There was a blood crisis, and the health infrastructure keeps collapsing because of this. And so looking at these issues and how they're interconnected, and I made this work, and yeah. So largely, it's also talking, for the past few years I've been making work surveying the state of water in Nepal. It started with the politics of water, and then of course I'm looking also at the relationship different communities have with water in Nepal. Nepal has 6 major climatic zones, and for a small country that's sandwiched between 2 larger countries, and also landlocked, the relationship to water changes quite drastically from place to place. And I feel with being able to work with different material, because every material has its own kind of sensitivities and intelligence. And I think when we speak about interdisciplinary practice, it's also being able to communicate through these materials about what we're talking about. And yeah, I should ask Janice about what she, as a curator, what importance do you think is there in an interdisciplinary practice?
Yeah, I personally have gained a lot with working with artists like you who have a research-based practice, but through our wider Welcome network, for example, like you said, we're able to put you in touch with some of our public health initiatives that we support. And through those exchanges, you can see there are things that the scientists would take years to figure out. For example, what touched me the most was they couldn't find out why just about 100 meters away, 2 villages has such drastic difference of the rate of dengue. And turns out you immediately ask them, is it the fences? And I was like, what fence? And you're saying like some villages would use waste tire that would collect stagnant water. And these are really kind of inherent knowledge you know because you live with these communities through your practice. This is just one really small example, but I think these are things that are not written about enough and spoken about enough, and how important having these knowledge would facilitate scientific research, would really help to speed up important groundwork that people are doing out in the field. This is just one example, and in the exhibition, I also work with, you also know, with another researcher, Anthony Acchiafati from the Yale School of Architecture. So he spent the last 15 years charting water system in South Asia. And then recently, in the recent decade, he's been looking into the groundwater extraction system. And he found out that New Delhi, which you also live in, and Tucson, Arizona, are the two places that extract the most groundwater. And you can imagine the contrast in population and infrastructure. And a lot of them boils down to how people approach the habits of water consumption, and he was able to use his architectural and urban landscape research with other research from other fields in geology and spatial science to kind of correlate some other groundbreaking research about the shift of the tilt of the planetary axis and how those have invisible impact to how our climate patterns changes, and how he's able to make artwork out of it to communicate these data. And something I think Mary just talked about earlier was that we need to move people. Some people are moved by numbers, but a lot of us are moved by stories. And I think that is what is so powerful about making an exhibition that is interdisciplinary, that involves a lot of voices of communities. So it's been really great to have you, and Karan's been with us in London for a research residency as well. So this commission allowed him to spend time on the ground, traveling. It would be really great to hear a bit more on that side of like you collecting rain song, doing sound recording, living with the different people through different parts of Nepal.
Yeah, in Nepal and as well as India and Bangladesh, we quite reliant on the monsoon and the rains. And I think in the public perception, there's a certain idea of abundance of water because it rains quite heavily and it floods. Nepal lies in between two tectonic plates, and so the Himalayas are the youngest mountain range, and it has, for relative to its population, it has the highest fatalities through landslides. And as I mentioned before, I've been working on making works on water, and but also going to different communities in different parts of Nepal. And something that what really struck me was, Nepal was a closed country up until 1950, and there was, in our recent history, there was a civil war for 10 years and then became a federal democratic republic. But it was under monarchy for 250 years, and suddenly it was woken up to modernity. And what does it mean to be modern, really? I mean, that's a big question that comes again from colonial thought perspective. And when I went to these villages and various parts of Nepal, in smaller cities, what was and collected these songs and stories and talking to people, I think what really struck me was this a certain climate blindness that had come with modernity, because in our parts of the world we're really reliant on water, like and nature, and how these stories are not just about how do we live, but also how do we live with each other, and also how do we live with all the other forms of life that is there. You know, it's always been a social as well as sacred duty for water to go back into the earth and belong to everybody else. It was not just a resource which is increasingly being commodified and made into a product. So it is through making these works that I feel like also, I mean, there's data. Data is often done through for a very specific intent with a very specific focus, but how do these things actually come down to people and everything else, and how it is connected to so many other things in the time and space that we live in? And I was curious about how you feel about bringing artists to engage with these collections and the impact it has on these historical collections?
Yeah, I mean, we're just even going back to your work, I get asked a lot, how does an artwork represent research knowledge, scientific knowledge? And there's not a very good image because we're still preparing for the exhibition to open, so we don't have professional photography yet, but you can see we, Karan here, have 3 suspending ink drawing on cotton. And I would love for all of you to see it up close because the layers of stories tying with, so this situates in the glacier section of the exhibition. And when we started working, you told me about, like a lot of people see images of melting glacier as in climate campaign.
Yeah.
And it often stops there. It's eerie, it's tragic, what's next? So people living in glacial fields have to move, but there's also tied to your other work about expansion of national park for tourism. So when you go on a lovely tour at a national park, you're supporting the displacement of the indigenous people who are also losing habitat from receding glacier and floods and landslide. And then you tell all these stories through a really intricate drawing, but you study so in such depth with the Egyptine image that in our collection. So in our collection there is this really exquisite drawing that was commissioned by Henry Wellcome for the opening of the London School of Hygiene and Tropical Medicine. And that remains one of the best hand-drawn illustration of this species. And you study it in depth and it's represented in the way your imagination, your storytelling. So it's also for us, and because of this commission that we're able to go back to our historic collection to rethink what commissioning an illustrator in the 19th century means to a medical school. So we're all connected in this way, and it becomes really obvious as that is the only way if we're ever going to, protect our habitat and our climate and each other and the modern human world. We need to have this holistic way of understanding each other's work, support each other's, elevate others' voices, but also to amplify the impact of all the specialist work. So it's been a really great process. And going back to the work, you mentioned the rain songs. So these are water vessels that you collected, and you want to talk about the significance, and then you've turned the vessels, and these are all speakers and suspended in the air. So what you see as metallic vessels, they will play the sound that you just mentioned. Do you want to share a bit more about the significance of water vessels, about water storage and shortage and water pollution?
Yeah. These vessels are playing sound installation, and the work on the right talks about what Janice mentioned, glacial melt. In the 20th century, like India has built like around 3,500 dams, in China around 22,000, and and Nepal's also going into this, like these hydro dreams about let's build dams, and there's all the rivers flow from north to south, and there's so much sedimentation, and of course because of seismic activity, there's been collapses of dams, and of course on one end there's an abundance of water as is spun in these hydro dreams. But at the other end, there's also a scarcity of water because of poor negligent governance and state corruption. So, propounding on what was mentioned earlier in the previous one is, like, of course, we need to have these regulations and these laws, and which is so much of that is there in Nepal, but it's also how it is implemented and who's going to check on how it is being implemented. That is, these are the fissures and the lacunae that we're dealing with, and so despite the water being there, and we have to buy water to drink, we have to buy water to use. And often people have to just keep storing water for the dry seasons during from winter to summer, and this creates ideal conditions for dengue mosquito for the vector, but it's also like we're living in these realities of erratic rainfall, and one end having so much damage due to flash floods, to floods sweeping away entire villages, and this one is talking about the Glof, the glacial lake outburst flood. But at the same time, there's also annual drought in the south of Nepal, which is called the Tarai region, where 50% of Nepal's population is concentrated there in just 20% of the landmass, and it's these precarious situations. And yeah, so I mean, I have been collecting these stories and also working on them in a way that's that can speak to the viewers. So yeah.
Yeah, well, thank you.
What do you want the people to take away from the exhibition?
Well, thank you so much. I think we're out of time. I think there's so much in the exhibition. We work with archaeologists, artists, architectural researchers, anthropologists, water scientists, architects, design engineers. So please, if you have a moment this week, come see. We're open to public on Thursday, and I hope something will resonate with you. Thank you.
Thank you very much. So we'll continue with the cultural elements now. Please welcome to the stage Love Sega, artist and founder of Live and Breathe.
Hello everyone. Good afternoon. It's great to be here. I'm an artist, musician, and of course founder of Live and Breathe, which is a black-led clean air movement, now an organization. So again, it's in the same way how I used my music as a way to talk about something to do with the climate, which is air pollution. It's for other groups, whether it's theater, whether it's roller skating, whether it's BMX or anything like that. Now today, if I just ask a quick question, how many of you, given there's health, how many of you are medics? Okay, there are a few medics. It's quite rare for me to be in front of medics like this, so I've written this and I'm talking to you and then everyone who's health adjacent. Just because very quickly, Rosamond Adukisi-Debrah, the mother of Ella Roberta Adukisi-Debrah, who's been doing amazing work. She was just on Woman's Hour on Radio 4 on Thursday, which was Clean Air Day, and she was there with Professor Sir Stephen Holgate. So if you go back and listen to, I think it's Thursday, after 3 minutes, and they're both walking from Great Ormond Street to Parliament, and they have an interview, which is live, and that's a great example. So when I said I'm talking to medics, because I listened to that, and Professor Stephen Holgate was on all of the inquests and everything, standing with Rosamond all throughout this. And it's a great example of when medics, you join together with other people and are able to communicate what you're doing. And hopefully this is an invitation to show that there are creative people out there, and we're ready to stand by you to communicate. So this is called Are We Really Watching? I wrote one day, we were the canaries in the coal mine, performed it in a pavilion that was an artistic shade of sublime, Theaster Gates, Black Chapel. It's about seeing a picture, making platforms. What should artists be doing in this century? What role should we play? And in doing so, is this a way to lead? I'd started Heirs of the South Circular, about to embark on Live and Breathe. Made me think, the arts are a good space for convening. When we quote being creative, does that let us turn on our humanity? But it's not a silo. We need everyone, mechanics, farmers, lawyers to listen. Some work with bodies, I work with words. So let me share my position. It's not binary. Words aren't just here to comfort, entertain, or massive ordnance damage. They are here for you, this audience today, to ingest as a challenge. It's overdue what we need. Pose a question and think. Do we want creative physicians? or people just to stop the goddamn bleed? And now, what do you say to power? Is it a thing you turn on and off? What do you say to electricity? When was the last time you got electrified, engaged? Remember that feeling? Or have you forgot? Why did you study so hard? To gain educational knowledge, only to look at policies, parliaments, politician as a foreign place, not to forage. I cycled from Brixton to Parliament with 100 young black poets. We did it with joy on a hot summer's day, just yesterday, in fact. But we want to raise the attention, clean air for the ends, positive action amongst friends. Now to you, are you campaigners, concerned citizens, medics? How can you shout directly to this government about the poison all our children are about to inherit? This is not about growth. Growth! Is that the best storyline we've got? That line can't hold until the next election. Peaceful protest is fast being banned. So sorry, this rebellion must come from you, the respected. What is the diagnosis from those of the Hippocratic persuasion? We said it, we want clean air. What's all this concern for this thing called the economy? Because last time the common folk checked, it was never there. Grow compassion, grow a lung. Grow a heart, grow a brain. A nervous system, sense. The whole 9 yards, a lot. We don't need a climate week. We need toxins out of our air. We're slower than the drinks brand. Look how they're taking alcohol out of the beer. See the trends, we want health. Look at your children. They can't do it by themselves. It's sad to be here, but the situation is grave. For all the summits about climate and health, there's billions for UK nuclear bombs and submarines. So on our watch, we're all getting played. Thank you.
Thank you very much. Thank you very much, Love Sega. And now for the unenviable task of summarizing key takeaways from such an insightful day, please welcome back our co-founder and CEO, Paul van Zyl.
When you follow artists, it's always a bad thing to follow artists because they're cooler and more inspirational than you can ever be. So thank you to both of you and to the two last presentations. I'm going to be very quick because I'm the person who's standing between you and cocktails. Firstly, I wanted to just thank everybody for showing up and for being kind of Ubuntu in action, because it's been an incredible day. The caliber of speakers have been extraordinary, and the conversation and the sidebars that I've managed to be witness to have been remarkable as well. So I'm going to just say 4 or 5 things that I think are reflections from the day at a more sort of systemic level, which I hope will resonate. The first thing I think is that both the climate crisis and the health and the quest to improve public health are large, multi-year, multi-stakeholder, desperately complex, easy to go wrong. So they require a lot of thoughtful, collaborative effort. And it can sometimes feel like, where do you start? How big is this problem? And it can be dispiriting. And so what I thought I would do is try and say, from listening to all of you, what conclusions I've drawn from what it will take for us to make progress on this. And then perhaps what you can do in the back of your minds is say, how much of this have we got? and how much of this do we need to work on? Like, where are we in the plus column and where are we in the minus column? And then obviously you'll take away your own pluses and minuses, and hopefully that's instructive. So the first thing is, I think we need solutions in the climate and health space. And in that one, I am broadly extremely optimistic. I think we have smart people with enormous innovation. If you were to pick any time in human history from a progress and innovation moment, you would choose it now. The policy work that we've done for decades is something that we can build on. I think that on the solutions front, we should be incredibly optimistic. We are broadly, and if we don't have them now, the technology and AI in particular is going to give us a huge leg up in getting there. From genomics on the health front to a paper released just today by Systemic on the impact that you can see from AI and decarbonization, there's loads to be optimistic about. And the one caveat I'll have is, are those solutions ones that we dream up in labs or universities or think tanks, or are they solutions that we co-create by people on the ground most impacted by what we're trying to do? And how deeply connected are we to the beneficiaries of what we're trying to do? And maybe there's some thinking to be done there about the right sorts of relationships between people with power and knowledge and IP. And that, I think, we have some thinking to do about where the solutions come from and who own them. Secondly, capital. If there's one thing that I'm confident about is where there's innovation, capital follows. And we are creating enormous markets. And those markets in the climate space, there are 10 or 12 trillion dollar markets that will be in the space of decarbonization, which will be helpful because private capital will crowd in. I'm certain that the innovation in the health space will also crowd in enormous amounts of private capital. And here I have two caveats. The one is, private capital innovation has been aided historically by the state, by public investment in universities and research for decades and decades. And some of the most important things that we've seen, the internet, have emerged not from some private geniuses sitting in an investment bank, but by a collaboration between the public and the private sectors. And the withdrawal from the role of the state, both at home and abroad, if it were to become a global trend, would be an enormously negative thing. So re-winning the idea that the state has a powerful role to play in innovation and in equity, and it has a business in doing that, is something that I think is very much up for grabs. And we've seen the consequences of that globally, and that is tens of millions of lives, so it's not abstract, and we can see the risks of that occurring domestically. And I think that there are two other points in capital. One is, I think this makes this moment a wildly important moment for philanthropy. Not to try and fill the bucket of what's been drained away by the reduction in aid, because just mathematically that can't be done. But by being a source of innovation, leverage, galvanization, mobilization, philanthropy has an outsized important role to be playing right now. It's to kind of fuel Ubuntu, it's to fill the gap, it's to help us find solutions. And so what Wellcome is doing is exceptionally important, and the rest of the philanthropic sort of infrastructure, I would say, now's your time. Like, this is a really interesting time to be a philanthropist or a foundation. And then finally, I'll say, I think there are some areas, both in climate and in public health, where they're just outright market failures, where the market is not going to respond in the way that it needs to do in order to achieve equity. And in those areas, we're going to have to defend the role of public investment, whether it's in vaccines or whether it's in bridging the gap in the decline in productivity in regen ag. There are areas where there aren't just simple, easy market solutions, and we've just got to make peace with that and not fetishize that every solution, every problem has a market solution. Facts. I think we need to do a much better job in framing the problem, in framing the solution, and a much better job in countering populism. We have been supine in the face of populism for too long. And we have to be more robust in calling out it is ethically and empirically fraudulent. And the fact that people who have bad solutions and tell people lies and they get away with it is our fault. It's on us. Because if we've got better ideas and better solutions, and we're losing the public battle for ideas, then there's something that we need to go and have a deep, long reflection in the mirror about what we do. So communication, narrative, framing, messaging, storytelling, culture, this stuff we need to pay much, much more attention to. And if you permit a digression, what's happening in the immigration front with eliding all evils that are occurring in immigration with a small number of people coming across the channel in meaningless numbers in small boats and ascribing all immigrants to that small, tiny phenomenon is the same thing. What happens with populism is we capitulate to it and we adjust our politics to go in the direction of populists because we think that will inoculate us from populists, and we lose when we stray our narrative into their terrain. And that terrain is the road to hell, because you will never out-demagogue a demagogue. The demagogues will always win. So we have to stay firm in positive, fact-based solutions. We have to call out the lies for what they are, and we have to be more robust about that. And on that one, there's everything to play for. I'm an optimist, but I think we've got hard work to do. And then on leadership, I think that what Mary said to us and what my direct experience in South Africa has shown and what's happening in the United States right now is illustrating is that leadership really, 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 really matters. Because when you're in a world that seems to be fragmenting, populist leaders who prey on our vulnerabilities and exploit these moments are super empowered. And it makes a different kind of leader much, much more important. And in the space of climate and health, speaking out clearly, showing that we're not going to succumb to the siren songs of what's going on, and how we're going to create an ecosystem of leadership is vitally, vitally important. And I would say, if you're going to invest in things, invest in leadership. And start with the young, but produce a set of leaders who are capable of dealing with complexity and moral conundrums and pain without pandering to the lowest common denominator, who are able to cause us to lift up our heads and be more generous and be more kind. And then finally, I'm going to end with Ubuntu, because I think that there are two kinds of it. One is the Ubuntu that occurs at the kind of multilateral level, which is stitching back together all the careful alliances and treaties and frameworks that are necessary to make progress in both climate and health, absolutely essential. And as quickly as they're being torn up, we have to be reconstituting them, because the people who are tearing them up will come to regret it. They'll come to regret it because we all have far more to gain as a planet and a civilization by this web of multilateralism. And we have to find the forces that are defending multilateralism, and we will not make progress in climate or health unless we reaffirm the value of it and we stitch those things back together as hard as we can. And then the bottom-up approach is what's happening in this room. And if there's one thing that gives me hope and optimism and makes me extremely confident about what we can do, it's groups like this getting together and innovating and solving and being generous and helping each other out and supporting each other's startups and helping us think through the breakthroughs that we need, because that will be the DNA of how progress is made. It's here and amongst ourselves. So I think that these fields, if you then do those as your sort of checklist, I think we're about like 60%. And the other 40% we've got if we just get up off our asses and do work. And I think that that's the thing that makes me feel like ultimately really optimistic, is that the parts of it that are to fight for, I would back us to win. So I'm incredibly grateful you came. I'm incredibly grateful to our partners who made this possible. You will not hear the end of us in this space, and we will continue to work. We're very excited by the Resilient Cities conference that we're hosting in December. We want to take the ideas and the innovation and the thoughts and solutions that come from amongst you and drop it into a forum so that it goes out from London to 50 cities around the world so we can scale things well. And now, please get up, go to the 3rd floor, and let's drink and be merry and meet new people. Thank you.
Hello everyone, a very important announcement. The drinks are on 5, they're on the 5th floor, not the 3rd floor.